Section 1 of Makers of Modern Medicine. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Read by SaigeOne. The Makers of Modern Medicine by James Joseph Walsh. The Making of Medicine. Quote, "Without history, a man's soul is purblind, seeing only the things which almost touch his eyes." Fuller, Holy and Profane State, 1641. End quote. Our generation, in this no more self-concentrated than many another, has prided itself so much on the progress it has achieved in science that it has, in its interest in the insistent present, rather neglected the claims of the history of science. There has been the feeling that our contemporaries and immediate predecessors have accomplished so much as to put us far beyond the past and its workers, so that it would seem almost a waste of time to rehearse the crude notions with which they occupied themselves. In no one of the sciences is this truer than in medicine. Yet it seems likely that no more chastening influence on the zeal for the novel in science, which so often has led this generation astray, could possibly be exerted than that which will surely follow from adequate knowledge of scientific history. In medicine, there is no doubt at all that an intimate acquaintance with the work of the great medical men of the past would save many a useless investigation into problems that have already been thoroughly investigated, or at least would help modern workers to begin at a place much farther on in their researches than is often the custom. There are other reasons why the knowledge of the history of medicine cannot but prove of great service to the present generation. We are entering a time when original research as the main business of selected lives, in contradiction to the few hours a day or even a week that the medical practitioners of a few generations ago could steal from their busy lives, is becoming more and more the rule. A consideration, then, of the methods by which advances in medicine were made in the past, of the character of the men to whom we owe the groundbreaking discoveries, of the way in which such discoveries were accepted, or rather rejected, by contemporaries, for rejection was almost the rule, will serve as a mirror for reflections that will surely be helpful in this day of great institutions of research. It must not be forgotten, however, that only too often in the past it is in the large institutions that routine work has been done, while the occasional genius has sprung up in circumstances that seemed quite unlikely to be the fostering mother of originality, and there has taken for the world the precious step into the unknown which represents a new departure in medical science. Professor Osler's declaration that the world's best work was mainly done by young men was not well received, but no one knew better than he that this is the most salient fact in the history of medical progress. There is practically not a single great discovery in medicine that was not made by a young man under 35. As a rule, indeed, the new departures in medicine came from men who were well under 30. Some of them, in fact, only at the beginning of their third decade of life. Morgagni's great germinal idea, which made him the father of modern pathology, came to him when he was a student scarcely more than 20. He then began to take notes on all the morbid appearances that he found in bodies, recognizing very clearly that he must trace out not only the main cause of the disease, but also the subsidiary pathological factors that were at work in the production of the various symptoms of the special case as he had studied it clinically. This idea is so obvious now as to seem impossible to be missed. Yet scarcely a century ago, it constituted the foundation stone of modern pathology. Auenbrugger, who laid the foundation of modern physical diagnosis by his observations upon percussion, began the work when he was under 25 at the Spanish hospital in Vienna, and carried it out to a completely successful issue absolutely without any encouragement from the great masters of the Vienna school. As a matter of fact, they rather pooh-poohed the idea that this foolish drumming, as one of them is said to have termed it, could ever amount to anything in enabling physicians to recognize pathological conditions within the chest. For 25 years after the publication of his little book, Auenbrugger's discovery attracted no attention. Laennec, who followed Auenbrugger in the development of physical diagnosis, set himself the much harder problem of constructing a system of auscultation when he was in his early 20s, studied the subject for 12 years, and then published the book on it when he was as yet scarcely 35. He accomplished the revolution in medicine that is due to him, though he was never strong and died at the early age of 46. These are only striking examples which show what the young man has accomplished. The same thing was true in other countries. Corrigan wrote his famous essay on the permanent patency of the aortic valve when he was only 29 years of age, and the work for it had been done during the preceding 3 years, at a hospital in which there were beds for only 6 medical patients. Trousseau declared this the greatest medical work, from a clinical standpoint, that had ever been accomplished, and hailed young Corrigan as one of the masters of clinical medicine. He maintained that the disease of the aortic valve should receive the name Corrigan's disease. Stokes, Corrigan's contemporary and friend in Dublin, wrote his little book on the stethoscope when he was not yet 21, and at a time when the distinguished clinicians of the day were all asking if these young men expected the old physicians to carry this toy about with them and use it for any serious purpose. Graves, also of the Irish School of Medicine, made some of the clinical observations on which his reputation is founded, including a short description of characteristic cases of the affection that still bears his name when he was well under 35. Further examples might well be cited, but they will be met with in the course of this book. The history of most of the sciences is like medicine in this respect, and it is to young men that the great groundbreaking ideas come. How true this is in biology can be noted even from the lives of the physician biologists that are included in this volume. Theodor Schwann, the father of the cell doctrine, did all the work for which he deserves the name of founder of modern biology when he was scarcely more than 30. Part of the best of it was accomplished before he was 25. Claude Bernard had shown the precious metal of his originality before he was far on in his 20s. Pasteur, the most original genius of them all, began his work when he was scarcely more than a boy, and though every 5 years of a long life was filled with original observations of the most precious kind, his genius had received the bent which it was to follow from the successful accomplishment of observations during his 3rd and 4th decades. In these modern days, when the education of the young man for medicine is not supposed to be finished until he's nearly 30, it is easy to understand that perhaps the precious years in which originality might manifest itself are already past before he gets out of the swaddling clothes of enforced instruction from others. As has been very well said, it is possible to smother whatever of the investigating spirit and original initiative there may be in a young man by attempting to teach him too much of what the present generation knows. Unfortunately, it happens only too often, even in this wise generation of ours, that it is not so much the ignorance of mankind that makes them ridiculous, as the knowing so many things that are not so. The number of things that the young man has to learn, and that are taught him often with the assurance that they are almost gospel truth in medicine, and yet that he finds before he has been long out of school, or indeed sometimes before he leaves school, to be at best opinions, is entirely too great. The saving grace for the correction of this constantly recurring fault in education is undoubtedly a knowledge of the development of medicine in the past and a recognition of the fact that the accepted truth of any one generation proves, after all, often enough to be only apparent. After the false impression that it is to older men we owe progress in medicine, perhaps the most universally accepted, apparent truth is that the investigating spirit is communicable, and that the pupils of a great master may be expected to carry on his work and add almost as much as he has done to the great body of medical knowledge during the generation immediately following his work. It would naturally be expected, for instance, that Morgagni, having laid the foundation of modern pathology and connected pathological observation with clinical observation, the great development in modern diagnosis would have come down in Italy. This was not true, however. The next great step, connecting bedside observations with post-mortem appearances, was made by Auenbrugger in Vienna in distant Austria. Auenbrugger's work having been successfully accomplished, it might reasonably be supposed that he himself, or some of those who had seen his successful diagnosis of thoracic conditions by percussion would take the next step and discover auscultation. This, however, did not happen in Germany, but in France. It is true that Laennec's work was done under the influence of Corvisart, who revived Auenbrugger's work and gave it to the world once more, and that, in a way, therefore, Laennec may be considered an indirect pupil of Auenbrugger. But the fact stands that the two discoveries of percussion and auscultation were made at an interval of nearly 50 years, and at a distance of more than 1,000 miles from each other. On the other hand, Laennec, having solved the wonderful mystery of the significance of the sounds within the chest, as far as they concern pulmonary diseases, might have been expected to do as much also for heart disease. Even genius, however, is able, it seems, to take only one step into the unknown. Auenbrugger did not discover auscultation, though it apparently lay so near at hand. Laennec did not solve the riddle of heart murmurs, though, for most of us, they do not present any more difficulty than the wonderfully successful recognition of the significance of rails of various kinds in which Laennec never failed. The problem of heart diagnosis was to be solved by Corrigan and the Irish School of Medicine hundreds of miles away, though they were doing their work about the same time that Laennec was making his observations in Paris. Curiously enough, just during the same decade, Richard Bright in England was studying out the problem of kidney disease and, as a young man, teaching the world nearly as much about it as it has ever learned, though, in the 75 years that have passed since, so much of investigation has been devoted to the subject. No one nation can claim the palm of superiority in the matter of original investigation. The spirit of genius breathes where it will, and unfortunately, it is incommunicable. Students may think they absorb all that the master has to give them, and that they are ready to go on with his work where he left it. They do actually seem, to their own generation, to make distinct progress in medicine. When the situation is analyzed 50 or 100 years afterward, however, it is found that only the master's work counts, and that much of what seems to be advance was only a skirmishing here and there along the lines laid down by him, but without any material progress for true science. This same peculiarity is manifest also, not only in the history of sciences allied to medicine, but in that of all the physical sciences. A very striking example is to be found in the story of the rise of electrical science, which took place almost at the same period as that which saw the rise of clinical medicine. Origins in electricity date from Franklin's work here in America and Galvani and Volta's observations in Italy. It might quite naturally have been expected that the further progress of electrical science would come in either of these countries. The next great discoveries, however, were separated by long distances and a considerable interval of time. After Volta came the demonstration by Ørsted in Denmark of the identity of magnetism with electricity. It was not in Denmark, however, that the problems connected with this principle were worked out, but by Ampère in France. In the meantime, Cavendish and Faraday, working quite independently of their continental colleagues, were making significant strides in electricity in England. When the problem of the resistance to the passage of electricity in a conductor was to be studied, another nation supplied the man for the opportunity. Ohm had never been in contact with any of these great contemporaries and did his work entirely by himself. It is a curious confirmation of what we have stated with regard to the young man in medicine and the making of great discoveries that practically all these founders in electricity were under 35 when their best original work was accomplished. From a series of biographies of great medical discoverers, certain salient traits stand out so as to attract attention even from the cursory reader. The essence of significant work in medicine consists of observation, not theory. It has always been the custom to theorize much and, unfortunately, to observe but little. Long ago, John Ruskin said that the hardest thing in the world for a man to do is to see something and to tell it simply as he saw it. Certainly, this has been true in medicine. The men who have had eyes and have used them have impressed their names upon the history of progressive scientific advance. The theorists have never contributed anything worthwhile to the body of medical truth. While this is readily acknowledged by every generation, with regard to the past, it is curious to note how different is the appreciation of each generation for the theorist as opposed to the observer. Medical theorists have always been honored by their contemporaries, unless their theories were utterly outlandish. And even then, they have had many disciples and have seldom been without honor, and never, with sorrow for the foolishness of men, be it said, without emolument. The observer, however, has but rarely been in favor with his contemporaries. Not infrequently, the observation that he made appeared to be so obvious that his fellows could not think that it represented a great truth. As a consequence, they have usually derided him for attempting to make them see a significance in his observation that they could not think was there. Huxley once stated the phases through which a new scientific truth ordinarily passes. At first, it is said to be trivial and insignificant. Then, as it attracts more attention, it is declared to be in contradiction with hitherto known truth. Finally, it is declared to be, after all, only in other terms, what the world has always believed in the matter. Certainly, through these stages, all the great discoveries in medicine have gone. So true is this, that if what seems to be a new truth in medicine is accepted at once, and willingly, there is more than a suspicion that it is not really a new discovery, but only a modification of something hitherto well known. All the great discoverers in medicine have practically, without exception, met, if not with opposition, surely with neglect of their work. We smile complacently now at the generation that considered the stethoscope a toy, and asked derisively if they should be expected to carry it about with them. The next generation, however, having grown accustomed to the stethoscope, refused quite as inconsequentially to have anything to do with the thermometer. They refused to carry these glass things around with them in order to test the fever that patients might have, since they claimed they were able to accomplish this purpose quite as well by means of their educated touch. The generation of medical men is not yet past who refuse to credit the thought that the diagnosis of diphtheria would ever be made only by the microscope and culture methods, and who considered that they could tell very well what was diphtheria and what not from the appearance of the throat. Of course, similar opposition was the fate meted out to every distinguished scientific discoverer. And so, I suppose, medical men cannot complain. His contemporaries said of Galvani that he had made himself a dancing master for frogs, because he continued the observations on the legs of these animals in order to solve the problems of animal electricity. Pasteur's demonstration that there was no such thing as spontaneous generation served at first only to bring down on his devoted head the aspersions of most of the distinguished scientific men in Europe. When that genius, the physician Robert Mayer, discovered the conservation of energy as the result of his acute observation, that blood drawn by venesection in the tropics was redder than that drawn in colder climates, he found that scientific circles were not only not ready to accept his demonstration, but that he was looked upon as a visionary, somewhat as one who thought that he had solved the problem of squaring the circle or the endless puzzle of perpetual motion. Fortunately, these men have, as a rule, had a physical and mental force that enabled them to go on in spite of the opposition or derision of their contemporaries. It is rather a curious fact that most of the great medical discoverers were born in the country, and were, as a rule, the sons of rather poor parents. Many of them were so situated that they had to begin to make their own livelihood to some extent, at least at the beginning of their third decade of life. Far from proving a hindrance to their original work, this necessity seems rather to have been one of the sources of inspiration that spurred them on to successful efforts in their investigations. Most of them were what would be called handymen, in the sense that they could use their hands to work out their ideas mechanically. This was typically true of Galvani, who had to construct his own first electrical instruments, and of Laennec, who took pride in making his own stethoscopes. So many of them by his own hands are still extant, that a number of museums have the opportunity to hold specimens of his handiwork. Auenbrugger and Johann Müller and Pasteur are further examples of this same handiness. Claude Bernard exhibited this quality very early in his life and continued to exercise it all during his career. Nor was their ingenuity limited to material things. Many of them were interested in literary and artistic work of various kinds. Morgagni was considered a literary light in his generation. Auenbrugger composed a musical comedy which had a distinct success even in music-loving Vienna. The Empress Maria Theresa said that she supposed he would now continue to write musical comedies. But Auenbrugger replied, with more candor than gallantry, that he had something better to do. Claude Bernard composed a play that shows distinct evidence of literary talent. It seems fortunate indeed that he was diverted from his original intention of following literature as a career and took up medicine. Many of the others, as, for instance, Graves and Stokes, were excellent judges of art, critics of real knowledge and genuine appreciation, and indeed it may be said that none of them was ever so absorbed in his vocation of medicine as not to have much more than a passing interest in some of the great phases of intellectual activity, quite apart from his professional work or from scientific knowledge, an avocation to which he turned for the only true recreation of mind there is, a change of work. This seems all the more worthwhile calling attention to in our strenuous age, because it is sometimes considered a mistake for a physician to show that he is interested in intellectual pursuits of any kind apart from his professional work. It is supposed that no one is capable of dividing his attention in this way, and yet do justice to his profession and his patients. As a matter of fact, it has well been said that no really great physician has ever been a narrow specialist, in the sense that he knew only medicine well. There was always at least one other department of intellectual attainment with which he had made himself so familiar as to be an authority in it. It is not the lopsided who make great athletes, and it is not the one-sided man who succeeds in doing really great work. Practically all the great physicians have had favorite hobbies to which they have turned for relaxation. For surely no one understands better than physicians that recreation consists not in that impossibility, the doing of nothing, but in resting the mind by doing something quite different from what it has been engaged at before. There is another phase of the lives of these great men of medicine that is so different from what is ordinarily thought to be the rule with physicians, that it seems worthwhile emphasizing at the end of this introduction. All these great discoverers have been men of constructive imagination, men who might have been distinguished literateurs, very probably, had they applied themselves in that field. All of them have had too much imagination to be materialists. That is, to consider that they could know nothing except what they learned from the matter with which their studies were taken up. All these great discoverers in medicine have been simple, sincere, faithful believers, ready to express their trust in an overruling providence, and in a hereafter that they knew only by faith, it is true, but which was for that reason none the less distinctly recognized. While it is usually considered that medicine leads men's minds away from orthodox thinking in the great matter of the relationship of the creature to the Creator, all these men have been not only ready to acknowledge their personal obligations to Him, but have furnished exemplary models of what the recognition of such obligations can make of human lives. There is an old proverb that runs, Ubi tres medici, ibi duo atei. Where there are 3 physicians, there are at least 2 atheists. This has made many a heartache for fond mothers when they found their sons had determined on becoming physicians. If the present series of sketches is to be taken as any argument, however, it is only the small minds among physicians who become atheists. They are not able to see their way clearly from the material they work in to the higher things that prove a source of strength and consolation to the great minds while they are busy making medicine for their own and subsequent generations. Certainly no more thoroughly representative group of the makers of 19th century clinical medicine could have been selected than those whose sketches are here given. They are from all the nations who have contributed materially to modern medical advance, yet all of them were deeply religious men. There is another and equally important point with regard to them. It is their relations to their fellows. Without exception, they were men beloved by those around them for their unselfish devotion, not only to science, but also to their brother men. In the midst of their occupations, the thought that has been the profoundest consolation for all of them, without exception, has been that they were accomplishing something by which their fellow men could be saved suffering, and by which human life would be made more happy. A study of their careers cannot fail to show the young physician the ideals he must cherish if he would have real and not apparent success and happiness in life. End section 1.
Section 2 of Makers of Modern Medicine. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Makers of Modern Medicine by James Joseph Walsh. Morgagni, the father of pathology. Let us then blush in this so ample and so wonderful field of nature, where performance still exceeds what is promised. To credit other means traditions only, and thence come uncertain problems to spin out thorny and captious questions. Nature herself must be our adviser, the path she chalks must be our walk, for so while we confer with our own ease, and take our rise from meaner things to higher, we shall at length be received into her closet secrets. Preface to Anatomical Excitations Concerning the Generation of Living Creatures, 1653, William Harvey. Morgagni, the father of pathology. Where ingeny, memory, study incomparable is. Holler. In 1894, when the International Medical Congress met at Rome, Professor Virchow of Berlin, the greatest living pathologist at the time, was asked to deliver the principal address. He chose as his subject John Baptist Morgagni, the distinguished Italian physician and original investigator of the 18th century, whom he hailed as the father of pathology. No medical scientist of the 19th century was in a better position than Virchow to judge who had been the founder of the science for which he himself did so much. Virchow, besides, through long and faithful study of the history of medicine, knew well whereof he spoke. In pathology, especially modern medicine, has made its sure advances, so that Morgagni's groundbreaking work may well be considered the beginning of the most recent epoch in medical science. As a matter of fact, medicine lost much of its obscurity by losing all its vagueness when Morgagni's methods came into general use. As a medical student, scarcely 20 years of age, he revolutionized medical observation by studying his fatal cases with a comparative investigation of their clinical symptoms and the post-mortem findings. This had been done before, but mainly with the idea of finding out the cause of death and the principal reasons for the illness which preceded. Morgagni's investigations in pathology consisted in tracing side by side all the clinical symptoms to their causes as far as that might be possible. This looks so simple now as to be quite obvious, as all great discoveries are both simple and obvious once they have been made. But it takes a genius to make them, since their very nearness causes them to be overlooked by the ordinary observer so prone to seek something strange and different from the common. How much Morgagni's studies from this new viewpoint of the investigation of all the symptoms of disease has meant for modern medicine may be best appreciated by a quotation from an address delivered before the Glasgow Pathological and Clinical Society in 1864 by Professor Gardner, who thus tersely describes the character of the distinguished Italian pathologist's work. In investigating the seats of disease, Morgagni is not content to record the coincidence of a lesion in an organ with the symptoms apparently due to disordered function in that organ. For the first time almost in medical inquiry, he insists on examining every organ as well as the one suspected to be chiefly implicated. Not only so, he marshals with the utmost care from his own experience and that of his predecessors all the instances in which the symptoms have existed apart from the lesion or the lesion apart from the symptoms. He discusses each of these incidents with severe exactness in the interest of truth, and only after an exhaustive investigation will he allow the inference either that the organ referred to is or is not the seat of the disease. And in like manner, in dealing with causes, a group of symptoms may be caused by certain organic changes. It may be even probable that it is so, but according to Morgagni's method, we must first inquire into all the lesions of organs which occur in connection with such symptoms. In the second place, we must know if such lesions ever occur without the symptoms, and again, if such symptoms can be attributed in any cases to other causes in the absence of such lesions. During over 60 years of a long life, Morgagni continued to follow out the idea that he had developed as a boy, and his works contain the first definite account of pathological lesions and clinical manifestations that attracted attention. As a proof of the striking difference between the value of observation and theory in medicine, it may be said that many hundreds of volumes containing the most elaborate medical theories were published during the 18th century, and that practically none of these is ever read now, except for curiosity's sake by some seeker after the quaint and distant in medicine, while Morgagni's books still contain a precious fund of information to which pathologists at least, and not a few clinicians, turn often with interest and come away always with profit. They are not infrequently quoted from, and as we shall see, have been highly appreciated by some of the best medical authorities of the present and the immediately preceding generations. To the modern thinker, accustomed to look rather to the northern nations or to France for great advances in science, It may prove somewhat of a surprise to have an Italian thus put forward as the founder of modern medicine and especially of the most scientific department of it. Those who are familiar with the history of medicine since the revival of civilization after the Dark Ages will realize what a prominent place Italy has always held in the development of medical science. The first great Christian medical school was founded at Salerno, not far from Naples, in the 10th century. The first regular practical teaching of anatomy by means of dissections of human bodies and demonstrations on the cadaver was done at Bologna by Mondino at the beginning of the 14th century. The great father of modern anatomy, Vesalius, was a Belgian, but he did all the work for his epoch making book, the De Fabrica Humani Corporis, at the universities of North Italy, especially at Padua, Bologna, and Pisa, during the first half of the 16th century. Every student of medicine in those times who was desirous to secure wider opportunities for medical education went down into Italy, and on the rosters of the Italian medical schools of the 16th century are to be found the names of most of the men who, in all the countries of Europe, became famous for their medical attainments. Morgagni only forms a final link in the chain of great Italian medical scientists connecting medieval with modern medicine. From the time of Vesalius to that of Morgagni, there was never a period when Italy did not possess the leading medical investigator of Europe. We need only mention such names as those of Fallopius, who added so much to our knowledge of abdominal anatomy, Eustachius, to whom we owe many important details of the anatomy of the head, Spigelius, whose name is forever associated with the liver, and Malpighi, to whom the whole round of the biological sciences, allied most closely to medicine, owes more than perhaps to any other single investigator to show the complete justification for this claim. As a matter of fact, every encouragement to the progress of medicine was extended both by the secular and the ecclesiastical authorities in Italy during these centuries, and the Italian peninsula was from the beginning of the 16th to the end of the 18th centuries the Mecca for ardent medical students desirous of exhausting the medical knowledge of their time, quite as Germany has been in our day. John Baptist Morgagni was born on February 25, 1682. His birthplace was Forli in Romagna. It was the capital of a little papal state lying at the foot of the Apennines to the southeast of Bologna. The modern American traveler is likely to know something about it because it is one of the principal stopping places on the road from Bologna to Rimini, for at least the feminine portion of any traveling party will want to make a pilgrimage to the home of Dante's poor Francesca and to the scene of the heroic exploits of Caterina Sforza, the great woman of the Renaissance, to whom in all honor and without any tinge of the discredit it has since come to convey, was given the proud title of the Virago of Forli. The little town is noted for the beauty of its situation and well deserves a visit for itself, for it contains a famous palace built after designs made by Michelangelo. The town had decreased in importance and population at the end of the 17th century when Morgagni was born there, but it was favorably known for the high standard of cultivation among its inhabitants, possessed a good library, a number of schools, and a well known college. Like many other great men, Morgagni seems to have been especially fortunate in his mother. He was left an orphan at a very early age. His mother, however, whose maiden name was Maria Tornielli, not only bore her loss bravely but devoted her life and talents to the education of her gifted son. She seems to have been a woman of uncommon good sense and remarkable understanding. Morgagni often spoke of her during the course of his life and attributed much of his success to the training he had received from her. It is the custom sometimes to think that women have come to exert great cultural influence only in these latter days. Nothing could be more untrue. All through history are abundant traces of women exerting the highest intellectual influences in their own sphere, and the North Italians in their era of highest cultural development seem to have been happier in nothing more than their recognition of the possibilities that lay in providing educational facilities for women. These times and this part of Italy are famous in history for some of the opportunities afforded women in the matter of higher education. It has been suggested that it is perhaps to the liberal culture of the mothers we owe the fact that this part of Italy furnished for 150 years about this time the greatest men in science of the time. It is well known that women occasionally held professorships at the University of Bologna, not far from Morgani's birthplace. The general culture of the women of this section was very high. Modern masculine historians have even been ungenerous enough to point out that Bologna was famous for two things: the opportunities provided for the higher education of women and the extensive manufacture of various forms of prepared food, the best known of which, the classical Bologna sausage, has come down as a precious heritage to hurried housekeepers in our own time. After an excellent preliminary education at Forlì, always under the careful supervision and enlightened encouragement of his mother, Morgagni, as might have been expected from the place of his birth, went to the neighboring university town of Bologna for his higher studies. Bologna was at this time at the very acme of its reputation as the greatest of existent medical schools. The science of anatomy had been especially developed here as the result of important investigations and discoveries made by some of the greatest men in the history of medical science. Mondino had, very early in the 14th century, recreated the modern science of anatomy as we know it. He was the first to realize the importance and urge the necessity for the dissection of human bodies if any real lasting progress in human anatomy was to be made. Medical teaching before this time had been largely by lectures and disputations upon the work of Aristotle, Hippocrates, and Galen, but actual observation on human tissues and organs now replaced the older method. Bologna became a papal city in 1512, and it is especially after this date that, under the fostering care of the popes, the University of Bologna became the center of medical teaching for the whole world for several centuries. As the result of actual observation and patient study, instead of idle theorizing, there came a large number of great discoveries in anatomy. From Mondino to Morgagni, there is a continuous series of great men in connection with the University of Bologna, such as no other institution can show. About midway between the first and last came the great Vesalius, who taught at Bologna as well as at Padua and Pisa, and whose work on anatomy was to be a treasure for anatomists of all countries for many generations. It was while teaching at Bologna that Vesalius made the famous series of dissections which formed the subjects of the illustrations for his great work on anatomy. Titian, the celebrated Venetian artist, who had come down from Venice in order to study anatomy for artistic purposes at the famous School of Anatomy and under the supervision of its great teachers, is said to have executed the plates for the book. The work remains a worthy monument of the two great masters in their respective professions whose collaboration created it. During the century before Morgagni's entrance into the University of Bologna, the distinguished English physician Harvey, who was to lay the foundation of modern physiology by the discovery of the circulation of the blood, was attracted to Bologna because of the opportunities it presented for advanced work in the studies in which he was so much interested. While repeating some of the dissecting work that Vesalius had done, Harvey was led to suspect the existence of the circulation and had his thoughts directed in the channel which finally led to his masterly exposition of the subject. In a word, here at Bologna, the study of the physical side of life, so important a characteristic of latter day science, became a distinct and recognized branch of science. As Professor Benjamin Ward Richardson said in his sketch of the life of Morgagni, since that time there has been no decline in interest in these studies, and medicine has been developed in a manner as daring in project as it has been useful in application. Bologna was, at the time, certainly an excellent place for Morgagni. He went there as an inquiring youth of 15 and began his medical studies at once. He became a student of two of the most celebrated professors of the time, Albertini, a leader in his day, though since more or less forgotten, and Valsalva, whose investigations into the anatomy of the ear assure him a permanent place in the science of anatomy for all time. When Morgagni went to the university, Valsalva was at the zenith of his brilliant career as an anatomist. He was in the midst of his great work on the organ of hearing. This extremely intricate piece of human mechanism had never been understood before his time, and the working out of its details proved a time taking but intensely interesting investigation. It was not long before the genial insight of Valsalva picked out Morgagni as a person excellently fitted to assist him in his dissecting work. Morgagni had not only an enthusiasm for the work, but had, what is much more precious under the circumstances, untiring patience and industry and unsparing perseverance. These were the qualities that were afterward to prove the foundation of his reputation. His genius consisted certainly in the faculty for hard work, and his special talent was an infinite capacity for taking pains. Nearly all of the dissections which Valsalva required for his demonstrations during lecture hours or for the illustrations of his books are said to have been made by Morgagni under the master's personal supervision. After 4 years of this precious training and study at the university, Morgagni took his degree as Doctor of Medicine and of Philosophy. The late Benjamin Ward Richardson, one of the great English medical men of the end of the 19th century, says that this is a happy combination of qualifications which might, with great advantage, be required of the graduate in the present day, when so much of medicine and so little of philosophy is demanded of the student to the manifest detriment of both departments of knowledge. Some idea of the estimation in which Morgagni was held at this time may be gathered from the fact that though scarcely more than 21 years of age, he was sometimes allowed to assume Valsalva's lecture obligations during the master's absence. After graduation, he spent some time at the university doing special work in connection with the science of anatomy, in which he was so much interested, and as an assistant professor and tutor. Bologna at this time enjoyed as wide a European reputation as at any period of its history. Students from all countries in Europe flocked here, especially to make their legal and medical studies. Among the medical students, Morgagni was always a moving spirit, a leader in the phases of thought in many lines that were occupying students' minds at the time. He was the founder and director of a society of young professors and maturer students whose object was the discussion of scientific subjects of many kinds. The standard of the new society was personal investigation and observation as a means of arriving at scientific truth. The principal maxim that guided their discussions seems to have been that nothing was to be accepted on authority merely because it was authority. In the physical sciences, thought had been frequently cramped to fit the old theories inherited from Galen and Pliny and Aristotle and Hippocrates. A quotation from one of these classic authors on a point at issue was supposed to throw light on any difficulty that might be the subject of discussion. Morgani's society was called the Academia Inquietorum, the Academy of the Restless. The idea of the curious name being that the members were not satisfied to rest peacefully in the knowledge to be gleaned from the older authors, but preferred to get at science for themselves by direct observation and planned experiment. Morgani's idea in founding the society seems to have been premature. The fate of the Academy of the Restless is involved in some obscurity, but biographers seem to hint that it failed of its purpose. Neither the university nor the times were yet ready for such freedom of thought as this. Even in our own day, such a scheme would be considered radical and chimerical. The discouragement met with finally led to the abandonment of the meetings, and Morgagni gave up his attempt to inspire others with his own industry and enthusiasm for original investigation in the physical sciences. For some years after this, he seems to have been absent from Bologna. His time was spent especially at the medical schools of the great universities of Pisa and of Padua. Students who wish to make some special branch of medicine, such as physiology or anatomy or the then as yet scarcely known science of pathology, their prime object in life, had to visit various universities in order to find opportunity and suggestion for study. Morgagni devoted himself so faithfully to his work that his eyesight failed him for a time and very probably his general health also. For some years, he returned to his native town to recuperate. Here he took up the active practice of medicine. As so often happens, this period of rest after years of study proved especially broadening in its influence upon Morgagni. After his rest, his contemporaries began to realize his great possibilities as a scientist. End of section 2. Section 3 of Makers of Modern Medicine. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Read by Prajakta. Makers of Modern Medicine by James Joseph Walsh. Morgagni, Father of Pathology, Part 2. His first publication was a series of notes on anatomy. These were published in the form of collected essays with the title Adversaria Anatomica. The title has a pugnacious sound, but Morgagni did not indulge in controversy, and Adversaria is only the Latin name for notebooks. The first articles thus collected were really communications made by Morgagni to the Academy of the Restless during his presidency of that body. This opened his career as a writer, and it is interesting to note that his last book was to be published some 63 years later, a period of vacant authorship almost unprecedented. As the result of the reputation gained by this work, he was offered a teaching position at the University of and later was transferred to the chair of the second professorship of anatomy. After a few years, he succeeded to the first professorship of anatomy at the university, at that time the most important post in the medical school. This gave him, at the age of about 35, one of the greatest university professorships in the world. Opportunities for research were now amply provided. He was in a position where his communications would be received with due attention and his reputation was secure. A university professorship in those days was a position of more importance than even in our own, and Morgagni was especially favored in the fact that it had come early in life so as to enable him to round out his career. His work was eminently congenial to him, and the labor it involved was that which constituted for Morgagni the highest form of recreation. He made many friends among professors and students. The lectures which Morgagni delivered to the university became so popular that his lecture room was overcrowded and new quarters had to be provided. Many foreign students were attracted to the university by his widespread reputation as a great and suggestive teacher. These students came in great numbers, especially from the northern countries of Europe. At one time, there were over 1,000 German students at the University of Padua, and when they organized into a guild for mutual help and social purposes, Morgagni was chosen by them to act as their patron. Here at the University of Padua, Morgagni was to found the new science of pathological anatomy. Normal anatomy had received its development at the hands of the other great masters in the schools of North Italy. To Morgagni was to be given to describe the changes which take place in organs as the result of disease. Needless to say, this is the most important practical branch of modern medical science. The symptoms of disease mean very little unless we know just what organs are affected and what changes have taken place. Morgagni's work on the seeds and causes of disease contains the foundation of modern pathology. Modern advances might seem to put it out of date, but the acuity of its author's observations and the truth of his investigations make it an enduring classic. Of this work of Morgagni's, Professor Benjamin Ward Richardson said, "To this day, no medical scholar can help being delighted and instructed by the study of this wonderful book. To move into it from the midst of a body of current medical literature is like passing from the periodical flux of current general literature to the pursuit of a Shakespearean drama, The Pilgrim's Progress or Paradise Lost. It is a transition from the mediocrity of incessant repetition of well-known truths told in long and hackneyed terms back to descriptions derived direct from nature and fresh from her treasury. It matters not where the book is opened, it is always good and instructive reading, full of suggestion and rich in original narrative." Some of Morgagni's work in clinical medicine and in pathology, as detailed in these volumes, remains of perennial interest and is often referred to. Many an after-time discovery proclaimed loudly by its author will be found at times only in embryo but often enough in entirety in its pages. There are frequent surprises to the reader in the anticipation of what are supposedly much later thoughts in medicine. Some of these passages of more general interest I venture to present here. It was Morgagni who first realized that minute connections between parts of the nervous system might very easily provide the basis for symptoms quite distant from the site of actual disease. He gives, for instance, a detailed account of a curiously interesting case in which the patient, a man somewhat beyond middle life, was annoyed on a number of occasions by violent sneezing. These attacks of sneezing became more and more frequent and finally were accompanied by difficulty of breathing and a sense of pressure over the chest. These symptoms became more and more marked until finally, during an especially violent attack of sneezing, the man suddenly died. Up to this time, anatomists generally had declared that there was no direct nervous connection between the mucous membrane of the nose and the diaphragm. Sneezing is due to a violent contraction of the diaphragm and is almost invariably caused by the presence of an irritant in the nose. This is, in fact, nature's method of getting rid of irritant material on the sensitive nasal mucous membranes by an explosive expulsion of air through the nose. This expulsion of air is brought about by a convulsive contraction of the diaphragm. It had always been supposed that the sneezing was due to irritation transmitted through the brain to the diaphragm. Morgagni, in discussing the reason why the diaphragm should be excited into sympathetic reaction by the presence of an irritant in the nose, pointed out a fact that had been forgotten or the significance of which had not been appreciated. The membrane of the nose concerned in smell is supplied by the first pair of cranial nerves, the so-called olfactory nerves. Between this olfactory nerve and the nerve which supplies the diaphragm, the phrenic nerve, which is a cervical and not a cranial nerve, that is to say, comes from the central nervous system through the spinal cord in the neck and not directly from the brain, the older anatomists declare there was no connection. Morgagni pointed out that the mucous membrane of the nose is partly supplied also from the fifth pair of cranial nerves. From the fifth nerve, small branches of connection with the cervical nerves, as low even as the intercostal nerves, had been traced by Meckel. This shows the possibility of a nervous reflex, that is, of a communication of nerve impulses without the necessity for the intervention of the central nervous system. This was the first direct tracing of distant reflex nervous action in human physiology. The problem of nervous reflexes was to remain obscure for more than a century later until light was thrown upon it by the investigation of the French physiologist Claude Bernard. Here, however, was the pregnant suggestion of the explanation of the seeming mystery. In subsequent cases, Morgagni looked for the confirmation of his theory in this matter and found it. He pointed out that there was a relationship between the abdominal viscera and the olfactory mucous membrane of the nose. In one of his cases, an epileptic seizure was always accompanied by a sense of discomfort in the upper abdominal region and a fetid odor. This odor was entirely subjective, that is, though extremely annoying to the patient, it could not be noticed by anyone else, even though the patient was close at hand and exhaled his breath at the moment of the observation. This would seem to point to the fact that Morgagni suspected there were other connections between the spatial senses and important organs besides those which had been discovered by anatomists up to that time. As a matter of fact, does place all the organs of spatial sense in direct connection with the other important organs of the body. Morgagni's suspicions were to be confirmed by the discoveries made in this sympathetic system during the succeeding century. Morgagni, first of all, seems to have realized what was the mechanism by which alcohol injures the human system. He pointed out that the excitation of the heart due to the action of alcohol was reflected in an overdistension of the arteries. This overdistension gradually led to degenerations in the arterial walls. The loss of elasticity thus induced brought on a disturbance of the circulation in the important organs of the body and so gave rise to symptoms of widespread interference with organic functions. Morgagni's studies in aneurysm, that is, in the dilatation of blood vessels, show how thoroughly he understood the mechanism of the formation of this serious pathological condition. He pointed out that the first noticeable disease change that occurs a degeneration of the inner coat of the artery. This leads to the formation of furrows on the inner wall of the vessels and finally brings on weakness of the middle coat of the artery. He realized that the progress of these arterial changes is due to a large extent to blood pressure within the arteries. He felt too that blood pressure could be kept from being dangerously high by strict attention to diet limitation. If aneurysms are discovered in early stages, the patient's life may well be prolonged by these simple measures. This idea contains the germ of the Tufnell treatment, which has been the most successful therapeutic measure for the treatment of aneurysm in the 19th century. The Italian anatomist's acumen led him to appreciate better than ever before in medical history the influence of the mind on the circulation. He pointed out that emotions have a powerful influence on the circulatory system in all its parts. How much the peripheral blood vessels are affected can be seen in the tendency to blushing during certain forms of excitement involving shame or embarrassment. On the contrary, pallor in anger or indignation or fright. He pointed out too that the heart is affected by such emotions and is sometimes strenuously excited and sometimes very much retarded. Morgagni understood that the influence of such emotions in especially excitable individuals leads to wear and tear on the blood vessels and so to a shortening of lives. He thought of some aneurysms, even those affecting the large blood vessels, might be caused by sudden intense emotions and especially by violent efforts to suppress or conceal emotions. We know now, however, that these pathological conditions are due to human passions but quite other than those which Morgagni had in mind. It is interesting to note that comparative pathology, that is, the study of the diseases of animals as illustrating corresponding conditions in human beings, had already attracted the attention of the Bolognese School of Medicine. Albertini, who had been a professor of Morgagni's, pointed out that aneurysms are rarely found in animals because brutes were not subject to emotions as are human beings. Morgagni made still further observations in this line to confirm his own conclusions in the matter. For a time in his earlier life, he devoted himself to the study of fishes because they seem to promise to throw light on certain problems in human anatomy and pathology. How closely he studied pathological changes in tissues can be gathered from the fact that his observations led him to point out that aneurysm of the aorta occurs most frequently at that part of the curvature of the aorta against which blood is constantly projected by the heart. The realization of the importance of this mechanical factor in the production of aneurysm is one of the first successful results of carefully applied observation and knowledge of physical laws in the causation of changes in the tissues as opposed to elaborate theories with very little foundation in fact. Variations in the pulse attracted his attention, and he was among the first to point out that the occurrence of flatulency is liable to cause disturbance of the heart's action and to bring on noticeable cardiac palpitation in the absence of any organic affection of the heart itself. Morgagni also pointed out that intermittence of the pulse may be due to nervous conditions. He showed that severe mental shock or trying emotions may cause irregularity of the heart's action and pulse intermittency. Some of his observations in this matter show an intuition with regard to the nerve supply of the heart that is quite beyond the anatomy of his time and seems to indicate that he suspected the existence and function of the sympathetic system and also the existence of a special nerve supply to the small arteries. Perhaps Morgagni's most penetrating evidence of insight in pathology and its relations to clinical medicine is with regard to tuberculosis. Over a century and a half ago, he insisted on its contagiousness. He refused to make autopsies on patients who had died of tuberculosis, and his position in the matter was undoubtedly of the greatest service in directing the attention of his contemporaries and especially those closely in contact with him to the important question of intimate association with tuberculous patients as a potent factor in the acquirement of the disease, more potent even than heredity, which then occupied all men's minds on this subject. It might be deemed that this advanced position of Morgagni was due rather to intuitive abhorrence of the disease than to the conviction of actual observation, and that his conclusions were the result more of prejudice than of real knowledge. Any such opinion, however, is absolutely contradicted by the fact that he knew and understood better than anyone of his generation the pathology of consumption. He pointed out at a time when any chronic affection of the lungs was liable to be considered consumption that there are a number of forms of chronic bronchitis that are not due to phthisis pulmonalis but to other slow running conditions within the lungs. He anticipated very completely the present position of surgery with regard to the treatment of cancer. He advised the operative removal of these malignant tumors whenever possible. As Benjamin Ward Richardson points out, this advice was given evidently not with the idea that the disease could be always thus completely cured, but because early operation gave speediest relief of annoying symptoms and assured the greatest prolongation of life. Many other methods of removal of cancerous growths were suggested in Morgagni's time, as in our own, and many false promises made and false hopes raised by their advocates. He pointed out that the quickest, the safest, the surest, and in the end, for the patient, the easiest method of removal is by the knife in the hands of the bold and skillful surgeon. After a century and a half of vauntedly great advance, especially in surgery, we are practically in the same position as when Morgagni's advice was penned, and his opinion remains practically as valuable today as then. In another important point of medicine, Morgagni seems to have anticipated the opinion of our own time. It was the custom to practice venesection very freely. On one or two occasions in his own lifetime, Morgagni fell ill and venesection was recommended. His biographer says that he constantly refused this method of treatment, adding very newly, and he who had often cured others by venesection would never allow this remedy to be used upon himself because, as I believe, he had a natural abhorrence to it. It was an index of thoroughgoing independence of thought in those days to stand out, even for personal reasons, against the overwhelming tradition in favor of bloodletting. But Morgagni had well-grounded doubts as to the remedial efficacy of abstraction of blood and at least avoided it in his own case. Besides his skill in practical and theoretic medicine, Morgagni was a man of cultivated taste in art, and he was conversant not only with the literature of his own language but also of French, Latin, and Greek. He was always welcomed in the library circles of the cities of northern Italy and counted among his friends many of the great writers of the time. His success in winning the friendship of rulers was especially noteworthy and had not a little influence for the advantage of education and science. The patricians of Venice were proud to consider him as a personal friend, and to the Venetian Senate he owed his professorship at Padua. The King of Sardinia, Emmanuel III, looked upon him as an intimate acquaintance. All the popes, five in number, of the second half of his life were on terms of personal intimacy with him, and his advice was asked on many important questions with regard to educational matters in his own day. Some of these popes are among the most influential pontiffs that ever occupied the Roman See. The great Benedict XIV, himself a native of Bologna and an intimate friend of the scientist, in his classic work De Beatification Servorum Dei, mentions Morgagni in terms of special commendation. His scarcely less famous successor, Clement XIII, had often consulted Morgagni professionally at Padua before his elevation to the See of Rome. After his election as Pope, he assures Morgagni of his continued esteem and friendship and asks him to consider the Vatican always open to him on his visits to Rome. In an extant letter, Clement praises his wisdom, his culture, his courtesy, his charity to God and men, and holds him up as an example to others, since with all his good qualities he had not aroused the enmity or envy of those around him. Morgagni's life must have been in many ways ideally happy. Rewards for his scientific success began early in life, even before his professorship, and continued all during his long career. The Royal Society of England elected him a Fellow in 1724. The Academy of Sciences of Paris made him a member in 1731. In 1735, the Imperial Academy of St. Petersburg conferred a like honor upon him. In 1754, the Academy of Berlin elected him to honorary membership. His English biographer, Dr. William Cook, says quaintly that all the learned and great who came into his neighborhood did not depart without a visit to Morgagni. He was in correspondence with most of the great men of his time, and the terms of intimate relationship that this correspondence reveals are the best evidence of the estimation in which Morgagni was held, especially by the prominent scientists of his time. Among them were such men as Walsh, Boerhaave, Sir Richard Mead, Haller, and Meckel. This wide acquaintanceship of itself was a great distinction at a time when the means of communication were so much more limited than at present. It is gratifying to think that Morgagni must have been enviably content in his private life, though, as usually happens when this is the case, very little is said explicitly on this subject. His untiring labor deserved the compensation of a loving domestic circle. During his retirement at Forlì, after his graduation from the university, and when from overwork his health failed him for a time, he married the descendant of a noble family of the town, Paola Vergeri by name, a companion for him who, biographers declare, could not have been surpassed in judgment or in affection. They had a family of 15 children, 8 of whom survived their father, though he lived to the ripe age of 87 years. There were three sons, one of whom died in childhood, another became a Jesuit and taught in the famous Jesuit school at Bologna, whose magnificent building has now become the municipal museum, the Accademia delle Belle Arti. The third followed his father's profession, married and settled in Bologna, but died before his father, who assumed the care of his grandchildren. All Morgagni's daughters who grew up to womanhood, 8 in number, became nuns in various religious orders. The spirit of science had not disturbed the development of a homely, simple faith in the family. The great father of pathology, far from being disturbed by the unselfish self sacrifice of so many of his children, bore it not only with equanimity but even rejoiced at it. His relations to his children were ever most tender. After the separation of the Jesuits, his son, who had been a member of the order, worked at science with his father at the University of Bologna and not without distinction. The estimation in which Morgagni was held by his contemporaries can be judged from the fact that twice when invading armies had entered the Emilia and laid siege to Bologna, their commanders, as in old Greek history, did the Grecian generals with regard to Pindar and Archimedes, gave strict orders that special care was to be taken that no harm come to Morgagni and that his work was not to be hampered. Having lived his long life amidst the reverent respect of all who knew him, he died full of day and honors. Succeeding generations have not been backward in acknowledging Morgagni's merits. I have already spoken of Virchow's tribute to his greatness. The Italians have long considered him as one of their most brilliant names in medicine. One of the best known of the representative Italian medical journals is Il Morgagni, published at Milan. To its pages, the foreigner seeking to know the progress of Italian medicine turns almost as the first resort. Il Morgagni was founded some 50 years ago and continues to uphold its reputation as one of the world known medical periodicals. The great medical scientist, whose work was to prove the foundation of modern pathology and thus be the source of more blessings to mankind than ever even he dreamed of, remained in the midst of the reverence and gratitude of his generation, one of those beautifully simple characters whom all the world delights to honor. As a teacher, he was the idol of his students. No great scientist who came to Italy felt that his journey had been quite complete unless he had had the privilege of an interview with Morgagni. This friend of popes and of many of the European rulers was the happy father of a houseful of members of religious orders and considered himself blessed that so many of them had chosen the better part. He was himself all during his long life the ardent seeker after truth who did well the work that came to his hand and followed his conscience in sincere simplicity of heart and reaped his personal reward in the peace that is beyond understanding to those who have not the gift of faith to appreciate the things that are beyond the domain of sense. End of section 3.
Section 4 of Makers of Modern Medicine. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Read by Grass. Makers of Modern Medicine by James Joseph Walsh. Auenbrugger, Inventor of Percussion, Part 1. While medicine is your vocation or calling, see to it that you have also an avocation, some intellectual pastime which may serve to keep you in touch with the world of art, of science, or of letters. Begin at once the cultivation of some interest other than the purely professional, The difficulty is in a selection, and the choice will be different according to your tastes and training. Osler, Equanimitas, and other addresses. At the present time, the most interesting development in medicine is the gradual reduction of the death rate from tuberculosis. This is entirely due to the fact that the disease can now be recognized very early in its course, and that, as a consequence, the treatment may be begun before serious damage has been inflicted on the lungs. Under the circumstances, the death formerly supposed incurable has become, according to all the best modern authorities, one of the most tractable of infectious diseases. In their recent lectures in Philadelphia before the Phipps Institute for the Prevention and Cure of Consumption, such distinguished medical authorities as Dr. True of Saranac, Professor Osler of Johns Hopkins, and Professor G. Sims Woodhead of Cambridge, England, insist on the absolute curability of tuberculosis when it is taken in time. Professor Woodhead particularly asserts that there has been entirely too much pessimism in this matter, even amongst physicians. This present confidence with regard to the successful treatment of pulmonary consumption is due to the fact that the diagnosis can be made early. The glory of this early recognition depends entirely on two men, Auenbrugger of Vienna and Laennec of Paris. To Auenbrugger, whose work was done nearly half a century before that of Laennec, must be given the credit of having first approached the problem of differentiating diseases of the lungs from one another by methods which were so objectively practical that every practitioner of medicine could, after having become expert in their employment, use them with absolute confidence in his diagnosis. Modern medical science and practice acknowledges very gratefully its deep obligations to what is known as the Vienna School of Medicine. It is not a little surprising to find that it was the practical side of medicine particularly which was developed at Vienna, since the inhabitants of the Austrian capital, while supposed to have artistic tastes far above the average, are usually considered to be among the most impractical people in Europe. For over 150 years, however, the medical department of the University of Vienna has always ranked among the first in the world. Many of these Viennese professors of medicine have been acknowledged as the greatest teachers of their time. Beginning with Van Swieten and De Haan during the second half of the 18th century, the medical department of the University of Vienna has scarcely ever been without at least one of the leading lights of medicine in Europe. Wunderlich, Rokitansky, and Skada were, in the middle of the 19th century, the greatest medical men of their time. Hebra, Billroth, and Nothnagel worthily continue the tradition of medical greatness in the Austrian capital. Even at the present time, notwithstanding the great advance in medicine and medical teaching that has come over all Europe, it is generally conceded that the best place in the world to study clinical medicine, that is, to study illness at the bedside of the patient, is the famous Allgemeines Krankenhaus, the General Hospital of Vienna. The clinical teaching of medicine developed much later in the history of medical education than might naturally have expected. There is a tradition of bedside instruction in medicine in old Grecian times at the various shrines of Aesculapius, but this is not well authenticated. Early in the 16th century came the modern birth of clinical medicine instruction at St. Francis's Hospital in Padua, in connection with the university there, which in every line did so much for modern medicine. The first clinic that attracted widespread attention, however, did not come until Boerhaave's time, at the end of the 17th and the beginning of the 18th century. The bedside instruction in medicine by this distinguished master drew hosts of students to the hitherto comparatively unimportant University of Leiden in Holland. Two rulers, just the two who, to modern minds, would perhaps appear least likely to do so, at once recognized the immense practical value of this innovation in medical teaching and immediately set about securing its benefits for their people. Pope Benedict XIII and Empress of Austria put themselves in communication with Boerhaave, and the Pope was the first to avail himself of the advice in the matter which the great Dutch master gave. The Roman clinic became in the first half of the 18th century, under the direction of the distinguished Lensis, one of the best known in Europe. The Austrian Empress Maria Theresa, interested in everything that could prove to be for the benefit of her people, invited the distinguished pupil of Boerhaave van Swieten to become her family physician, and encouraged him in the foundation of a clinical medical school at Vienna. Van Swieten soon came to occupy a very prominent place at court. When he was invited from Holland on recommendation of the sister of the Empress, there was no heir for the Austrian crown, though one had been anxiously looked for several years. Heirs to the number of 16 in all blessed the imperial family in the next 25 years, and Van Swieten became the confidential adviser of the reigning monarchs in polity as well as in medicine. Accordingly, when he suggested the invitation of De Haan, who had also been a pupil of Boerhaave, the suggestion was promptly accepted, and the Leiden colleagues became the founders of the Old Vienna School of Medicine, as it is called. They established the tradition of bedside teaching, of actual practical experience in the treatment of patients, and of the collection of detailed information of every feature of cases that could possibly be helpful for diagnosis. They also established the custom of demonstrations on a pathological material with confrontation of the diagnostic conclusions during life and the findings of the post-mortem examination in fatal cases, which, down to our own day, makes Vienna an ideal place for serious postgraduate work in clinical medicine. It was not long after the establishment of the clinic on these broad lines at Vienna before the first important fruit of the new teaching method was to be gathered. Curiously enough, however, this initial advance in practical medicine did not come from one of the distinguished heads of the clinic, but from a comparatively young man of no previous reputation. The greatest discovery ever made at Vienna is due to Auenbrugger, an unassuming practitioner of medicine, who came from the Austrian province of Styria, or, as it is called in German, the Steiermark, about the middle of the 18th century. He was the son of a small hotel keep of Graz, and after making his medical studies in Vienna, he remained at the capital for some years, doing hospital work. While thus engaged, the young Syrian, who attracted very little attention except for his affability, and who made no pretension of special knowledge or genius in observation, laid the first stone in the structure of modern exact diagnosis of pulmonary disease, and cleared up many of the obscurities in which all affections of the chest had been shrouded before his time. Having accomplished this noteworthy achievement before he was 40 years of age, Auenbrugger then quietly settled down to be an ordinary medical practitioner in the Austrian capital, with a special reputation for his knowledge of chest diseases, and for kindly ways that gave him as much interest in his poor patients as in those that could afford to pay handsomely for his services. Leopold Auenbrugger, afterward Elder von Auenbrugger, a term about equivalent to the English Knight of Auenbrugg, who thus stands at the head of modern medical diagnosis, was born on the 19th of November, 1722, at Graz in Lower Austria. His early education was received at Graz, and it seems to have been of rather a comprehensive character for Auenbrugger. Later in life was a member of the elegant literary circles in Vienna and a welcome friend at tables of cultured and distinguished fellow townsmen. It will be recalled by those who remember German literature that at this time Vienna was the center of culture in Germany, attracting many literary men, as for instance the two Schlegels, from other parts of Germany. Auenbrugger's father was of the lower middle class, the proprietor of the Gasthaus Schwarzenmachen in one of the suburbs of the city of Graz, but also the owner of another hotel in the city itself, so that he was able, by making some sacrifices, to afford his son a university and a medical education in Vienna. The city were not in very affluent circumstances, however, and in this Auenbrugger was in the same condition as many other of the distinguished medical men who have made important original discoveries. Volta, Laennec, Johann Müller, Helmholtz, Pasteur, and Virchow were all the sons of comparatively poor parents, and had to eke out their university education by doing teaching work as soon as they were considered capable. Auenbrugger's studies in medicine were pursued under the well-known Baron van Swieten. Van Swieten was, as has been said, one of the most distinguished of Boerhaave's pupils, and devoted most of his life to writing a set of commentaries on Boerhaave's aphorisms and editing his master's work. Van Sweeten's greatest ambition was to make the Austrian capital the home of the great clinical school of medicine, and a pilgrimage at least as attractive as physicians seeking to study practical medicine at the bedside as had been his own alma mater at Leyden. He was of so great administrative ability that Mayor Theresa made him one of her own state councillors. With all the influence of the government behind him, then, it is not so surprising that Van Swieten succeeded in his very laudable project of establishing a great medical school at Vienna. It was fortunate that Auenbrugger made his medical studies under such good auspices. We have no details of his student life nor of his success in his examinations. Even as a student his engagement of marriage to Marianna von Priesterberg was announced. The formal marriage ceremony took place in 1754, when Auenbrugger was about 32 years of age. His wife seemed to have had a dowry, and this enabled Auenbrugger to begin his medical career in Vienna. Some years before this, as a young graduate physician, he had accepted the position of resident medical attendant at the Spanish military hospital of the Holy Trinity in Vienna. This hospital was large and important and provided manifold opportunities for clinical study. Its wards were frequently drawn on by the clinical department of the University of Vienna for cases to be demonstrated before the students. This fact was sufficient to make Auenbrugger's position of great educative value for him. Mistakes in diagnosis would be apt to be discovered, since the interesting cases were reviewed by some of the best physicians of the time in Europe. His position carried with it no salary beyond his maintenance, but provided well worth the time he gave it, since it developed in him habits of careful investigation. Just 10 years after he began his work at this hospital, he published a little book called Inventium Novum, or New Discovery, on which his reputation depends. It was written in Latin, and its full title ran, A New Discovery that enables the physician from the percussion of the human thorax to detect the diseases hidden within the chest. Although his little manual probably does not contain much more than 10,000 words, it is perhaps 2 or 3 times as long as thousands of medical articles published every year in our modern medical journals. It contains, however, one of the most important discoveries in the whole history of medicine. One of the best diagnosticians of the 19th century, Skoda, the distinguished head of the Vienna School of 60 years ago, called the discovery that Auenbrugger outlined so unpretentiously the beginning of modern diagnosis, and hailed Auenbrugger himself as the founder of the new science of diagnosis that was to prove so fruitful of good in the prevention of human suffering. It is interesting to compare Auenbrugger's little book with Van Sweeten's commentaries on Boerhaave's works, which were published in some 8 huge volumes. Van Sweeten's successor, De Haan, an equally illustrious contemporary of Auenbrugger, published about the same time some 18 volumes on the science of medicine. Neither of these works is ever consulted now, except by some enthusiastic student of the history of medicine who wishes to clear up a point in medical historical development. But Auenbrugger's unpretending monograph is and will ever remain a classic. Practically nothing has been needed to complete the clinical usefulness of his discovery. Like Laennec, whose work was done just half a century later, he had the genius to realize what the possibilities and the limitations of his discovery are, and he completed it in all its details before giving it to the public. Auenbrugger's discovery consisted in recognizing that diseases of the chest can be distinguished from one another and their varying character differentiated by the sounds elicited when the chest is tapped with the finger. To this tapping he gave the technical name, since become classic in medicine, of percussion. Wherever there is air in the chest, that is all over the healthy lungs, the sound elicited by percussion resembles that given out by a drum over which a thick woolen cloth has been placed. Over the heart, where there is no air, the sound given out when the chest is percussed corresponds very nearly to the sound produced when the thigh is tapped. The sound elicited by percussion of the thigh Auenbrugger took as the standard of dullness, and applied to it the term Scheneckelton, or thigh sound. When the lungs become consolidated because of an inflammatory process such as pneumonia or tuberculosis, then the percussion note over the consolidated area resembles the sound over the leg or that found over the heart. As a rule, the heart is somewhat covered by the lungs, and the sound produced by percussion over it is not quite as dull as that over the solid muscular structures of the legs. Whenever fluids finds its ways into the thorax, as in pleurisy, then the sound produced on percussion is very dull. Auenbrugger further showed that by means of the sound thus obtained he could demonstrate the size of the heart under varying conditions, and so determine whether it is larger than normal or not. This gave the first inkling as to the discernment of hypertrophy and dilation of the heart, and was the first step in the modern differential diagnosis of heart diseases. He showed, moreover, that he could, by percussion, outline very exactly the extent to which a consolidation of the lung has taken place, or the height to which an effusion into the pleural cavity reaches. These conclusions and demonstrations require not only the greatest care, but the most deliberate confirmation of every detail by comparison of the diagnosis during life with the condition found after death in fatal cases. Auenbrugger seems to have spared neither time nor labor in this work of confirmation. He made a number of experiments upon dead bodies, injecting fluid into the pleural cavity, and then demonstrating by percussion the line of demarcation that indicated the level of fluid within the chest, as well as the pulmonary conditions that develop because of its presence. In the study of pneumonia and tuberculosis particularly, Auenbrugger spent many hours of patient investigation during his 10 years of hospital service, but also the existence of cavities in the lungs and their size and general character. End of section 4.
Section 5 of Makers of Modern Medicine. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information, or to volunteer, please visit LibriVox.org. Read by Jonathon Kirk. Makers of Modern Medicine by James Joseph Walsh. Auenbrugger, Inventor of Percussion, Part 2. Vienna was an ideal place for the development of Auenbrugger's ideas of confirmation. At this time, it must have been one of the most unhealthy places in Europe as regards pulmonary diseases. The city was surrounded by walls that occupied the ground now taken up by the magnificent Ringstrasse, and the inhabitants were packed into extremely narrow quarters. The modern municipal sanitary conscience is lax enough in our own day, but at that time it had not been awakened to the slightest sense of duty toward the citizens. Narrow, wandering streets, lined by high buildings that made an attaché of the British legation of Vienna, speak of the houses of the city, scarcely more than 50 years ago, as well-like were the universal rule. It must be remembered that the present magnificent Austrian capital, containing perhaps the handsomest single street and some of the finest buildings in the world, is entirely a creation of the last half-century. The old city had every cause to be unsanitary. Situated in the valley of the Danube, liable in the springtime to serious floodings from the capricious mighty river, which has been brought under control only in recent years at great expense. In an exposed situation, which makes it a veritable temple of the winds during the autumn and winter. It is not surprising that tuberculosis should have been very frequent. Even with all its improvements in recent years, sanitary, hygienic, municipal, and domiciliary, Vienna has at the present time one of the highest death rates from tuberculosis in Europe. In Auenbrugger's time, there must have been practically unlimited opportunity for the study of pulmonary diseases of all kinds. How well the brilliant young medical observer took advantage of the opportunities thus afforded him can be judged very well from the passages of his book that refer to chronic pulmonary diseases. He divides the chronic diseases of the thorax, in which abnormal percussion sounds are heard, into two classes. In the first place, he places those in which the thoracic organs are rendered less capable of resisting disease and become actually affected because of insidious influences, such as hereditary conditions, depressing circumstances, poverty, and poor nutrition. Without really calling it tuberculosis, it is evident that in this group pulmonary consumption is included. The second class consists of affections in which the thoracic organs become diseased from definite, easily recognizable causes. Such are disturbances of the general health and pulmonary affections that follow thoracic disease not completely recovered from. By these diseases, Auenbrugger evidently intends cases of pneumonia or other affections of the lungs or trauma and the like, which are followed by tuberculous processes. With regard to cavities in the lungs, Auenbrugger was able not only to demonstrate their presence and to show by autopsy records that his localization and determination of their approximate form and size were correct, but he also understood the method of their formation and explains the reasons for certain varieties of cavities that occur. He speaks of two classes of cavity formations. From one kind, there is an Icarus discharge. From the other variety, the evacuations are purulent. Cavities with non-purulent secretions are situated only in the lung. Abscesses of various kinds, that is, cavities with purulent secretions, may occur in any part, or in any of the organs of the thorax. The lung cavities are usually due to the breaking down of what he calls crude tubercles. Both kinds of cavities may either be closed or have an opening into the bronchi. Auenbrugger showed very well how to distinguish by percussion cavities of various kinds, and set it down as a principle that before the evacuation of the contents of the cavity, percussion over it gave a distinctly dull note, resembling that obtained when the thigh is percussed, while after evacuation, as by copious expectoration, a distinctly resonant note occurred. It is clear from his discussion of the symptoms noted in cavities, at least in the opinion of Dr. Murbach, who wrote a sketch of Auenbrugger's life for the Jahresbericht der Gesellschaft für Natur und Heilkunde in Dresden in 1861, that Auenbrugger was very near the discovery of auscultation in his study of pulmonary cavities. Auenbrugger says that when a cavity has been located by means of percussion, if the hand be laid over the place beneath which it lies, and the patient is asked to cough, the fremitus produced by the pus in the cavity can be felt as it moves under the coughing impulse. This is what we now know as palpitation. If instead of using his hand, Auenbrugger had applied his ear to the chest, auscultation would have been discovered nearly half a century before Laennec began his work upon the subject. Perhaps Murbach, who was himself a native of Styria and a professor at the University of Graz, was for patriotic motives more ready than others might be to give Auenbrugger credit for practically discovering auscultation. Auenbrugger's and Laennec's observations were made on exactly the same sort of clinical material. They were both studying advanced cases of tuberculosis in the hospitals of a great city. Laennec's work was actually not anticipated in the slightest degree, however. How Auenbrugger could have made the careful examinations of the chest that he did in thoracic diseases, without acquiring some knowledge of the value of the further application of the sense of hearing, which Laennec was to employ so fruitfully in the diagnosis of affections of the lungs and heart, seems to us almost impossible to understand. Discoveries once made, however, always seem so obvious that the wonder is they were not made long before. It takes genius to cross the line into the realm of the hitherto unknown, and the contemporary generation usually occupies itself mainly with making little of the new discovery. Even genius very rarely makes more than one original observation in a lifetime, and it would be too much to expect more from Auenbrugger. The preface to Auenbrugger's little book is a model of concise directness, typical of the man and his ways. As the modest introduction to a work that will ever be a classic in medicine, it seems to deserve a place here. I present to you, kind reader, a new sign for the detection of diseases of the chest, which I have discovered. It consists in the percussion of the human thorax, and the determination of the internal condition of this cavity by the varying resonance of the sounds thus produced. My discoveries in this subject are not committed to paper because of an itch for writing, nor an inordinate desire for theorizing. 7 years of observation have put the subject in order, and have clarified it for myself, and now I feel that it should be published. I foresee very well that I shall encounter no little opposition to my views, and I put my invention before the public with that anticipation. I realize, however, that envy and blame, and even hatred and calumny, have never failed to come to men who have illuminated art or science by discoveries, or have added to their perfection. I expect to have to submit to this danger myself, but I think that no one will be able to call any of my observations to account. I have written only what I have myself learned by personal observation over and over again, and what my senses have taught me during long hours of toil. I have never permitted myself to add or subtract anything from my observations because of the seductions of preconceived theory. I would not wish, however, that anyone should think that this method of diagnosis, which I suggest, has been developed to its utmost perfection. I confess with all candor that there are defects in the system, which conscientious observation will, I hope, amend with time. It is possible that there are even other important truths for the recognition of disease still hidden from this method of diagnosis. Some of these may prove of great usefulness for the differentiation, prognosis, and cure of diseases of the chest. This was the reason why, in my personal experience, after I had succeeded in finding the signs in the chest and proceeded further to the investigation of their causes, so far as my own observation could help me, I have always afterward had recourse to the commentaries of the illustrious Baron Van Swieten, since I have considered that whatever can be desired by an observant man is sure to be found in his work. I have thus been able to spare you a long disquisition. I have found in his work a sure basis of knowledge on which my slight superstructure may be raised up to view. I do not doubt, however, that I have accomplished a work which will earn the gratitude of all true devotees of the art of medicine, since I have succeeded in making clear certain things which shed not a little light on our knowledge of the obscure diseases of the chest, a subject hitherto very imperfectly understood. I have omitted many things that seem doubtful, because they are as yet not sufficiently elaborated. I shall endeavor, however, faithfully to devote myself to, literally to sweat over, the further development of these points. Finally, it has not been my effort to write in any elegant diction. I have chosen a style in which I may be thoroughly understood. Vale, December 31st, 1760. Auenbrugger's own realization of the importance of his work and of its significant value for medicine kept him faithfully investigating his chosen subject, though he seems to have met with very little encouragement from members of the medical profession near him. It is extremely difficult to understand how his practical observations and thoroughly conservative claim failed to attract more attention than they did from really great physicians, who were deeply interested in the progress of medicine. At least two distinguished writers on medicine, Van Swieten and De Haan, compiled treatises on medical subjects that included the consideration of diseases of the chest within a few years after Auenbrugger's Inventum Novum appeared. And yet, neither of them devotes any space to the question of percussion, nor hints at its possible value. Van Swieten's work consisted of commentaries upon the aphorisms of Boerhaave. The Vienna professor did not, however, limit himself to the consideration of the aphorisms alone, but made his work also a compendium of his own clinical experiences with acute and chronic diseases. As a matter of fact, his commentaries on the aphorisms are each a monograph on some special disease. The last two volumes of this commentary appear after the publication of Auenbrugger's book on percussion, one volume being published in 1772, the other in 1774. The first of these articles contains a long article on pulmonary consumption, and the other an almost equally long chapter on pleurisy with effusion. In neither of the volumes, however, is there any mention of percussion, or of Auenbrugger's work, though if Van Swieten had given any serious attention to the subject, he must have become convinced how valuable Auenbrugger's invention was in the diagnosis of these conditions. This omission is all the more surprising, as Auenbrugger was a pupil of Van Swieten's and practically dedicated his inventum novum to his master. He mentions Van Swieten's work several times in his little book. Auenbrugger's investigations were not unknown to Van Swieten then, and the only conclusion to be drawn from his neglect to mention Auenbrugger's methods is that he deliberately omitted reference to them because of his failure to recognize the value of the discovery. This constitutes one of the most serious blots on Van Swieten's medical career. He was succeeded as the head of the clinic in Vienna by de Haan, who also came from Leyden and brought with him the methods of Boerhaave's clinical school. As the time during which Auenbrugger was making his valuable observations at the Spanish military hospital coincides with the years when de Haan was professor of clinical medicine, and when he was frequently indebted to his colleague of the Spanish hospital for his cases for demonstration, it is impossible to conceive that Auenbrugger or his work should have remained unknown to the distinguished head of the clinic. There is not a single mention, however, to be found anywhere in de Haan's voluminous writings of Auenbrugger or his work. De Haan's principal work is his Ratio Medendi, System of Medicine, published at Vienna during the years from 1757 to 1779. It consists of 18 volumes, in which all the important forms of disease, as well as the rarer types of affections that came to the clinic, are thoroughly discussed. De Haan treated of pneumonia, of consumption, of pleurisy with effusion, which he calls dropsy of the chest, but never suggests the use of percussion. On the contrary, he complains in a number of places how very obscure and difficult of diagnosis are thoracic diseases, and especially dropsy of the chest, pleuritic, and pericardial exudates, and insists on the ease with which errors of diagnosis may be made in these subjects. He failed completely to recognize how much light had just been thrown on this subject by Auenbrugger's work, and how much easier the differential diagnosis of these conditions were to be as the result of systematic percussion. Some of the commentaries on Auenbrugger's work are not entirely depreciative, however. In Ludwig's Commentaria de Rebus in Scientia Naturali, a Medicina Gesti, for the year 1762, published at Leipzig, there is an excellent notice of Auenbrugger's work within a year after its appearance. It is not known who the reviewer was, but he calls Auenbrugger's discovery a torch that was designed to illumine the darkness in which the diseases of the thorax had up to this time lain concealed. A brilliant future was prophesied for the new method of examination. It is evident that the writer not only thoroughly comprehended Auenbrugger's work, but had himself applied the percussion method for purposes of diagnosis. This is almost the only favorable and reasonably intelligent review of Auenbrugger's work to be found in the medical journals of the time. In the new medical library issued by Rudolf Vogel, professor of medicine in Göttingen, published in 6 volumes in 1766, there is a short mention of Auenbrugger's book and his new discovery. This reference is, however, an extremely curious affair. The good professor completely failed to understand in what the new discovery really consists. It is clear that he had never read Auenbrugger's book. He seems to have heard of the subject from some medical friend, and to have obtained an entirely wrong notion. He talks of Auenbrugger's new diagnostic method as if it were an imitation of Hippocrates' succussion method of recognizing the presence of fluid in the chest by shaking the patient till the liquid gave the characteristic splash. Other medical writers of the time, perhaps as the result of reading Professor Vogel's book, made the same mistake in their appreciation of Auenbrugger's work. Vogel himself insisted that Auenbrugger did wrong to claim any originality for his invention, since it had been used so long before by Hippocrates. He adds that what is original with Auenbrugger is of very little value, the older ideas being the only ones worthwhile considering with regard to the application of this so-called new method of diagnosis. Vogel was an authority in medicine at the time, and other commentators took the keynote from him in this matter, and in many parts of Germany it was generally accepted that Auenbrugger's method of percussion was only an elaborated method of the so-called succussion of Hippocrates. Under these circumstances, it is perhaps not surprising that Auenbrugger's work attracted very little attention in the German-speaking countries. In Vienna itself, as we have already said, Van Swieten and de Haan failed utterly to recognize its value. Outside of Vienna, their example was naturally followed, for the Vienna school was considered authoritative, and surely, if anyone, the professors of the University of Vienna might be expected to know whether Auenbrugger's new discovery was really of any value or not. It is interesting to compare Auenbrugger's state of mind with regard to the neglect of his discovery with Laennec's remark in the preface of his book. Laennec said, "For our generation is not inquisitive as to what is being accomplished by its own sons. Claims of new discoveries made by contemporaries are apt for the most part to be met by smiles and mocking remarks. It is always easier to condemn than to test by actual experience." Auenbrugger seems to have suffered from more than the neglect of which Laennec complains. When he speaks of envy and calumny in no uncertain terms, the only conclusion possible is that his representations as to his discoveries must have been set down as pretensions that his contemporaries considered unjustified by what they knew of his work. It is interesting also to note that both men found their prospects of reward not in the good will of their contemporaries, nor even the prospect of fame, but in the hope that their work would be useful in lessening the sum of human suffering. Laennec said, "It suffices for me if I can only feel sure that this method will commend itself to a few worthy and learned men who will make it of use to many patients. I shall consider it ample, yea, more than sufficient reward for my labor, if it should prove the means by which a single human being is snatched from untimely death." Laennec's words are almost an echo 50 years afterward of Auenbrugger's expressions, just quoted. "I console myself," he said, "with the thought that I have accomplished a work which will earn the gratitude of all true devotees of the art of medicine, since I have succeeded in making clear many things which shed not a little light on the chapter of the obscure diseases of the chest, in which our knowledge has hitherto been so very incomplete." As a rule, it may be said that the medical observers whose genius leads them to step across the narrow line that separates the known from the unknown are likely to lack the appreciation of their own generation. Long before Auenbrugger or Laennec, Harvey, the discoverer of the circulation of the blood, said to friends that he did not expect any one of his generation to accept the new doctrine, and it is well known that the great medical men of the time did not accept it. Harvey is not an isolated example, and even in our own time, real medical progress sometimes waits for years for recognition, while well-advertised pretended advances are occupying the center of the stage. Auenbrugger's discovery made its impress, however, and was never entirely lost to sight. Even before his death, there was the consoling prospect of its meeting with adequate attention. De Haan's successor in Vienna, Maximilian Stahl, treated Auenbrugger's work very differently from his predecessors, and was the first to introduce it practically into clinical medical training. Stahl did not hesitate in his clinic, on the strength of what was discovered by means of percussion, to attempt the evacuation of fluid from the pleural cavity on a number of occasions. It can be easily understood that with their lack of knowledge of the necessity for thorough cleanliness in the surgical sense, such an operation might readily be followed by discouragingly fatal results. This actually happened in Stahl's own experience. He does not, however, seem to have abandoned his practice of tapping the chest because of this. He insisted to his students that Auenbrugger, more than anyone else, had experience in removing fluid, and especially purulent collections from the chest, and he recommended the practice to them. He added that medicine owed as much to Auenbrugger for his rational method of treating effusions into the pleural cavity, whether of pus or serum, as for his diagnostic sign by which the presence of the fluid could surely be recognized. Some of Stahl's pupils took up the work of commending Auenbrugger's method, and a little book written by one of them, IRL, came into the hands of the distinguished French physician Corvisart. IRL did not hesitate to say, in his treatise on empyema, that the practice of percussion of the thorax, a diagnostic method introduced by the very distinguished Vienna physician Auenbrugger, had been of great help to them in the study of this disease. Once the great French professor of medicine, Corvisart, took it up, the new method of diagnosis was destined to have an immediate and worldwide vogue. Corvisart was not only a power in medicine because of his faculty of observation and his thorough appreciation of the work of others, but he was the court physician of the first Napoleon, and this gave any ideas that he favored many advantageous chances for publicity. Napoleon's well-known faculty for selecting men for special positions whose genius was calculated to be of service to him was never less at fault than when he violated most of the court medical traditions in Paris and chose Corvisart for the imperial physician. Corvisart's selection was the result of Napoleon's appreciation of his new method of diagnosis, namely that of percussion in chest diseases. The emperor himself was suffering from a persistent cold, and was told that Corvisart, instead of following the traditional method of feeling the pulse, looking very wisely at the tongue, and then gazing learnedly into space, conducted an actual examination of the chest, and sounded it carefully all over, in order to determine where abnormal conditions might exist. This struck Napoleon as a very practical and possibly valuable feature of diagnosis. Accordingly, Corvisart was summoned to give his professional opinion. After the consultation, he was made the emperor's private physician. End of section 5.
Section 6 of Makers of Modern Medicine. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Read by chrishavel. Makers of Modern Medicine by James Joseph Walsh. Auenbrugger, Inventor of Percussion, Part 3. When Corvisart took up the subject of percussion of the chest, it was practically unknown in Europe outside of Vienna. Even in the city of its origin, as we have seen, it was not well appreciated. Auenbrugger's little book had fallen into oblivion. Corvisart obtained his hint as to the possible value of percussion from Stoll's and Irel's appreciative remarks with regard to it. The Frenchman used the method to some extent and, realizing its value, resolved to call the attention of his countrymen and the medical world to this very helpful aid in diagnosis. It was at this time that he came upon Auenbrugger's original monograph. Instead, then, of writing himself on the subject, he translated Auenbrugger's little book into French and made a commentary on it. Corvisart was Laennec's patron in medicine, his favorite teacher, and the man to whom the great French physician owed much of his early inspiration. It is no little merit in Corvisart's career, thus, to have been the connecting link between the men who did most for the practical science of medicine, and especially for the important but obscure chapter of diseases of the chest. He did not attempt at all to claim for himself any of the merit that he felt should rightfully go to Auenbrugger, and while his own observations and writings established percussion upon a firm basis and extended its knowledge, he shares the immortality of his discoverer, and comes down to us in medical history as an example of the reward of having rendered faithfully what was due, where it was due. It has been the custom to praise Corvisart for his justice toward Auenbrugger. Mere justice seems scarcely a worthy reason for praise of a great man, yet the history of medicine is so full of failures on the part of subsequent observers to acknowledge priority of discovery that perhaps the praise does not seem quite as futile as it otherwise would. It is not surprising, then, that Corvisar's pupil Laennec should have appreciated very thoroughly the value of Auenbrugger's discovery. In the preface of his book on mediate auscultation, Laennec bewails the fact that men are generally neglectful of discoveries made in their own time and fail to give them the attention they deserve. He attributes this neglect rather to the well-known carelessness of men than to any deliberate failure to recognize the merit of contemporary work. He says, "Lack of attention is an extremely common failing of all men. What it takes years and hard labor to acquire is not infrequently passed over without notice." Auenbrugger's method, published some 50 years ago, though capable of being learned in a few days and without difficulty, and of being put into practice without the use of any instruments, although snatched from oblivion by my illustrious preceptor, Professor Corvisar, and made clearer than it had been left even by the author himself, is not as yet in ordinary use among physicians. Even the wonderful invention of the illustrious Jenner, though received with so much praise, and with regard to whose efficaciousness numberless confirmatory observations have been made, is already somewhat less prominent in the minds of men than it should be, or at least it would be, only for the fact that the governments of many countries, provinces, and cities, the foresight of the clergy, of the authorities of all kinds, and the advice of the best physicians have exerted all their influence to keep it at public expense constantly in practice. After about 10 years of service at the Spanish military hospital, Auenbrugger resigned his position there and took up private practice. In this he was eminently successful, being, as might be expected, especially in demand for cases involving affections of the thorax. His practice appears to have been, to a great extent, among the better class of people, but he seems never to have neglected the poorer patients, whom he had come to know during his hospital experience. There are traditions in Vienna of his unfailing willingness to assist the poor, and even to put himself to considerable inconvenience in order to be of service to them. Tradition tells us that he was very conscientious in the pursuit of his vocation as a physician, and among the family relics there is preserved a small lantern which he kept always by his bedside to light him on his visits to the sick when called out at night. It must not be forgotten that city streets were not regularly lighted at the end of the 18th century, and night calls, even in city work, must have been a source of great annoyance and discomfort. There is a family tradition, too, that the night bell at his house was connected directly with Auenbrugger's room, so that the others of the household might not be disturbed when night callers came for him. Every tradition points to him as a man among men, in his unselfish readiness to save others trouble, and do all the good in his power. Auenbrugger was, according to well-grounded traditions, especially admirable in his relations toward other members of the medical profession. This may not seem a very significant sign of amiability to those outside the profession, but it is well recognized that even great physicians have not always been known to get on well with brother practitioners. Auenbrugger has, besides, the pleasant reputation of having been of great material assistance to a number of needy medical students during the time of their university careers, and to have frequently lent a helping hand to young practitioners in the city, who probably found it quite as discouraging beginning practice in those days as any of their young confreres of this generation find it at the present time. To physicians and medical students when ill, Auenbrugger was almost unceasing in attention. 2 or 3 physicians of the generation immediately after his attributed to his unselfish care and devotion to them their recovery from what would otherwise have been mortal illnesses. In this way, Auenbrugger seems to have been a man whom everyone who came to know him, even slightly, learned to love and respect. His relations to his family and relatives were always of the most happy, kind character, and family traditions show that his fatherly care was befittingly returned to him in his old age. The number of his friends was very great, and he counted among them some of the most distinguished inhabitants of the Austrian capital. Notwithstanding his devotion to his practice, Auenbrugger did not cease to make observations that occasionally he considered worthy of being committed to paper. He was especially careful in the study of his cases, and left fully written records of over 400 important cases that he had studied very faithfully. His attention seems to have been attracted particularly to certain mental diseases. This work was done half a century before even the first beginnings of the modern classifications of mental diseases were attempted. He wrote a short article with regard to mania and its treatment, and a longer article on melancholia. How well he recognized the essential feature of this latter affection and the main symptom that must be guarded against can be gathered very well from the title of his paper, which he called The Still Madness, or the Impulse to Self-Murder. It is about the time that he was engaged in the study of melancholia, perhaps as a contrast to sadder things, that he wrote a comic opera, of which we will have more to say presently. His description of the conditions that he saw during an epidemic of dysentery that occurred in Vienna show how exact and careful a clinical observer he could be, and that the demands of his practice did not absorb all his attention to the detriment of his faculty for observation. He seems himself to have suffered from a severe attack of typhus fever which raged epidemically in Vienna in 1798. Auenbrugger had a wide circle of interests beyond the subject of medicine. There is a family tradition that he had a magnificent library. He seems, with true Viennese spirit, to have been a great devotee of the opera, and to have had an especial liking for music. He wrote the text, score, and libretto of a comic opera with the title The Chimney Sweep. This operetta evidently enjoyed more than a succès d'estime, and further writing in this line was confidently expected from him by his friends. There is even a story to the effect that the Empress Maria Theresa, of whom he was an intimate friend, and who made use, it is said, of his counsel in political matters more than once, asked him why he did not follow up his first success in operatic writing. His blunt reply shows how intimate must have been his relations with the great Empress. He said he had things much better with which to occupy himself than the writing of comic operas. Seeing that he was so favored at court, it is not surprising to find the family tradition that Auenbrugger was associated with many of the most prominent persons in the Austrian capital during his lifetime. He was a special friend of, and spent a great deal of time with, the famous philosopher Werner. As he grew older, he delighted especially in music, and spent many hours at the house of Baron Zois, where many of the distinguished European musicians were to be found, and where famous matinee concerts were given every Sunday from 12 to 2. The day and the time may seem strange to foreigners, but Vienna still has concerts at this time on Sunday, and after the Viennese have gone to Mass in the morning, they think that they could not occupy themselves better than with listening to good music in the middle of the day. Toward the end of his life, Auenbrugger lived during the summertime in the suburb of Rossau, and cultivated a little garden, taking the greatest pleasure in spending his time at this simple occupation. It is a source of satisfaction to find that though Auenbrugger's medical work failed during his life to attract the attention it deserved, he had as reward for his patient investigations in earlier life, in a peaceful and contented ending to a career that had been so worthy of what was best in the man. He lived to celebrate his golden wedding in 1804, and was especially happy in the almost constant companionship of the good wife who had proved so faithful a helpmate during her long life. After her death, which took place the year following the celebration of their jubilee, his vitality and his contentment with life seemed to abandon him. He was a changed man, and kept himself for the most part to his room. He went to bed very early, and did not care to see anyone but his near relatives. His last illness was the result of a cold, and his advanced age, 87, left him little resistive vitality. He retained his consciousness until the very end, and said the day before his death that the next day would be his last. Shortly before noon of the day of his death, he looked at the clock in his room and said that when the hands would point to 2 o'clock, he would be no more. His prophecy came true. Vienna has never had the reputation of honoring its great geniuses during their lifetime, unless they happened to belong to the higher nobility. The exclusiveness of court society at the capital made itself felt in all circles, and the consequence was that genius sprung from the lower orders was almost sure not to receive its due share of attention. The comparative neglect of Auenbrugger does not seem so bad when we recall the case of Mozart. Music has always been one of the special fads of the Austrian, and the Viennese pride themselves on their appreciation of it. Mozart, however, perhaps the greatest musical genius that ever lived, received some attention during his life, but passed away almost unnoticed at the early age of 35, was buried in a common trench with the poor people of the city, and now Vienna cannot find his resting place. There is a magnificent monument to him, but his bones lie with his own people forever. Outside the circle of his personal friends, Auenbrugger did not receive much attention, so that even the year of his death was until recently more or less uncertain, and the resting place of his remains continues to be unknown. The present generation of medical men has done more to afford the due meed of praise to Auenbrugger than any preceding generation. The interest in tuberculosis particularly has led medical men to appreciate all the significance of Auenbrugger's work, and the practical importance of his discovery for the early recognition and consequently for the cure of the disease. The appreciation of Auenbrugger in our time has been so flattering as quite to make up for previous neglect. His name has been linked with that of Laennec as the great discoverers of physical diagnosis in chest diseases. At the opening of his address as president of the American Climatological Association some 5 years ago, Dr. Edward O. Otis of Boston said, "It is quite improbable, I think, that we should be here today, or indeed have an existence as a society largely devoted to the consideration of diseases of the chest, were it not for the methods of thoracic examination which Auenbrugger and Laennec have given us in their discoveries of percussion and auscultation. Without these two precious methods of investigation, we could scarcely have arrived at any degree of precision or certainty in thoracic pathology, and might have been not unlike the old physicians and surgeons, who would swear, as Morgagni says, that there was fluid in the chest, when in reality there was not a single dram, or perform paracentesis of the thorax upon a duke for an empyema which did not exist." His tribute is only an echo of many others, not less appreciative of Auenbrugger's important original work than have been expressed by modern medical men of all nations. The simple old German practitioner, who had the annoyance of seeing his discovery neglected by his contemporaries for so many years, has at last come into his own. There is scarcely an important medical meeting held anywhere in the world in which diseases of the chest are discussed without a mention of Auenbrugger's name. This is not surprising in Germany, but it is quite as true of France and England and America. As Dr. Otis said in closing the address from which we have just quoted, "Although we possess but meager and fragmentary records of Auenbrugger's life, there is yet enough to enable us to fill in the lines and gain a distinct idea of his personality and character. With some persons one does not need to be acquainted with much of the detail of their lives in order to know what manner of men they are. A few characteristic illustrations here and there in their career redeem the spirit and motives of their lives, and show the kind of men, just as they are, quite as well and clearly as an extended and continuous biographical narrative. Always enthusiastically devoted to the study of disease, Auenbrugger escaped the not infrequent misfortune of the student, a loss of sympathy with one's kind. His love for his fellow men, for suffering humanity, for struggling students in his own profession, kept pace with his love for medical study. He never sacrificed the man for the scientist, nor did he lose his interest for other things in life, as happens sometimes with men intensely devoted to one pursuit. A man of original powers, as someone has truly remarked, can never be confined within the limits of a single field of activity. He was interested in music, philosophy, and the drama, and well illustrates what Dr. da Costa has so happily styled the scholar in medicine, with dignity, sympathy, enthusiasm in his profession, even to the last, ever seeking to improve and add to his art, modest like most great men, never refusing to give what is best to suffering humanity, he richly lived out his long life. As we teach our students percussion as a matter of just recognition and due honor, let us tell them something of the life of the discoverer, and at least his name, which I fear but few who avail themselves of the result of his long and arduous labors know. Auenbrugger's German biographer, Professor Klar of Graz, says of his early life that from his parents he received an excellent early training, especially edifying because of the exemplary Christian family life he saw about him, the piety of his father and mother, and of the other members of the family. The baptismal register of the parish church at Graz is one of the important documents in his life history, for there is some dispute as to the exact date of his birth, as there is also with regard to his death. In 1798, he suffered from a severe attack of typhus fever, which at the time was epidemic in Vienna, and some of his biographers report his death in this year as a consequence of it. His descendants, however, have shown by the burial register of the parish church in Vienna that his death did not take place until May 17, 1807. From this church, of which he had been for half a century a faithful member, he was buried. Few of the lives of the great discoverers in medicine have in them more of encouragement for the busy practitioner of medicine than that of Auenbrugger. He began his medical career by a series of practical observations that stamped him for all time as one of the great geniuses. When his discoveries failed to meet with the acceptance they deserved, he was not disturbed, and, above all, he did not insist on acrid controversy. He took up the practice of medicine, and demonstrated how much his discovery could help in the diagnosis of the obscure chapter of the diseases of the chest. In the meantime, he went on his way, placidly doing the good that he found to do, taking care of his poor patients, and faithfully tending brother physicians who happened to be ill. He found an avocation to fill the moments spent apart from his vocation, and added to the pleasure of humanity by his work in music. All the time, he remained a simple, faithful believer in the relation of providence to man, and considered that somehow the inexplicable things of this life would find an explanation in the hereafter. He was probably the best liked member of the profession in Vienna during his lifetime, and the profession of his native town are very proud to recall the example that he sets physicians generally in all the ethical qualities that make a physician's life not only successful in the material sense, but also in inspiration for those around him to do their duty rather than seek the fulfillment of merely selfish aims. End of section 6. Section 7 of Makers of Modern Medicine. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Read by chrishavel. Makers of Modern Medicine by James Joseph Walsh. Jenner, Discoverer of Vaccination, Part 1. Edward Jenner, the discoverer of vaccination. It helps a man immensely to be a bit of a hero worshipper, and the stories of the lives of the masters of medicine do much to stimulate our ambition and rouse our sympathies. If the life and work of such men as Bichet and Laennec will not stir the blood of a young man and make him feel proud of France and of Frenchmen, he must be a dull and muddy-mettled rascal. In reading the life of Hunter, of Jenner, who thinks of the nationality which is merged and lost in our interest in the man and in his work. In the halcyon days of the Renaissance, there was no nationalism in medicine, but a fine Catholic spirit made great leaders like Vesalius, Eustachius, Stenson, and others at home in every country in Europe. Osler, Equanimitas, and other essays. Edward Jenner, the discoverer of vaccination. A very striking life in its lessons for the serious student of medical problems is that of Edward Jenner, who first demonstrated to the world that a simple attack of mild, never fatal cowpox, deliberately acquired, might serve as a protective agent against the deadly smallpox, which before that time raged so violently all over the civilized world. His successful solution of this problem has probably saved more lives and suffering than any other single accomplishment in the whole history of medicine. While this fact is apparently not generally appreciated, Jenner's discovery did not come by mere chance, but was the result of his genius for original investigation, which led him to make many other valuable observations, covering nearly the whole range of medicine. Nor indeed was his activity limited to medicine alone, but extended itself to many of the allied sciences, and even to scientific departments quite beyond the domain of medicine. In medicine, we owe to Jenner the first hint of the possible connection between rheumatism and heart disease. He pointed out, at a discussion in a little English medical society, how often affections of the heart occurred in those who had suffered from previous attacks of rheumatism. He was among the first, perhaps the very first, to hint at the pathological basis of angina pectoris. While Heberden's name is usually connected with this discovery, there seems good reason to think that already Jenner had independently noted and called attention to the frequency with which degenerative affections of the arteries within the heart muscle itself were to be found where during life heart pang had been a prominent and annoying symptom. Besides these important advances in medicine made by him, and his great discovery of the identity of cowpox and smallpox, Dr. Jenner was an interesting observer of phenomena in all the biological sciences, and in geology and paleontology. He was a great friend of Dr. John Hunter, who frequently suggested to him the making of such experiments and observations as were more likely to succeed in the country than in the city, and one cannot help but be struck with the determination evinced all his life to take nothing on authority, but to test everything by actual observation, and above all, not to theorize where he did not have the actual data necessary for assured conclusions. And even where he thought he had them, his wonderful faculty for waiting until they had properly matured and their true significance had become evident, stamped him for all time as a model for scientific investigators. Undoubtedly, Jenner's greatest work was that of determining the value of vaccination. His patient investigation of this subject, the thorough conservatism with which he guarded himself from publishing his conclusions until he had tested them in every way, the absence of that haste to rush into print so characteristic of most present-day medical investigators, and which is the cause of so much disappointment in modern medicine, all distinguished this country physician as one of the greatest investigating geniuses that medicine has produced. His life is a mirror for the medical student and the investigating practitioner of medicine. His discovery was so complete, when he finally announced it, that but very little has been added to it since. His invention came from his mind as Minerva from the brain of Jove, fully armed for the conflict that was sure to come. In this, Jenner resembled very much Laennec and the other investigating geniuses in medicine. As a matter of fact, only one improvement has been made in the preparation of vaccine material since Jenner's time, and that is the incorporation of glycerin in very recent years, which gradually destroys any microorganisms that may be present, leaving the vaccine virus itself unimpaired in its efficacy, though without the possibility of inflicting those secondary infections which for so long cast a shadow on vaccination. Dr. Edward Jenner was the third son of an Anglican clergyman, his mother being the daughter of a clergyman who had been at one time prebend in the Cathedral of Bristol. The family held considerable property in Gloucestershire. He received his early education in Wootton-under-Edge and later at Cirencester, the old Roman town in Gloucestershire. While he acquired a good working knowledge of the classics, from his earliest years he was interested in natural history. Before he was 9, he made a collection of the nests of the dormouse. The hours that other boys spent at play, he devoted to searching for fossils or other interesting natural curiosities. After his preliminary education had been finished, he was apprenticed to Mr. Ludlow, an eminent surgeon at Bristol, and after 2 years here he went to London, where he had the privilege of residing as a favorite pupil in the family of John Hunter for 2 years. At this time Jenner was in his 21st year, John Hunter in his 42nd. Hunter was not then a public lecturer, but he had been for 2 years surgeon to St. George's Hospital, and for nearly 5 years had been engaged in studying the habits and structure of animals in a menagerie and laboratory, which he had established at Brompton. The inspiration of Hunter's original genius meant much for young Jenner. He learned not only to respect the teacher, but to love the man. In Hunter's unquenchable desire for knowledge and love of truth, there was something very congenial to the spirit of Jenner, who was himself above all things an inquirer. After completing his 2 years of work with Hunter, he still remained intimately associated with him by letter. Though later in life Jenner's correspondence became very voluminous, these letters from Hunter were always very carefully preserved in a special cover, and they served to show how stimulating to the young man must have been Hunter's virile enthusiasm for truth as it could be deduced by observation and experiment. It was to Hunter that Jenner once wrote that he had heard it said in Gloucestershire that the dairy workers who suffered from a certain disease caught from the udders of cows and called cowpox were protected thereafter from attacks of smallpox. He added that this tradition interested him very much, and that he intended to think about it. "Don't think," wrote Hunter to him in return. "Make observations. Investigate for yourself the truth of the tradition." Jenner did so, and the result is now known to all. These letters from Hunter contained many other interesting suggestions. For instance, it was under Hunter's direction that Jenner succeeded in finding out that in hibernating animals the temperature is very much reduced, and the respirations are very slow, while the rate and force of the pulse are often so much diminished as to be scarcely more than noticeable at the extremities. Between Hunter and Jenner it had already been discovered that the sap in trees will not freeze at temperatures much lower than that at which the same fluid freezes when withdrawn from the tree, and the same thing seemed to be true with regard to the blood of hibernating animals. He learned that notwithstanding the low temperature to which it is reduced, the animals are not affected particularly by the cold, though their store of fat is consumed and they awake very hungry in the springtime. Besides hibernation, Jenner also investigated the habits of the cuckoo, that crux of the biologist which insists on foisting its eggs upon other birds and allowing its orphan young to be brought up in alien nests, while the real young of the deceived foster parents are often pushed out of their nests by this burly intruder, which grows so fast and strong. It is needless to say, this subject interested John Hunter very much, and there are a number of letters which passed between them on the subject. It must not be supposed, however, that young Jenner was entirely occupied with his scientific work to the exclusion of social life and recreation. He was one of the best known men of the county, and was looked upon as a genial companion, from whom might be expected on almost any occasion pleasant jests and epigrams, not too biting, with regard to friend and acquaintances. Some of these have been preserved, and we quote several of them as indicative of his special vein of humor. On the death of a miser. Tom at last has laid by his old niggardly forms, and now gives good dinners. To whom, pray? The worms. On Lord Berkeley's huntsman, who died in the chase. Determined much higher to hoist up his name than Nimrod the hunter in annals of fame. Hark forward, cried Charles, and gallantly whirled his high-mettled steed o'er the gates of the world. Death and Mr. Peach. A short dialogue. Nota bene. Mr. P. died in April. P. A while forbear thy horrid gripe. Do pray, dread sir, remember, peaches are never fairly ripe till August or September. D. To gratify my longing taste and make thy flavor fine, I had thee in a hothouse placed and moistened well with wine. Mr. Peach had shortened his life by the too free use of the bottle. We have said that Dr. Jenner's supreme accomplishment in science was the working out of the vaccination problem to a great humane conclusion. His discovery was no mere accident, nor chance confirmation of a medical tradition. He devoted himself for many years to the study of cowpox, as he had the opportunity to see it, and it is what we know of this investigation, his patience and care in eliminating all the factors of error, that stamped Jenner as a medical scientist worthy of honor. When he began practice in Berkeley, he made many inquiries among his professional brethren with regard to their opinion of the protecting power of cowpox, but most of them had either paid no attention to such reports or shook their heads at once, and said they were at most popular traditions, due merely to coincidences and unsupported by any credible evidence. In the face of this, Jenner began to follow John Hunter's advice to investigate. The first careful investigation dates from about 1775, and it took him more than 5 years to clear away the difficulties surrounding the solution of the question in which he was interested. As Pasteur found in the next century when investigating the silkworm disease, Jenner soon learned that there was more than one disease called cowpox, and that the confusion consequent upon the existence of at least 2 specific diseases and a number of skin affections of the hands of various kinds, which existed among dairy workers, made the recognition of the protective power of true cowpox extremely difficult. After he had differentiated genuine cowpox, however, there was no difficulty in tracing its apparent protective power. He soon found, however, that the protection was not afforded unless the cowpox had been communicated at a particular stage of the disease. In other words, after the true vaccinia had run its course, secondary affections of the skin of the cows usually take place, and if dairy workers became infected from these lesions, then no protection against smallpox is afforded them. Another important observation that Jenner made at this time was that the disease known as grease in horses is the same affection as cowpox, and that both of these diseases are smallpox as modified by the organism in which they develop. It may be said at once that this opinion, so difficult to arrive at more than a century ago, when so little was known of comparative pathology, is held at the present day, and was confirmed by the last series of investigations made under the auspices of the Jenner Society in England. One difficulty that confronted Jenner in his researches was the fact that cowpox was scarce in his part of the country, and he had no opportunity of making inoculations with the disease in a proper stage, so as to put his suspicions to an absolute test. He collected much information, however, and stimulated others to the making of observations, so that when his discovery was announced, the mind of the medical profession was more ready to receive it. In 1788, he carried a carefully made drawing of a case of cowpox as it occurred on the hands of a Gloucester milkmaid to London, and showed it to a number of medical men, whose opinions he wished to obtain. Among these was Sir Edward Home, who agreed that there was a distinct similarity between it and certain stages of smallpox, and considered that the question of a connection between the two diseases was an interesting and curious subject. He did not share any of Jenner's views, however, with regard to the practical importance of his discovery in this matter, and gave little encouragement to the idea that a possible prophylactic for smallpox might be discovered. Something of Jenner's enthusiasm for experiment may be gathered from the fact that he did not hesitate even to inject various materials related to cowpox into the arm of his own children. We know Mrs. Jenner to have been a very wonderful woman, quite as deeply interested as the doctor himself in securing the great benefit to humanity that would result from the demonstration that cowpox protected against smallpox. But it is a little bit difficult for us in these days to understand how her mother heart could have permitted some of the experiments which Dr. Jenner's biographer, Dr. Barron, describes. The subject is indeed so surprising that I prefer to quote the passage with regard to these experiments directly from Dr. Barron. In November 1789 he inoculated his eldest son Edward, who was then about 1 year and a half old, with swinepox matter. The progress of the disease seemed similar to that which arises from the insertion of true smallpox matter when the disease is very slight. He sickened on the 8th day, a few pustules appeared. They were late and slow in their progress and small. Variolous matter, this would mean material from a smallpox patient calculated to give that disease, was carefully inserted into his arms at 5 or 6 different periods, subsequently without the slightest inflammation being excited in the part. On Thursday, April 7th, 1791, variolous matter was again inserted by 2 small incisions through the cutis, beneath the skin. Then the following notes of observed conditions day after day are made. 9th, evidently inflamed. 10th, an efflorescence of the size of a shilling spread round the inferior wound. 11th, the incision assumed a kind of erysipelatous elevation. The efflorescence much increased. 12th, these appearances much advanced. 13th, a vesicle containing a brownish fluid, and transparent, about the size of a large split pea, on the superior incision, the inferior about twice as big. The surrounding parts affected with erysipelas. The erysipelas extended to the shoulder, and then pretty quickly went off. The child showed no signs of indisposition the whole time. March 1792. E. Jenner was again inoculated. The matter was taken from a child that caught the disease in the natural way and had it pretty full. It was inserted fresh from the pustule. The same evening an inflammation appeared round the incision. which, at the end of 20 hours, increased to the diameter of a sixpence, and some fluid had already been collected on the lips of the scratch, which the child had rubbed off. It was not for 5 years after this time, however, that Jenner was able to make his crucial experiments in the matter. On the 14th of May, 1796, the date is still recalled as Vaccination Day in Germany, especially in Berlin, vaccine matter was taken from the hand of a dairymaid, Sarah Nelms, and inserted by 2 superficial incisions in the arms of James Phipps, a healthy boy of about 8 years of age. The boy went through an attack of cowpox in a regularly satisfactory manner. After this, however, it was necessary to determine whether he was protected from smallpox. After waiting 2 months, Jenner inoculated him with variolous material. The result of this experiment can best be learned from the following letter written to his friend Gardner. Dear Gardner, as I promised to let you know how I proceeded in my inquiry into the nature of that singular disease, the cowpox, and being fully satisfied how much you feel interested in its success, you will be gratified in hearing that I have at length accomplished what I have been so long waiting for, the passing of the vaccine virus from one human being to another by the ordinary mode of inoculation. A boy of the name of Phipps was inoculated in the arm from a pustule on the hand of a young woman who was infected by her master's cows. Having never seen the disease but in its casual way before, that is, when communicated from the cow to the hand of the milker, I was astonished at the close resemblance of the pustules, in some of their stages, to the variolous pustules. But now listen to the most delightful part of my story. The boy has since been inoculated for the smallpox, which, as I ventured to predict, produced no effect. I shall now pursue my experiments with redoubled ardor. Believe me yours very sincerely, Edward Jenner. Notwithstanding the complete success of this experiment, Jenner did not rush into print with it. 2 years later, at the end of June 1798, his Inquiry into the Causes and Effects of the Variolae Vaccinae was published. In the meantime, Jenner had succeeded in demonstrating the protective quality against smallpox of vaccination, contracted either casually or by direct inoculation, in some 23 cases. 16 of these had occurred accidentally in the course of occupations connected with cows and horses. The rest were done under Jenner's directions. Among the persons inoculated was Jenner's own little second son, Robert Fitz Harding Jenner, an infant 11 months old. Jenner demonstrated conclusively that the cowpox protects the human constitution from the infection of smallpox. End of section 7.
Section 8 of Makers of Modern Medicine. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Makers of Modern Medicine by James Joseph Walsh. Jenner, Discoverer of Vaccination, Part 2. After Dr. Jenner had made his tests, he prepared a pamphlet for publication. Before publishing, however, he thought it better to make a visit to London so that he might have the opportunity to introduce the subject personally to friends and demonstrate the truth of his assertion to them. He remained in London for nearly 3 months without being able to find anyone who would submit to vaccination. The medical profession generally took very little interest in the subject and seemed to consider him sadly visionary. Under the circumstances, it is not surprising that Jenner went back to Gloucestershire and his country practice, rather disappointed. It happened, however, that soon after his return home, a distinguished London surgeon named Klein resolved to make a trial of the vaccine material which Jenner had left with his friends. The surgeon's purpose in using it, however, was not altogether to test its efficacy as a prophylactic against smallpox, but with the notion that the counter irritation thus obtained might be useful in a case which he had under treatment. Those were the days when the satin and the issue were still in common use, and counter irritation was considered one of the most important remedial measures at the command of the surgeon. The patient was a child suffering from a form of chronic hip joint disease that, at this distance of time and with rather incomplete descriptions, seems to have been the ordinary tuberculosis of the hip. The vaccine material was inoculated over the joint, and surprising though it may appear now, the vaccine vesicle ran rather a normal course and healed kindly. The little patient was afterward inoculated with smallpox and found to be incapable of acquiring that disease. This case attracted considerable attention. It is not, however, a matter for congratulation as regards the openness of mind of the medical men of the period to find that this was the only sort of a case that was considered suitable for such an experiment. It is very easy to understand that in a child in a rundown condition, the vaccine material might very well have provoked a rather serious local reaction. In a way, the fate of vaccination hung in the balance, and good luck was in its favor. Mr. Klein, however, after this became a strong advocate of vaccination and brought it very decidedly before the London physicians. There was still a feeling of opposition, as indeed there always is against any novelty in medicine, but this gradually disappeared to give place to a suspension of judgment until more accurate and detailed information could be obtained from further observations and tests. It was not long before the opposition to the practice of vaccination took definite form. One of the best known London physicians of the time, Dr. Injane House, became the leader of a strong faction of the medical profession of London, who not only would have nothing to do with vaccination, but proclaimed openly that it was a dangerous innovation, absolutely unjustifiable, and communicated a disease without protecting against any other. On the other hand, there were overzealous advocates of vaccination who insisted on its value but did not know how to recognize the true cowpox from other lesions, sometimes confounded with it, nor the exact stage of the disease in which the vaccine material obtained would prove effectively protective. A number of these used vaccine material so contaminated by secondary infections of one kind or another that no wonder serious sores were reported as a result. Physicians who have for many years known how difficult it is to bring certain people to a recognition of the benefits that have been conferred on modern civilization by vaccination will appreciate how many difficulties and prejudices and misunderstandings Jenner himself must have encountered during the original introduction of vaccination. Some of the supposed objections to vaccination wear a very modern air and come from physicians whose only purpose apparently is to bring out the truth and yet who are evidently led to the drawing of conclusions much wider than their premises by the fact that they know they will have an attentive audience among the anti vaccinationists at least. A fair example of one of these old time objections against vaccination may be found in the following passage from a letter by Dr. Jenner written to Mr. Moore. Corresponding objections have been made in much more modern times, and the passage will arouse the sympathetic amusement of present day physicians. You probably may not have seen a pamphlet lately published by Dr. Watt of Glasgow, as there is nothing in its title that develops its purport or evil tendency. An inquiry into the relative mortality of the principal diseases of children, etc. The measles, it seems, have been extremely fatal in the city of Glasgow for the last 4 or 5 years among children, and during this period, vaccination was practiced almost universally. Previously to this, the measles was considered as a mild disease. Hence, Dr. Watt infers that the smallpox is a kind of preparative for the measles, rendering the disease more mild. In short, he says, or seems to say, that we have gained nothing by the introduction of the cowpox, for that the measles and smallpox have now changed places with regard to their fatal tendency. Is not this very shocking? Here is a new and unexpected twig shot forth for the sinking anti vaccinists to cling to. But mark me, should this absurdity of Mr. Watt take possession of the minds of the people, I am already prepared with the means of destroying its effects, having instituted an inquiry through this populous town and the circumjacent villages, where, on the smallest computation, 20,000 children must have been vaccinated in the course of the last 12 years by myself and others. Now it appears that during this period there has been no such occurrence as a fatal epidemic of measles. You would greatly oblige me in making this communication to the board with my respectful compliments. Fortunately, only a few colleagues were so illogical, and an excellent idea of how much Jenner's discovery was appreciated by his contemporaries may be obtained from the number of honors, diplomas, addresses, and communications from public bodies and distinguished individuals which he received. A chronological list of these may be found at the end of Dr. Barron's Life of Jenner. Among them may be noted the diploma of LL.D. from the Senate of Harvard University, Cambridge, Mass. Under the presidency of Dr. Willard, also the diploma of Doctor in Medicine, honoris causa, which Jenner especially appreciated, as he says in one of his letters, because he understood that the university conferred this degree in this way only once or twice in a century. There is a diploma as Fellow of the American Society of Arts and Sciences in Massachusetts, as well as a diploma as a member of the American Philosophical Society at Philadelphia. The diploma from Boston bears the signature of John Adams as president, that from Philadelphia the signature of Thomas Jefferson. Most of the prominent medical and scientific societies of Europe had elected him a member or had sent him some special token of recognition. One of these documents, expressive of the gratitude of the senders for the great benefit his work had conferred upon the human race, which Jenner valued the highest, was an address from the 5 Indian nations which, with a wampum belt, was delivered to him on November 8, 1807. In reply to this, Dr. Jenner wrote to the American agent through whom the insignia had been forwarded. Sir, your kindness in delivering to the 5 nations of Indians my treatise on vaccination and in transmitting to me their reply demands my warmest thanks. I beg you to make known to the 5 nations the sincere gratification which I feel at finding that the practice of vaccination has been so universally received among their tribes and proved so beneficial to them. At the same time, be pleased to assure them of the great thankfulness with which I received the belt and string of wampum with which they condescended to honor me, and of the high estimation in which I shall forever hold it. May the active benevolence which their chiefs have displayed in preserving the lives of their people be crowned with the success it deserves, and may that destructive pestilence, the smallpox, be no more known among them. You also, sir, are entitled to the most grateful acknowledgments, not only from me, but from every friend of humanity, for the philanthropic manner in which you originally introduced the vaccine among these tribes of Indians. I have the honor to remain, etc. E. Jenner. The general trend of American appreciation for Dr. Jenner's work, at least among the intelligent classes, may be gathered from the following letter sent to Dr. Jenner by Thomas Jefferson, while he was president May 14, 1806. Monticello, Virginia, May 14, 1806. Sir, I have received the copy of the evidence at large respecting the discovery of the vaccine inoculation, which you have been pleased to send me, and for which I return you my thanks. Having been among the early converts in this part of the globe to its efficacy, I took an early part in recommending it to my countrymen. I avail myself of this occasion to render you my portion of the tribute of gratitude due to you from the whole human family. Medicine has never before produced any single improvement of such utility. Harvey's discovery of the circulation of the blood was a beautiful addition to our knowledge of the human economy. But on a review of the practice of medicine before and since that epoch, I do not see any great amelioration which has been derived from that discovery. You have erased from the calendar of human afflictions one of its greatest. Yours is the comfortable reflection that mankind can never forget that you have lived. Future nations will know by history only that the loathsome smallpox has existed and by you has been extirpated. Accept the most fervent wishes for your health and happiness and assurances of the greatest respect and consideration. T.H. Jefferson. Almost more interesting than the story of Jenner, the experimental scientist, the true harbinger of modern experimental medicine, the founder of experimental pathology, and the discoverer of the pregnant idea, which was to mean so much for 19th century medicine, in the hands of Pasteur and his successors, is the story of Jenner, the man, the husband, the friend, and the physician of the poor. In spite of his intense preoccupation in his experimental work and the amount of time it must have required to make his observations, he found opportunities to care for the poor and to interest himself in all their concerns as well as their health. He made many firm friends among people of his own social status and generally was considered a most amiable as well as liberal and humanitarian man. He was deeply religious and, as we shall allow his earliest biographer, Dr. Barron, to tell, was not ashamed to exhibit his religious feelings by word and deed when the proper occasion presented itself. This part of his life deserves to be studied as carefully and remembered as faithfully as that in which he made his discoveries, since it is the complement that shows the character of the man in its entirety. Jenner's personal character may be very well understood from a paragraph of his biographer who had been his bosom friend for many years. He says, but Dr. Jenner was not only humble in all that concerned the greatest incident of his life, the successful discovery of vaccination. He continued so after success had crowned his labors and after applause greater than most men can bear had been bestowed upon him. This most estimable quality was visible at all times, but it was particularly conspicuous when he was living in familiar intercourse with the inhabitants of his native village. If the reader could in imagination accompany me with him to the dwellings of the poor and see him kindly and heartily inquiring into their wants and entering into all the little details of their domestic economy, or if he could have witnessed him listening with perfect patience and good humor to the history of their maladies, he would have seen an engaging instance of untiring benevolence. He never was unwilling to receive anyone, however unseasonable the time may have been. Such were his habits, even to the latest period of his life. I scarcely know any part of his character that was more worthy of imitation and unqualified respect than that to which I have alluded. I have never seen any person in any station of life in whom it was equally manifest and when it is remembered that he was well stricken in years, that he had been a most indefatigable and successful laborer in the cause of humanity, and that he might have sought for a season of repose and the uncontrolled disposal of his own time, the sacrifices which he made are the more to be valued. In the active and unostentatious exercise of kindness and charity, he spent his days, and he seemed ever to feel that he was one of those qui se natos ad homines juvandos, tutandos, conservandos, arbitranter, who consider themselves born to help, protect, and cherish their fellow men. His kindness and condescension to the poor was equalled by his most considerate respect and regard to the feelings and character of the humblest of his professional brethren. I have often been struck with the total absence of everything that could bear the semblance of loftiness of demeanor. Few men were more entitled to deliver their sentiments in a confident or authoritative tone, but his whole deportment was opposed to everything of that description, and he did not hesitate to seek knowledge from persons in all respects his inferior. All his younger brethren who have ever had the happiness to meet him in practice must have been deeply impressed with this part of his character. Many a member of the medical profession who is not a genius will find an excuse for allowing disorder about his rooms from the example which is said to have been set by Jenner. He was interested in nearly every branch of science, and specimens from many departments were constantly around him. He himself, it is said, had the key to the apparent confusion. Most of the others who allow themselves to drift into careless habits in the same direction insist that they too have the key. Some of their friends, however, are inclined to doubt it. It is curiously interesting under these circumstances to have Jenner's biographer tell of the confused state of affairs that existed in his room and yet his defense of it. Perhaps in this matter it is well to remember what Augustin Birrell says at the end of his essay on Carlisle. Don't let's quarrel with genius. We have none of it ourselves, and the worst of it is we cannot get along without it. The objects of his studies generally lay scattered around him, and, as he used often to say himself, seemingly in chaotic confusion. Fossils and other specimens of natural history, anatomical preparations, books, papers, letters, all presented themselves in strange disorder, but every article bore the impress of the genius that presided there. The fossils were marked by small pieces of paper pasted on them, having their names and the places where they were found inscribed in his own plain and distinct handwriting. His materials for thought and conversation were thus constantly before him, and a visitor on entering his apartment would find in abundance traces of all his private occupations. He seemed to have no secrets of any kind, and notwithstanding a long experience with the world, he acted to the last as if all mankind were as trustworthy and free from selfishness as himself. He had a working head, being never idle, and accumulated a great store of original observations. These treasures he imparted most generously and liberally. Indeed, his chief pleasure seemed to be in pouring out the ample riches of his mind to everyone who enjoyed his acquaintance. He had often reason to lament this undoubted confidence, but such ungrateful returns neither chilled his ardor nor ruffled his temper. It is interesting to note what was Jenner's opinion with regard to two subjects that are very much discussed at the present time. These are the questions of religious training in education and the advisability of making nature study a part of the course for children. Jenner considered that no education could possibly be complete which did not include both of these subjects. Religious training he deemed absolutely indispensable. Nature study he advised for somewhat different reasons from those for which it is now urged. He thought there was a depth of interest in the study of the objects of nature that could scarcely fail to lessen the burden of education for the child, but the main reason for its study to his mind was that children intent on the wonders of nature could scarcely help but realize the power of the Creator and learning to admire Him more and more, be thus drawn to respect His laws, to acknowledge His supremacy, and to devote themselves to bringing about the fulfillment of His will in this world to the fullest extent in their power. Jenner's religious opinions and beliefs must be left to the expression of the biographer already mentioned, who gives them very fully. He says, one of the most remarkable features in Jenner's character when treating of questions of a moral or scientific nature was a devout expression of his consciousness of the omnipresence of the deity. He believed that this great truth was too much overlooked in our systems of education, that it ought to be constantly impressed upon the youthful heart, and that the obligations which it implied, as well as the inward truth and purity which it required, should be rendered more familiar to all. Mrs. Jenner was constantly occupied in teaching these lessons to the poor around her in schools which she established for the purpose of affording a scriptural education. He, building upon this foundation, wished to add instruction of a more practical description, deduced from their daily experience and illustrated by a reference to those works of wisdom and beauty which the universe supplies. He always contended that some aid of this kind was necessary to impress completely upon the character of the lower ranks those maxims which they derived from their teachers. He had other views too. In recommending such a plan, he thought that the lot of the poor might be ameliorated and many sources of amusement and information laid open to them which they are at present deprived of, that the flowers of the field and the wonders of the animal creation might supply them with subjects of useful knowledge and pious meditation. His wife, as is often, though unfortunately not always, the case, seems to have had that precious uplifting influence over him which served continually as an incentive to higher things and kept him from the sterile materialism which an exclusive absorption in scientific studies, with lack of the exercise of faith and of association with human suffering, seems to bring to many men. Dr. Barron says on this point, I remember when discussing with him certain questions touching the conditions of man in this life and dwelling upon his hopes, his fears, his pains, and his joys, and coming to the conclusions which merely human reason discloses to us, and when dwelling on the deformity of the heart, our blindness, our ignorance, the evils connected with our physical structures, our crimes, our calamities, and our unfathomable capacity both for suffering and for enjoyment, he observed, Mrs. Jenner can explain all these things. They cause no difficulties to her. Toward the end of his life, Jenner's feelings with regard to the importance of a confident otherworldliness as the only fitting explanation for the mysteries of this became emphasized. To quote his biographer once more, as he approached nearer to his own end, his conversations with myself were generally more or less tinged with such views as occur to the serious mind when contemplating the handiwork of the Creator. In all the confusion and disorder which appears in the physical world, and in all the anomalies and errors which deface the moral, he saw convincing demonstration that he who formed all things out of nothing, still wields and guides the machinery of his mighty creation. Jenner's feelings with regard to the relative importance of medical and religious ministrations may be very well appreciated from an expression of his on the occasion when he was being presented to a distinguished nobleman by the famous missionary Ronald Hill. The Reverend Mr. Hill said, "Allow me to present your lordship my friend Dr. Jenner, who has been the means of saving more lives than any other man." "Ah," responded Jenner, "were I like you, I could save souls." In his sketch of Jenner's life in the Disciples of Aesculapius, Sir Benjamin Ward Richardson considers that this incident shows a lack of appreciation of the dignity of the medical profession and a humility rather difficult to understand. Anyone who will place himself in Jenner's position of fervent belief that one thing necessary is the salvation of souls will not fail to recognize, however, his sincerity or fail to appreciate its true significance. After all, Jenner was so deeply impressed with the importance of other worldly things and the comparative insignificance of this that he found it even a little difficult to understand why men should not see the direct action of the Creator and all his providence in even some of the minutest details of life. Once he said, "I do not marvel that men are grateful to me, but I am surprised that they do not feel grateful to God for making me a medium of good." Few men who have accomplished so much have felt so little vainglory over it as Jenner. There was not a jot or tittle of what is so rightly called conceit in him. He well deserves a place beside such beautiful characters as Morgagni, Auenbrugger, Laennec, and Pasteur, whose work was done for others, not for themselves, and after all the most striking definition of a saint is one who thinks first of others and only second of himself. End of section 8.
Section 9 of Makers of Modern Medicine. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Read by Sheikh Bear 1602. Makers of Modern Medicine by James Joseph Walsh. Galvani, founder of animal electricity. The world that I regard is myself. It is the microcosm of my own frame that I cast mine eye on. For the other, I use it, but like my globe, and turn it round sometimes for my recreation. Men that look upon my outside, perusing only my condition and fortunes, do err in my altitude, for I am above Atlas his shoulders. The earth is a point, not only in respect of the heaven above us, but of that heavenly and celestial part within us, that mass of flesh that circumscribes me, limits not my mind. That surface that tells the heavens it hath an end, cannot persuade me I have any. I take my circle to be above 360. Though the number of the arc do measure my body, it comprehendeth not my mind. Whilst I study to find how I am a microcosm, or a little world, I find myself something more than the great one. There is surely a piece of divinity in us, something that was before the elements, and owes no homage to the sun. Sir Thos, Brown, M.D. It is often thought, and only too often stated, that the impetus to the rise of our modern science, which came during the last half of the 18th century, was due to the spirit of the French Revolution, making itself felt long before the actual declaration of the rights of the man by the French encyclopedists. It is the custom to conclude that the spirit of liberty which was abroad infected the minds of the rising generation to such an extent that they cast off the fetters of old traditional modes of thinking, refused to accept supposed truths on the strength of tradition or on authority as before, tested knowledge for themselves, and as a consequence made true progress in the sciences. Something doubtless there is in this, and yet a careful investigation of the lives of the men to whom especially the beginnings of the biological sciences are due will show that not only were they men with the deepest respect for authority, the greatest reverence for old modes of thinking, but they were also typical representatives of the developing influence of methods of education which are sometimes unfortunately deemed to be narrowing in the extreme. We have already studied the life of Morgagni, the great father of modern pathology, to find that he, least of all, in his generation, was affected by any of the liberalizing tendencies that are supposed to have led up to the freedom of the human mind and the consequent successful broadening of human science. We shall see that there were many others who did their work at the end of the 18th century, of whom this same thing can be said. And no more striking examples of this can be found than the lives of two great Italians, Volta and Galvani, to whom the modern world has paid the tribute of acknowledging them as founders in electricity by taking their names to express important basic distinctions in the science. It was not in Italy alone, however, that this adhesion of the great scientific minds to the old orthodox teachings of Christianity constituted a notable characteristic of the history of 18th century science. Everywhere, the same thing was true. Cavendish, Sir Humphrey Davy, and Faraday, the great English scientists, to whom so much of progress in electricity and in physics is due, were similar in this respect to their Italian colleagues. Oersted the Dane belongs in the same category. In France, such distinguished names as Lamarck, the great founder of modern biology and the first to broach the theory of evolution, Hauy, the father of crystallography, Laplace, and many others might be mentioned. The lives of the men who were contemporary workers in medicine, as sketched in the present volume, will show the same thing to be true also in their cases. A glance at the life of Aloysius Galvani will illustrate how little the spirit of the revolution had to do with the rise of electricity and the first discussions of its relations to life. He was born at Bologna, September 9, 1737. A number of his immediate relatives had been distinguished as clergymen. The early years of Galvani's life were spent in association with religious, and as a youth he wished to become a member of a religious order whose special function it was to assist the dying at their last hour. His father, however, was opposed to his entrance into religion, and so Galvani devoted himself to medicine at the University of Bologna, and at length became a professor of anatomy in his alma mater. Professor Galeazzi, who was, at the time, one of the most distinguished professors in anatomy in Italy, was very much attracted to young Galvani and became his friend and patron in his student days. Galvani became a member of Galeazzi's household, and finally having fallen in love with one of his daughters, won her father's consent to their early marriage. The happiness in life that he thus prepared for himself became one of the often quoted exemplars of domestic felicity in Bologna, where Galvani's life was passed. Medici, in his Panegyric of Galvani, which we shall have an occasion to quote for more than once, of the doctor's wooing and marriage with Lucia Galeazzi, which we prefer to repeat in the naive simplicity with which it is related by the Italian panegyrist. Galvani had been seriously thinking of matrimony for some time, and had, it seems, strange as that might be considered in a rising young scientist in our day, even prayed for counsel in the matter. One of his favorite saints was Saint Francis of Sales, the Archbishop of Geneva, the gentleman saint as he had been called, for whose charming personal character Galvani had a very devout admiration. One day, while praying in one of the churches of Bologna before a statue of Saint Francis of Sales, he looked up after some moments of abstraction to find a young woman's face between him and the altar. The face proved to be that of Lucia. Galvani looked upon it as a sign from heaven of approval of some of his wishes, and applied for the hand of the fair Lucia. Anyone who has seen the offerings at the shrine of Saint Anthony of Padua, not so far from Bologna, and has realized that the good patron of things lost seems also to be a special subject of recourse in cases of lost hearts among the northern Italians, even at the present day, will realize that probably the story as told is the simple truth without any tincture of romance. Galvani began original work of a high order very early in his medical career. His graduation thesis, with regard to bones, treating specially their formation and development, attracted no little attention, and is especially noteworthy because of the breadth of view in it, for it touches on the various questions relative to bones from the standpoint of physics and chemistry, as well as medicine and surgery. It was sufficient to obtain for its author the place of lecturer in anatomy in the University of Bologna, besides the post of director of the teaching of anatomy in the Institute of Sciences, a subsidiary institution. From the very beginning, his course was popular. Galvani was an easy, interesting talker, and he was one of the first who introduced experimental demonstrations into his lectures. At this time, the science of comparative anatomy was just beginning to attract widespread attention. John Hunter in London was doing a great work in this line, which has placed him in the front rank of contributors to biology and collectors of important facts in all the sciences allied to anatomy and physiology. Galvani took up this work with enthusiasm and began the study particularly of birds. These animals, the farthest removed from man of the beings that have warm blood, present by that very fact many interesting contrasts and analogies, which furnish important suggestions for the explanation of difficult problems in human anatomy and physiology. His experimental work in comparative anatomy, strange as it might appear and apparently not to be expected, led him into the domain of electricity through the observation of certain phenomena of animal electricity and the effect of electrical current on animals. Like so many other great discoverers in science, his first and most important observations in electrical phenomena were results of an accident. Of course, it is easy to talk of accidents in these cases. The fall of the apple for Newton, Laennec's observation of the little boys tapping on a log in the courtyard of the Louvre, from which he got his idea for the invention of the stethoscope, were apparently merest accidents. Without the inventive scientific genius ready to take advantage of them, however, these accidents would not have been raised to the higher planes of important incidents in history. They would have meant nothing. The phenomena had probably occurred under men's eyes hundreds of times before, but there was no great mind ready to receive the seeds of thought it suggested and go on to follow out the conclusions so obviously indicated. Galvani's observation of the twitching of the muscles of the frog under the influence of electricity may be called one of the happy accidents of scientific development, but it was Galvani's own genius that made the accident happy. There are two stories told as to the method of the first observation in this matter. Both of them make his wife an important factor of the discovery. According to the more popular form of the history, Galvani was engaged in preparing some frog legs as a special dainty for his wife, who was ill and who liked this delicacy very much. He thought so much of her that he was doing this himself in the hope that she would thus be more readily tempted to eat them. While so engaged, he exposed the large nerve of the animal's hind legs and at the same time split the skin covering the muscles. In doing this, he touched the nerve muscle preparation, as this had come to be called, with a scalpel and little forceps simultaneously, with the result that twitchings occurred. While seeking for the cause of these twitchings, the idea of animal electricity came to him. The other form of the story of his original discovery is not less interesting and perhaps a little more authentic. One evening, he was engaged in his laboratory in making some experiments while some friends and his wife were present. By chance, some frogs, the hind legs of which had been stripped of skin, were placed upon the table not far from an apparatus for the generation of frictional electricity. They were not in contact with this apparatus at any point, however, though they were not far distant from the conductor. While the apparatus was being used to produce a series of sparks, a laboratory assistant, without thinking of any possible results, touched with the point of a scalpel the sciatic nerves of one of the animals. Just as soon as he did this, all the muscles of this limb went into convulsive movement. It was Galvani's wife who had noticed what had happened and who had the assistant use the scalpel one more time, with the same result. She was herself a woman of well-developed intellect, and her association with her father and husband made her well acquainted with the anatomy and physiology of the day. She realized that what had occurred was quite out of the ordinary. Accordingly, she called the attention of her husband to the phenomena and is even said to have suggested the possible connection with the presence and action of the electric apparatus. Husband and wife then together, by means of a series of observations, determined that whenever the apparatus was not in use, the phenomenon of the conclusive movements of the frog's legs did not take place, notwithstanding irritation by the scalpel. Whenever the electric apparatus was working, however, then the phenomenon in question always took place. According to either form of the story, it is clear that Madame Galvani had an important part in the discovery, and Galvani himself, far from making little of what she had accomplished, was always glad to attribute his discovery, or at least a suggestive hint that led to it, to his wife. After these first discoveries on the influence of artificial electricity, nothing seemed more interesting than to investigate whether ordinary atmospheric electricity, as manifested in lightning, would produce the same effects on muscular movements. In this matter, Galvani showed much courage as an inventive genius. He dared to place an atmospheric conductor on the highest point of his house, and to this conductor he attached a wire which ran down to his laboratory. During a storm, he suspended on this metallic circuit, by means of their sciatic nerves, frogs' legs and the legs of other animals prepared for the purpose. To the feet of the animals he attached yet another wire, sufficiently long to reach down to the bottom of a well, thus completing a current to the ground. All the phenomena took place exactly as if with artificial electricity, Whenever lightning flashed from the clouds, the limbs of the animals experimented with underwent violent contractions, which were so noticeable before the noise of the thunder, and were, so as to say, the signal for it. These contractions took place although there were no conductors from the muscles, and although the nerve conductors were not isolated. The muscular contractions were greater in proportion than the intensity of the lightning and the proximity of the storm. The phenomena were manifest whether the animal was in the open air or if, for greater convenience, it was closed in a room or even in a vessel. The muscular contractions could even be noticed despite the fact that the nerves were separated somewhat from their conductor, especially whenever the lightning was violent. The sparks would leap over a small gap, almost as in the case of artificial electricity, the muscular contraction of the animal being proportional to the energy and the nearness of the sparks. It is almost needless to say, these experiments upon the frog were not accomplished in a few days or a few weeks. Galvani had his duties as professor of anatomy to attend to, besides the obligations imposed upon him as a busy practitioner of medicine and surgery. At that time, it was not nearly so much the custom as it is at present to use frogs for experiments, with the idea that conclusions might be obtained of value for the biological sciences generally, and especially for medicine. There has always been an undercurrent of feeling that such experiments are more or less a beating of the air. Galvani found opposition not only to his views with regards to animal electricity, as enunciated after experimental demonstration, but also met with no little ridicule because of the supposed waste of time at occupations that could not be expected to lead to any practical results. It was the custom among scientific men to laugh somewhat scornfully at his patient persistence in studying out every detail of electrical action on the frog, and one of the supposedly prominent scientists of the time even dubbed him the frog dancing master. This did not, however, deter Galvani from his work, though some of the bitter things must have proved cutting enough and might have discouraged a smaller man, less confident of the scientific value of the work he was doing. There were even phases of physical science quite apart from physiology or animal electricity, which he was able to illustrate by his experiments. He called special attention, for instance, to the fact that the lightning does not excite a single contraction of the muscle, as in the case with a spark of artificial electricity, but that there are a series of muscular contractions succeeding one another rapidly in diminishing energy and somewhat corresponding to the reiterated reports of thunder. This was Galvani's expression for the dying away of the electrical influence upon the muscle. He had thus evidently reached a hint of the pendulum-like swing with which electrical equilibrium is restored after its violent disturbance immediately following the lightning stroke. He noted, moreover, that for the production of muscular contractions, the absolute appearance of lightning was not indispensable. Muscular twitchings were noted whenever the heavens were overclouded by a storm, or whenever clouds charged with electricity were passed above the conductor. These experiments were made upon living frogs, as well as upon separated legs, and in both cases the results obtained were very similar to those observed on the employment of some form of artificial electricity. In some of these observations, Galvani was anticipating ideas that became current truth in electrical science only many years after his time. In his observations upon the effects of lightning, he was forestalling Franklin's words to a certain extent. Both of these great scientists, however, had been anticipated by a clergyman in Austria, whose work attracted very little attention, however, because he was not in touch with the scientific bodies of the day. The demonstration of the identity of ordinary terrestrial artificial electricity and the lightning was in the air, as it were, and many workers, as is usually the case with any great discovery, came very close to it and deserve at least a portion of the credit for it. It is almost needless to say, many of the experiments with lightning thus conducted by Galvani were not without an element of serious personal danger. Not long after his time, a Russian servant, Richmond by name, while repeating Franklin's experiments with the kite, was struck dead by the charge received from his apparatus. Galvani, however, devoted himself only in passing to the physical problems involved and kept always in view the physiological aspects of the problem of animal electricity, and accordingly made a series of most interesting observations on the ray fish or torpedo, as it is sometimes called, the fish which gives electrical shocks. His idea was to demonstrate that the shocks felt when this animal is touched are really due to sparks of electricity similar to those which can be obtained by artificial means. This had never been determined, and Galvani succeeded in showing the presence of sparks exactly as if the animal were one of the apparatuses by which the sparks of frictional electricity are developed. At this time, this seemed surprising enough. Galvani also endeavored to demonstrate that the electricity in the electric torpedo differed only in degree, but not in quality, from certain electric manifestations that he had noted in the bodies of other animals, especially the frog. His idea always was to show the existence of a natural animal electricity, by means of which some of the complex mechanism of life was accomplished. He seems to have had some notion of the theory that had been suggested often enough in science, and is not yet entirely disproved, that there is some very close relationship between nerve impulses and the electric current. In this, of course, he was far ahead of his time, and utterly unable to make absolute demonstration, because of the lack of proper apparatus. End of section 9.
Section 10 of Makers of Modern Medicine. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Read by Nathan Meyers. Makers of Modern Medicine by James Joseph Walsh. Galvani, Founder of Animal Electricity, Part 2. The most interesting quality of Galvani's scientific career is the thoroughly experimental character of all his researches into natural phenomena. Few men have known so well how to vary their experiments so as to bring out new details of scientific knowledge. His experimental skill was of the highest order, and it is to that we owe the development in his hands of the nascent science of electricity to a point where it became easy to continue its natural evolution. Galvani's work furnished the necessary stimulus to Volta, and then the real foundation of modern electricity was laid. Almost more interesting than Galvani the scientist, however, is Galvani the man. As one of his biographers said of him, he joined to the most eminent intellectual genius a group of very precious qualities of the heart. Utterly unselfish in his relationship to others, he was known to be extremely sympathetic and had a large number of friends. His friends, too, he bound to him by even more than the proverbial hoops of steel, so that when they passed out of life, they left him unconsolable. While it was very hard to get him to take part in social functions at which numbers of people were gathered, he was by no means a recluse, and liked to be in the company of a few friends. He seemed to care very little for the renown that his discoveries gave him, and refused, as far as possible, to be made the object of public congratulations and testimonials. His relations with his patients, for during all of his long career he continued to practice, especially surgery and obstetrics, were of the friendliest character. While his distinction as a professor at the university gave him many opportunities for practice among the rich, he was always ready and willing to help the poor, and indeed seemed to feel more at home among poor patients than in the society of the wealthy and noble. Even towards the end of his life, when the loss of many friends, and especially his wife, made him retire within himself much more than before, he continued to exercise his professional skill for the benefit of the poor, though he often refused to take cases that might have proved sources of considerable gain to him. Early in life, when he was very busy between his professional work and his practice, he remarked more than once, on refusing to take the cases of wealthy patients, that they had the money with which to obtain other physicians, while the poor did not, and he would prefer to keep some time for his services for them. Toward the end of his life, Galvani was not a little perturbed by the course of events around him and by the sweeping away of faith in old beliefs, consequent upon the French Revolution and the philosophic movement that had led up to it. Seeing around him, too, the abuses to which this supposed liberty and assertion of the rights of man led, it used to be a favorite expression of Galvani that, quote, "a little philosophy led men away from God, but a good deal of it led them back to him again," end quote. Especially did he consider this true with regard to younger men, whose lack of wisdom in the difficult phases of life made them think their philosophy of things was complete, until sad experience had taught them the necessity for lifting men's minds above any mere religion of humanity, any mere stoic resignation to the inevitable, if what was best in them was to be brought out. A very interesting phase of the Italian university life of that time is revealed in two important incidents of Galvani's university career. One of his professors, one, by the way, for whom he seems to have had a great deal of respect, and to whose lectures he devoted much attention, was Laura Caterina Maria Bassi, the distinguished woman professor of philosophy at the University of Bologna, about the middle of the 18th century. It is doubtless to her teaching that Galvani owes some of his thoroughgoing conservatism in philosophic speculation, a conservatism that was of great service to him later in life in the midst of the ultra-radical principles which became fashionable just before and during the French Revolution. Madame Bassi seems to have had her influence on him for good not only during the student career, but also later in life, for she was the wife of a prominent physician in Bologna, and Galvani was often in social contact with her during his years of connection with the university. As might perhaps be expected, seeing that his own happy domestic life showed him that an educated woman might be the center of intellectual influence, Galvani seems to have had no spirit of opposition to even the highest education for women. This is very well illustrated by the first formal lecture in his course on anatomy at the university, which had for its subject the models for the teaching of anatomy that had been made by Madame Manzolini. In the early part of the 18th century, Madame Manzolini had been the professor of anatomy at the University of Bologna, and in order to make the teaching of this difficult subject easier and more definite, she modeled with great care and delicate attention to every detail so that they imitated actual dissections of the human body very closely, a set of wax figures which replaced the human body for demonstration purposes, at least at the beginning of the anatomical course. Galvani, in taking up the work of lecture on anatomy, appreciated how much such a set of models would help in making the introduction to anatomical study easy, yet at the same time without detracting from its exactness, and accordingly introduced his students to Madame Manzolini's set of models in his very first lecture. At the time, there were those connected with the teaching of anatomy who considered the use of these models as rather an effeminate proceeding. Galvani's lack of prejudice in the matter shows the readiness of the man to accept the best wherever he found it, without regard to persons or feelings. He was one of the most popular professors that the University of Bologna has ever had. He was not, in the ordinary sense of the word, an orator, but he was a born teacher. The source of the enthusiasm which he aroused in his hearers was undoubtedly his own love for teaching and the power it gave him to express even intricate problems in simple, straightforward language. More than any of his predecessors, he understood that experiments and demonstrations must be the real groundwork of the teaching of science. Accordingly, very few of his lectures were given without the aid of these material helps to attract attention. Besides, he was known to be one who delighted to answer questions and was perfectly frank about the limitations of his knowledge whenever there was no real answer to be given to a question that had been proposed. Though an original discoverer of the first rank, he was extremely modest, particularly when talking about the details of his discoveries or subjects relating to them. The most striking proof of the thorough conscientiousness with which he faced the duties of life is to be found in his conduct after the establishment of the so-called Cisalpine Republic in Italy. This was a government established merely by force of arms, without the consent of the people, and a plain usurpation of the rights of the previous government. He considered himself bound in duty to the authority under which he had lived all his previous life, and to which he had sworn fealty. When the University of Bologna was reorganized under the new government, the first requirement of all those who were made professors was that they should take the oath of allegiance to the new government. This he refused to do. His motives can be readily understood, and though practically all the other professors of the university had taken the oath, he did not consider that this freed him from his conscientious obligations in the matter. Accordingly, he was dropped from the role of professors and deprived of the never very large salary which he had obtained from this chair. On this sum he had practically depended for his existence, and he soon began to suffer from want. While he had been a successful practitioner of medicine, especially of surgery, he had always been very liberal and had spent large sums of money in demonstrations for his lectures and personal experimentation and in materials for the museums of the university. He began to suffer from actual want, and friends had to come to his assistance. He refused, however, to give up his scruples in the matter and accept the professorship which was still open for him. Finally, at the end of 2 years, influence was brought to bear on the new government, and Galvani was allowed to accept his chair in the university without taking the oath of allegiance. This tribute came too late, however, and within a short time after his restoration to his professorship, he died. That his action in this matter was very properly appreciated by his contemporaries, and that the moral influence of his example was not lost, can be realized from the expressions used by Alibert, the Secretary General of the Medical Society of Emulation, in the historical address on Galvani which he delivered before that society in 1801. Quote, Galvani constantly refused to take the civil oath demanded by the decrees of the Cisalpine Republic. Who can blame him for having followed the voice of his conscience, that sacred interior voice which alone prescribes the duties of man and which has preceded all human laws? Who could not praise him for having sacrificed with such exemplary resignation all the emoluments of his professorship rather than violate the solemn engagements made under religious sanction? End quote. In that same panegyric, there's a very curiously interesting passage with regard to Galvani's habit of frequently closing his lectures by calling attention to the complexity, yet the purposefulness of natural things, and the inevitable conclusion that they must have been created with a definite purpose by a supreme being possessed of intelligence. At the time that Alibert wrote his memoir, it was the fashion to consider, at least in France, that Christianity was a thing of the past, and that, while theism might remain, that would be all that could be expected to survive the crumbling effect of the emancipation of man. He says, quote, We have seen already what was Galvani's zeal and his love for the religion which he professed. We may add that in his public demonstration he never finished his lectures without exhorting his pupils to a renewal of their faith by leading them always back to the idea of the eternal providence which develops, preserves, and causes life to flow among so many different kinds of things. I write now, he continues, in the age of reason, of tolerance, and of light. Must I then defend Galvani in the eyes of posterity for one of the most beautiful sentiments that can spring from the nature of man? No, and they are but little initiated in the saner mechanisms of philosophy who refuse to recognize the truths established on evidence so strong and so authentic. Breves haustus in philosophia ad atheismum ducent, longiores autem reducent ad deum. Small drafts of philosophy lead to atheism, but longer drafts bring one back to God. End quote. Which may perhaps be better translated by Pope's well-known lines, quote, "A little learning in philosophy is a dangerous thing. Drink deep or touch not the pier in spring." End quote. Galvani has been honored by his fellow citizens of Bologna as one of their greatest townsmen and by the university as one of her worthiest sons. In 1804, a medal was struck in his honor, on the reverse of which, surrounding a figure of the genius of science, were the two legends, Mors mihi vita, death is life, or me, and Spiritus intus alit, the spirit works within, which were favorite expressions of the great scientist while living and are lively symbols of the spirit which animated him. In 1814, a monument was erected to him in the courtyard of the University of Bologna. It is surmounted by his bust, made by the most distinguished Bolognian sculptor of the time, De Maria. On the pedestal there are two figures in bas-relief, executed by the same sculptor, which represent religion and philosophy, the inspiring geniuses of Galvani's life. Before he died, he asked, as had Dante, whose work was his favorite reading, to be buried in the humble habit of a member of the Third Order of St. Francis. He is said to have valued his fellowship with the sons of the poor little man of Assisi more than the many honorary fellowships of various kinds which had been conferred upon him by the scientific societies all over Europe. End of section 10.
Section 11 of Makers of Modern Medicine. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Read by Julie Shuck. Makers of Modern Medicine by James Joseph Walsh. Laennec, Martyr to Science. A quote from Freud. The knowledge which a man can use is the only real knowledge, the only knowledge which has life and growth in it, and converts itself into practical power. The rest hangs like dust about the brain, or dries like raindrops off the stones. Laennec, Martyr to Science. On August 13th, 1826, there died at Quimper in Brittany at the early age of 45 one of the greatest physicians of all time. His name, René Théodore Laennec, was destined to be forever associated with one of the most fruitful advances in medicine that has ever been made, and one which practically introduced the modern era of scientific diagnosis. At the present time, the most interesting phase of medical development is concerned with the early recognition and the prevention of tuberculosis. To Laennec, more than to any other, is due all the data which enabled a physician of the 20th century to make the diagnosis of tuberculosis with assurance, and to treat it with more confidence than before, and so prevent its spread as far as that is possible. The history of pulmonary consumption in its most modern phase is centered around the names of three men, Laennec, Villemain, and Koch. To Laennec will forever belong the honor of having fixed definitely the clinical picture of the disease, and of having separated it by means of auscultation and his pathological studies from all similar affections of the lungs. Villemain showed that it was an infectious disease, absolutely specific in character and capable of transmission by inoculation from man to the animal. To Koch, the world owes the knowledge of the exact cause of the disease and consequently of the practical method for preventing its spread. The isolation of the bacillus of tuberculosis is the great triumph of the end of the 19th century, as the separation of disease from all others by Laennec was the triumph of the beginning of that century. There is still room for a fourth name in the list, that of the man who will discover a specific remedy for the disease. It is to be hoped that his coming will not be long delayed. The estimation in which Laennec was held by the most distinguished among his contemporaries may be very well appreciated from the opinions expressed with regard to him and his work by the best-known Irish and English clinical observers of the period. Dr. William Stokes, who was himself, as we shall see, one of the most important contributors to our clinical knowledge of diseases of the heart and lungs in the 19th century, said with regard to the great French clinician whom he considered his master, "Time has shown that the introduction of auscultation and its subsidiary physical signs has been one of the greatest boons ever conferred by the genius of man on the world. A new era in medicine has been marked by a new science, depending on the immutable laws of physical phenomena, and, like the discoveries founded on such a basis, similar in its application and easily understood, a gift of science to a favored son, one by which the ear is converted into the eye, the hidden recesses of visceral disease open to view, a new guide to the treatment, and a new help to the ready detection, prevention, and cure of the most widely spread diseases which affect mankind." Dr. Addison, who is best known by the disease which since his original description has been called by his name, was no less enthusiastic in praise of Laennec's work. He said, "Were I to affirm that Laennec contributed more towards the advancement of the medical art than any other single individual, either of ancient or of modern times, I should probably be advancing a proposition which, in the estimation of many, is neither extravagant nor unjust. His work, De l'auscultation mediate, will ever remain a monument of genius, industry, modesty, and truth. It is a work in perusing which every succeeding page only tends to increase our admiration of the man, to captivate our attention, and to command our confidence. We are led insensibly to the bedside of his patients. We are startled by the originality of his system. We can hardly persuade ourselves that any means so simple can accomplish so much, can overcome and reduce to order the chaotic confusion of thoracic pathology, and hesitate not in the end to acknowledge our unqualified wonder at the triumphant confirmation of all he professed to accomplish. These tributes to Laennec, however, from men who were his contemporaries across the Channel, have been more than equaled by distinguished physicians on both sides of the Atlantic at the end of the 19th and the beginning of the 20th century. While we might hesitate to accept the opinions of those who had been so close to him at the beginning of the new era of physical diagnosis, there can be no doubt now, after the lapse of 3/4 of a century, of what Laennec's influence really was, and the tributes of the 20th century place him among the few great geniuses to whom scientific medicine owes its most important advance. At the annual meeting of the State Medical Society of New York, held in Albany at the end of January 1903, the president of the society, Dr. Henry L. Elsner of Syracuse, in his annual address devoted some paragraphs to a panegyric of Laennec. He wished to call attention to what had been accomplished for scientific medicine at the beginning of the last century by a simple, observant practitioner. In the course of his references to Laennec and his work, he said, "It is by no means to be considered an accident that among the greatest advances in medicine made during the century just closed, the introduction of pathological anatomy and auscultation into the practice of medicine at the bedside were both affected by the same clear mind, Laennec. He is one of the greatest physicians of all time." He then quoted the opinion of a distinguished English clinician, Professor T. Clifford Allbutt, who is well known, especially for his knowledge of the history of medicine. Professor Allbutt is the Regius Professor of Physic, a term about equivalent to our practice of medicine, of Cambridge University, England, and was invited to this country some years ago as a representative of English medicine to deliver the Lane Lectures in San Francisco. During his stay in this country, he delivered a lecture at Johns Hopkins University on medicine in the 19th century, in which he said, "Laennec gives me the impression of being one of the greatest physicians in history, one who deserves to stand by the side of Hippocrates and Galen, Harvey and Sydenham." Without the advances of pathology, Laennec's work could not have been done. It was a revelation of the anatomy of the internal organs during the life of the patient. René Théodore Hyacinthe Laennec, who is thus conceded by 20th century medicine a place among the world's greatest medical discoverers, was born February 17, 1781, at Quimper in Bretagne, that rocky province at the north of France, which has been the sturdy nursing mother of so many pure Celtic Frenchmen, who have so mightily influenced the thought not only of their own country, but of all the world. The names of such Bretons as Renan and Lamennais have a universal reputation, and the province was even more distinguished for its scientists. There was published a few years ago in France a detailed history of Breton physicians. This work sketches the lives of the physicians of Breton birth from the 16th to the 20th century. Only those of the 19th century concern us, but the list even for this single century includes such distinguished names as Broussais, whose ideas of physiology dominated medicine for nearly the whole of the first half of the 19th century; Jobert, the famous French surgeon whose reputation was worldwide; Alphonse Guérin, another distinguished surgeon, whose work in the protection of wounds in some respects anticipated that of Lister; Chassignac, to whose inventive genius surgery owes new means of preventing hemorrhage and purulent infection, and who introduced the great principle of surgical drainage; finally, Maisonneuve, almost a contemporary, whose name is a household word to the surgeons of the present generation. Without mentioning for the moment the subject of this sketch, Laennec, the greatest of them all. 6 greater men have never come from one province in the same limited space of time. Bretagne, the land of granite covered with oaks, as the Bretons love to call it, may well be proud of its illustrious sons of the century just past. Taken all together, they form a striking example of how much the world owes to the children of the countryside, who, born far from the hurrying bustle of city life, do not have their energies sapped before the proper time for their display comes. These Bretagne physicians, illustrious discoverers and ever faithful workers, are at the same time a generous tribute to the influence of the simple, honest sincerity of well-meaning parents, whose religious faith was the wellspring of humble model lives that formed a striking example for their descendants. The foundations of many a great reputation were laid in the simple village homes, far from the turmoil and the excitement of the fuller life of great cities. The Bretons are but further examples of the fact that for genuine success in life, the most precious preparation is residence in the country in childhood and adolescent years. The country districts of Normandy, the province lying just next to Bretagne, have furnished even more than their share of the Paris successes of the century, and have seen the Norman country boys the leaders of thought at the capital. Laennec's father was a man of culture and intelligence, who, though a lawyer, devoted himself more to literature than to his casebooks. His poetry is said to recall one of his better-known compatriots, de Forges-Maillard. Laennec was but 6 years old when his mother died. His father seemed to have felt himself too much preoccupied with his own work to assume the education of his son, and so the boy Laennec was placed under the guardianship of his granduncle, the Abbé Laennec, and lived with him for some years in the parish house at Elian. A relative writing of Laennec after his death says that the boy had the good fortune to be thus happily started on his path in life by a hand that was at once firm and sure. The training given him at this time was calculated to initiate him in the best possible way into those habits of application that made it possible for him to make great discoveries in after life. The boy was delicate besides, and the house of the good old rector-uncle was an excellent place for him, because of its large and airy rooms and the thoroughly hygienic conditions in which it was kept. Household hygiene was not as common in those days as in our own, and child mortality was higher, but the delicate boy thrived under the favorable conditions. Besides, the parish house was situated in the midst of a beautiful country. The perfectly regular and rather serious life of the place was singularly well adapted to develop gradually and with due progression the precious faculties of a young, active mind and observant intelligence. This development was accomplished, besides, without any excitement or worry, and without any of the violent contrasts or precocious delusions of city life. The boy passed some 4 or 5 years with his granduncle the priest, and then went to finish his studies with a brother of his father, Dr. Laennec, a physician who had left a deservedly honored name. At this time, Dr. Laennec was a member of the Faculty of Medicine at the University of Nantes. The growing lad seems to have been wonderfully successful in his studies, and a number of prizes gained at school show how deeply he was interested in his work. During this time, he learned English and German and became really ready to begin the study of the higher sciences. Besides working at his academic studies, Laennec paid some attention to his uncle in his professional work, and by careful observation laid the foundation for his medical studies. His character as an observer, rather than a student of books, showed itself very early. He devoted himself to the clinical investigation of cases in the military hospital and was especially interested in the study of anatomy. In 1800, at the age of 19, he went to Paris. It was typical of the man and his careful thoroughness in all through life that the first impulse, when he found himself free to work for himself, was to try to make up for what he considered defects in his elementary studies. It must not be forgotten that the 10 years of Laennec's life, from his 10th to his 20th year, came in the stormy time of the French Revolution, and that school regularity was very much disturbed. His first care, then, was to take up the study of Latin again. He learned to read and write the language with elegance and purity. Later on, occasionally, he delivered his clinical lectures, especially when foreigners were present, in Latin. We shall have the occasion to see, before the end of this article, with what easy grace he learned to use it, from some passages of the preface of his book, written in that language. He did not allow his accessory studies, however, to interfere with his application to his professional work. He was one of those rare men who knew how to rest his mind by turning it from one occupation to another. When scarcely more than a year in Paris, Laennec secured the 2 first prizes for medicine and surgery in the medical department of the University of Paris. In 1804, he wrote 2 medical theses, one of them in Latin, the other in French. The subject of both was Hippocrates, the great Greek father of medicine, whom Laennec admired very much, and whose method of clinical observation was to prove the keynote of the success of Laennec's own medical career. At this time, the Paris School of Medicine had 2 great rival teachers. One of them was Corvisart, who endeavored to keep up the traditions of Hippocrates and taught especially the necessity for careful observation of disease. The other was Pinel, famous in our time mainly for having stricken the manacles from the insane in the asylum of Paris, but who was known to his contemporaries as a great exponent of what may be called philosophic medicine. Corvisart taught principally practical medicine at the bedside. Pinel mainly the theory of medicine by the analysis of disease conditions and their probable origin. Needless to say, Laennec's sympathies were all with Corvisart. He became a favorite pupil of this great master, who did so much for scientific medicine by introducing the method of percussion, invented nearly half a century before by Auenbrugger, but forgotten and neglected, so that it would surely have been lost but for the distinguished Frenchman's rehabilitation of its practice. Corvisart was a man of great influence. He had caught Napoleon's eye. The great emperor of the French had the knack for choosing men worthy of the confidence that he wished to place in them. His unerring judgment in this matter led him to select Corvisart as his personal physician, at a moment when his selection was of the greatest service to practical medicine. For no one was doing better scientific work at the time, and this quasi-court position at once gave Corvisart's idea a vogue they would not otherwise have had. End of section 11. Section 12 of Makers of Modern Medicine. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Read by Julie Schuck. Makers of Modern Medicine by James Joseph Walsh. Laennec, Martyr to Science. Corvisart's most notable characteristic was a sympathetic encouragement of the work of others, especially in what concerned actual bedside observation. Laennec was at once put in the most favorable circumstances, then, for his favorite occupation of studying the actualities of disease on the living patient and at the autopsy. For nearly 10 years, he devoted himself almost exclusively to the care and study of hospital patients. In 1812, he was made physician to the Beaujon Hospital, Paris. 4 years later, he was transferred to the Necker Hospital, where he was destined to bring his great researches to a successful issue. To the Necker Hospital, before long, students from all over the world flocked to his clinical lectures to keep themselves in touch with the great discoveries the youthful master was making. In spite of rather delicate health, Laennec fulfilled his duties of physician and professor with scrupulous exactitude and with a self-sacrificing devotion that was, unfortunately, to prove detrimental to his health before very long. One of his contemporaries says of him, "Laennec was almost an ideal teacher. He talked very easily, and his lesson was always arranged with logical method, clearness, and simplicity. He disdained utterly all the sacrifices of oratory. He knew, however, how to give his lectures a charm of their own. It was as if he were holding a conversation with those who heard him, and they were interested every moment of the time that he talked. So full were his lectures of practical instruction." Another of his contemporaries says naively, "At the end of the lesson we did not applaud because it was not the custom." Very few, however, who had heard him once failed to promise themselves the pleasure of assisting at others of his lectures. The work on which Laennec's fame depended, and the discovery with which his name, in the words of our great American diagnostician, Austin Flint the Elder, will live to the end of time, was concerned with the practice of auscultation. This is the method of listening to the sounds produced in the chest when air is inspired and expired in health and disease, and also to the sound produced by the heart and its valves in health and disease. Nearly 2 centuries ago, in 1705, an old medical writer quoted by Walsh in his treatise on the disease of the lungs and heart said very quaintly but very shrewdly, "Who knows but that one may discover the works performed in the several offices and shops of a man's body by the sound they make, and thereby discover what instrument or engine is out of order?" It was just this that Laennec did. He solved the riddle of the sounds within the human workshop, to continue the quaint old figure, and pointed out which were the results of health and which of disease. Not only this, but he showed the difference between the sounds produced in health and disease by those different engines, the lungs and the heart. The way in which he was led to devote his attention originally to the subject of auscultation is described by Laennec himself, with a simplicity and directness so charmingly characteristic of the man, of his thoroughly Christian modesty, of his solicitude for even the slightest susceptibility of others, and of his prompt inventive readiness, that none of his biographers has been able to resist the temptation to quote his own words with regard to the interesting incident, and so we feel that we must give them here. He says, "In 1816, I was consulted by a young person who was laboring under the general symptoms of a diseased heart. In her case, percussion and the application of the hand, what modern doctors call palpation, were of little service because of a considerable degree of stoutness. The other method, that namely of listening to the sounds within the chest by direct application of the ear to the chest wall, being rendered inadmissible by the age and sex of the patient, I happened to recollect a simple and well-known fact in acoustics, and fancied it might be turned to some use on the present occasion. The fact I allude to is the great distinctness with which we hear the scratch of a pin at one end of a piece of wood on applying our ear to the other. Immediately on the occurrence of this idea, I rolled a quire of paper into a kind of cylinder and applied one end of it to the region of the heart and the other to my ear. I was not a little surprised and pleased to find that I could thereby perceive the action of the heart, in a manner much more clear and distinct than I had ever been able to do by immediate application of the ear. From this moment, I imagined that the circumstance might furnish means for enabling us to ascertain the character, not only of the action of the heart, but of every species of sound produced by the motion of all the thoracic viscera, and consequently for the exploration of the respiration, the voice, the rails, and perhaps even the fluctuations of fluid effused in the pleura or pericardium. With this conviction, I forthwith commenced at the Necker Hospital a series of observations, from which I have been able to deduce a set of new signs of the diseases of the chest. These are for the most part certain, simple, and prominent, and calculated perhaps to render the diagnosis of the diseases of the lungs, heart, and pleura as decided and circumstantial as the indications furnished to the surgeons by the finger or sound, in the complaints wherein these are of use. This is the unassuming way in which Laennec announces his great discovery. He did not, in modern fashion, immediately cry, "Eureka!" and announce the far-reaching importance of his method of diagnosis. For 2 years, he devoted himself to the patient study of the application of his method and the appreciation of its possibilities and its limitations. Then he presented a simple memoir to the French Academy of Sciences on the subject. A committee of 3, then distinguished members of the Academy, Doctors Portal, Pelletan, and Percy, were named to investigate the new discovery. It is rather interesting to notice, though almost needless to say, that the names of these men would be now absolutely unremembered in medical history, but for the fortuitous circumstance that made them Laennec's investigators. Such is too often the ephemeralness of a contemporary reputation. Fortunately for the committee, they reported favorably upon Laennec's discoveries. It is not always true of new and really great advances in medicine that they are received with proper appreciation upon their first announcement. Even Harvey said of his discovery of the circulation of the blood that he expected no one of any reputation in his own generation to accept it. It is not very surprising to find, then, in the matter of the Laennec investigators, that there is a cautious reserve in their report, showing that they were not too ready to commit themselves to a decided opinion on the importance of the new discovery, nor to any irretrievable commendation. The important part of the discovery was supposed to consist in the use of the wooden cylinder which Laennec came to employ instead of the roll of paper originally used. This wooden cylinder, now familiar to us under the excellent name invented for it by Laennec himself, is the modern single stethoscope. This instrument is of great service. The really important part of Laennec's work, however, was not the invention of the stethoscope, but the exact observation of the changes of the breath sounds that could be noted with it in various forms of chest diseases. Laennec succeeded in pointing out how each one of the various diseases of the heart and lungs might be recognized from every other. Before his time, most of the diseases of the lungs, if accompanied with any tendency to fever particularly, were called lung fever. He showed the difference between bronchitis and pneumonia, pneumonia and pleurisy, and the various forms of tuberculosis, and even the rarer pathological conditions of the lung, such as cancer, or the more familiar conditions usually not associated with fever, emphysema, and some of the forms of retraction. With regard to heart disease, it was before Laennec's discovery almost a sealed chapter in practical medicine. It was known that people died from heart disease often, and not infrequently, without much warning. The possibility that heart conditions could be separated one from another, and that some of them could be proved to be comparatively harmless, some of them liable to cause lingering illness, while others were surely associated with the probability of sudden fatal termination, was scarcely dreamed of. It is to Laennec's introduction of auscultation that modern medicine owes all its exacter knowledge of heart lesions and of their significance. He himself did not solve all the mysteries of sound here, as he did in the lungs. Indeed, he made some mistakes that render him more sympathetic because they bring him down to the level of our humanity. He did make important discoveries with regard to heart disease, and his method of diagnosis during his own life was, in the hands of the Irish school of medicine, to prove the key to the problems of disease he failed to unlock. Almost at once, Laennec's method of auscultation attracted widespread attention. From Germany, from Italy, from England, even from the United States. In those days when our medical men had so few opportunities to go abroad, medical students and physicians went to Paris to study the method under the direction of the master himself, and to learn from him his admirable technique of auscultation. Those who came found that the main thing to be seen was the patient observation given to every case and Laennec's admirably complete examination of each condition. The services to diagnosis rendered by the method were worthy of the enthusiasm it aroused. Only the work of Pasteur has attracted corresponding attention during the 19th century. Physicians practice auscultation so much as a matter of course now that it is hard to understand what an extreme novelty it was in 1820, and how much it added to the confidence of practitioners in their diagnosis of chest diseases. Boulin said, with an enthusiasm that does not go beyond literal truth, "A sense was lacking in medicine, and I would say, if I dared, that Laennec the creator, by a sort of divine delegation of a new sense, supplied the long-felt want. The sense which medicine lacked was hearing. Sight and touch had already been developed in the service of medical diagnosis. Hearing was more important than the other two senses, and in giving it to scientific medicine, Laennec disclosed a new world of knowledge, destined to complete the rising science of diagnosis." Henri Roger said, "Laennec, in placing his ear on the chest of his patient, heard for the first time in the history of human disease the cry of suffering organs. First of all, he learned to know the variations in their cries and the expressive modulations of the air-carrying tubes and the orifices of the heart that indicate the points where all is not well. He was the first to understand and to make others realize the significance of this pathological language, which, until then, had been misunderstood, or, rather, scarcely listened to. Henceforth, the practitioner of medicine, endowed with one sense more than before, and with his power of investigation materially increased, could read for himself the alterations hidden in the depths of the organism. His ear opened to the mind a new world in medical science." The freely expressed opinions of distinguished German, English, and American physicians show that these enthusiastic praises from his French compatriots are well deserved by Laennec, for the beautifully simple yet wonderfully fecund method that he placed before the medical profession in all its completeness. The first employment of the stethoscope, by rolling up sheets of paper, is of itself a sign of his readiness of invention. He made his own stethoscopes by hand, and liked to spend his leisure time fashioning them carefully and even ornately. One of the stethoscopes certainly used by him, and probably made by him, is to be seen in the Museum of the College of Physicians of Philadelphia. After 3 years of study and patient investigation of the use of auscultation in pulmonary and cardiac diagnosis, Laennec wrote his book on the subject. This is an immortal work, a true classic in its complete treatment of the subject. We have had thousands of books written on the subject since Laennec's time, and yet no physician could do better at the present moment than study Laennec's 2 comparatively small volumes to learn the art of physical diagnosis. It is a characteristic of genius to give a completeness to work that endows it with an enduring independent vitality. Almost innumerable disciples follow in the footsteps of a teacher, and each thinks that he adds something to the fullness of the revelation made by the master. At the end of a century, the 4th generation finds that scarcely anything has been added, and that the master's work alone stands out, not merely as the great central fact of the new theory or doctrine, but as the absolute vital entity to which the other supposed discoveries are only adventitious and not entirely indispensable accessories. Dr. Austin Flint the Elder, admittedly one of the greatest diagnosticians in pulmonary and heart diseases that we have ever had in America, said on this subject, "Suffice it to say here that, although during the 40 years that have elapsed since the publication of Laennec's work, The application of physical exploration has been considerably extended and rendered more complete in many of its details. The fundamental truths presented by the discoverer of auscultation not only remain as a basis of the new science, but for a large portion of the existing superstructure. Let the student become familiar with all that is now known on this subject, and he will then read the writings of Laennec with amazement that there remained so little to be altered or added. Laennec's unremitting devotion to his hospital work finally impaired his health. He was never robust, and strangers who came to Paris and saw him for the first time wondered that he should be able to stand the labor he required of himself. The portraits of him give a good impression of his ascetic delicacy. They convey besides a certain wistfulness, the look of one close to human suffering and unable to do all that he would wish to relieve it. Long before his discovery of the mysteries of auscultation, he had accomplished results that, of themselves, and without his subsequent master discovery, would have given him an enduring name in medical literature. Laennec's genius enabled him to make a really great discovery. But Laennec's talent, the principal part of which was an inexhaustible faculty for untiring labor, an infinite capacity for taking pains with all that he did, enabled him to make a number of smaller discoveries, any one of which would have given a great reputation to a lesser man. Some idea of the amount of work that he did in preparing himself for the observations that were to result in his discovery may be gathered from details of his earlier career. During the first 3 years of his attendance at La Charité Hospital in Paris, he drew up a minute history of nearly 400 cases of disease. As early as 1805, he read a paper on hyatidid cysts. These cysts were formerly thought to be hollow tumors formed within the tissues themselves, somewhat as other cystic tumors are formed. Laennec showed conclusively that their origin was entirely due to certain worms that had become parasites in human beings. The cysts, instead of being tumors, were really one stage of the worm's existence, and had an organization and an independent existence of their own. He gave an exact description of them and even showed that there were several types of the parasite, and described the different changes that various forms produced in the human tissues. This study of the hyatidid parasites remains a remarkable contribution to medicine, down even to our own day. During these early years, Laennec devoted himself particularly to the study of pathology. Like all the men who have made great discoveries in medicine, he understood that all true medical advance must be founded on actual observation of the changes caused by disease in the tissues, and that this knowledge can only be obtained in the autopsy room. For years, he devoted himself to the faithful study of the tissues of patients dead from various forms of disease. He wrote, as the result of this work, a treatise on peritonitis that was a distinct advance over anything known before his time, and which, in the words of Benjamin Ward Richardson, as a pathological study, was shrewdly in anticipation of the later work of one who became his most formidable rival, the famous Broussais. From the peritoneum, his attention was attracted to the liver. As early as 1804, he wrote a description of the membranes of the liver. Pathological changes in the liver continued to occupy his attention for some time, and it is to him we owe the name cirrhosis of the liver, as a term for the changes which are produced by alcohol in this gland. Alcoholic cirrhosis is often spoken of as Laennec's cirrhosis of the liver, and he was the first to point out the significance of the changes in the organ, their etiology, and the reason for the symptoms that usually accompany this condition. This work alone would have been sufficient to have made Laennec's name a permanent fixture in medical literature. During the early years of Laennec's career at Paris, the French Anatomical Society was founded, and Laennec became a prominent member of it. Corvisart, who was the moving spirit in the society, was at this time, the early years of the 19th century, doing his great teaching at the medical school of the University of Paris. He was Laennec's master, and was at the height of his glory. It was a constant source of surprise to his students to note how well the master's diagnosis agreed with post-mortem findings. This is, after all, the only true criterion of scientific diagnosis. It is not surprising that the strict application of this practical method of control of medical theory soon gave rise to a series of distinct advances in medical knowledge of the greatest importance. Discussions of cases were frequent, and Laennec took a prominent part in them. His knowledge of medicine was broadening in this great field of practice, and he was chosen as one of the contributors to the Dictionnaire des sciences médicales. His articles for this work contain much original matter of great value and suggestive views of notable importance. Laennec was the first to give a description of carcinoma encephaloides and certain especially malignant forms of cancers. He showed the distinction between pigmented spots of benignant character and those that were due to malignant disease. After all, however, says Benjamin Ward Richardson, the grand reputation of Laennec must rest on his one immortal work. It is not too much to say that any man of good intelligence could have written the other memoirs. No one less than Laennec could have written the treatise on mediate auscultation and the use of the stethoscope. The true student of medicine, who never wears out, reads this original work of Laennec once in 2 years at least, so long as he is in practice and takes a living interest in the subject of which it treats. It ranks equally with the original works of Vesalius, Harvey, and Bichat, and as a section of medical literature is quite equal to any section of Hippocrates. Some quotations from the Latin preface to the book will serve to show that Laennec appreciated the value of discovery he had made for the diagnosis of chest diseases, yet that he did not expect it to be taken up enthusiastically at once. And in his modest way, he adds that he shall be satisfied if it should serve to save but one human being from suffering and death. Unfortunately, as we have said, Laennec's untiring devotion for nearly 20 years to medical investigation caused his health to give way. It is painful to think that in the full tide of the success of his great labors, when the value of his work was only just beginning to be properly appreciated, and when he had attained a position which would satisfy even lofty ambitions, his nerves gave way, and he had many of the typical melancholic symptoms that disturb the modern neurasthenic. Fortunately, his habits of life, always extremely abstemious, and his liking for outdoor sports had been a safeguard for him. He retired to the country, and for nearly 2 years spent most of his time in the open air. It was not long before surcease from intellectual labor and indulgence in field sport restored him to health and to activity. He foresaw, however, that to go back to the city and to his scientific work would almost surely lead to another breakdown. One of his biographers states that it was the great regard which he had for his family and the powerful influence of his religious principles which alone had sufficient weight to make him leave his retreat in the country. After an absence of 2 years, he returned to Paris and once more took up his hospital duties. Soon after his return, he received the appointment of physician to the Duchess de Berry. One of the main objections to this position, in Laennec's mind, seems to have been the necessity for occasionally wearing court dress with a sword and regalia. Ordinarily, he went dressed very plainly, and it was noted that, when men of much less authority and much less practice used their own carriages, he usually took a hired cab. His position at court gave him enough influence to bring about the proper recognition of his merit as a teacher. At this time, his lectures on auscultation, although he held no regular professorship, were crowded by students from all nations. The year after his return to Paris, he was appointed professor of medicine in the College of France, and afterward of clinical medicine in the Hospital La Charité, where he had made his own studies as a medical student. End of section 12.
Section 13 of Makers of Modern Medicine. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Read by chrishavel. Makers of Modern Medicine by James Joseph Walsh. Laennec, Father of Physical Diagnosis, Part 3. About this time, he was offered a position of importance as a member of the Royal Council of Public Instruction. This he refused, however, because it would deprive him of some of the precious time that he wished to devote to the further investigation of important subjects in clinical medicine, and especially to the elaboration of his method of auscultation. One of the most striking features of Laennec's character was his absolute placidity and lack of personal ambition. His life was passed in the most complete calm. He devoted himself to his work, and had the supreme joy of duty accomplished, seeming to look for no other enjoyment in life. Those who knew him best said that they had never seen him angry or even impatient. In the midst of his discussion with Broussais, it might have been expected that there would occasionally have been some flashes of impatience, for the great protagonist of medical theory was a man of satiric character, and his supposedly scientific discussion was stained by some very bitter personalities. In spite of all Broussais' sarcasm, Laennec remained absolutely unmoved. Occasionally, his friends saw a smile at some of Broussais' emphatic asseverations, but Laennec simply continued at his work and looked straight ahead, convinced that what he was doing was for the cause of truth, and the truth would finally prevail. He was known for the kindness of his disposition and his readiness to help his friends whenever it was possible. He was never known to injure anyone, and a certain quiet elevation of spirit preserved him from all conceit. One of his most intimate Briton friends, Kirk, said, "I have never heard Laennec express by a single word, or even by the slightest insinuation, anything that might seem to indicate pride in what he had accomplished, or that might provoke a listener to say something in praise of him." The friends he made were bound to him with hoops of steel. They were not many, for he had not the time to waste on many friends. He was too devoted to his work, and too deeply interested in the great problem whose solution he foresaw meant so much for the good of humanity, to have much time for anything but his studies and his patients. With regard to Laennec's personal character, his most recent biographer, Dr. Henri Saint-Aignan, has said, "I have shown in the course of this life just what was the character of Laennec and his intellectual and moral qualities, so that it will not be necessary for me to dwell at length on this subject in concluding. His great piety, which had never been abandoned from his earliest infancy, was his main guide during all his life, without ostentation, yet without any weakness, absolutely ignoring human respect. He obeyed with utter simplicity the prescriptions of his faith. While he did not conceal his convictions when, during the First Empire, they might have proved a source of lessened esteem or positive prejudice, he made no noise about them when under the Restoration they might have proved the means of advancement and of fortune. He had not, in the slightest degree, what is so often objected to in devoted persons, namely, the love of making proselytes. The words of Professor Desgenet might very well have been applied to him, as he did not believe himself to have any mission to lead others to his opinions. He limited himself to preaching by example. The reproach of being rabidly clerical or propagandist, which was urged against him when he first became a member of the Faculty of Medicine, was absolutely unjustified. Laennec never occupied himself with politics nor with religion in public. As a physician, he devoted himself exclusively to his profession, receiving at his clinic all those who desired to follow his teaching, whatever might be their opinions or beliefs. It was not long, however, before Laennec's many labors in Paris began to tell on his health once more. His practice, after his return to health and his attachment to the court, became large and lucrative. It is characteristic of the man and his ways that he frequently refused, owing to a lack of time, to go see wealthy patients, from whom he would have received large fees. But it is said that he never refused to go see a poor patient. His hospital patients always received the most solicitous attention, and his time was almost entirely at their disposal. It was not long before Laennec himself, who had taught modern physicians so much about the diagnosis of pulmonary diseases, began evidently to suffer from pulmonary disease himself. There seems no doubt now that almost constant association with tuberculous patients in an overworked subject inclined naturally to be of underweight, and therefore especially susceptible, led to the contraction of the disease. After about 4 years in Paris, a dry, hard cough developed insidiously, gradually increased in annoyance, and finally grew so serious as to demand a return once more to his native Bretagne. He lost flesh, became subject to intermittent attacks of fever, and suffered from some pleuritic and pulmonic pains. For some time after his return to his native air, he improved. He was treated by the usual method employed at the time whenever fever accompanied any ailment. Venesection was the main part of what was then called the antiphlogistic treatment. It is needless to say he did not improve. He was suffering from exhausting disease, and the treatment became really an accessory to further exhaustion. At last, there could be no longer any doubt that the end was approaching. The old curé of the village came often to visit him, and brought to him all the consolations of religion. With his sincere Christian faith and firm conviction, it was not hard for Laennec to find the moral force and the calm necessary to secure an easy death. Finally, one day, on August 13th, his wife saw him take off his fingers, one after another, the rings he wore, and place them softly upon the table. When she asked him why he did so, he replied, "It will not be long now before someone else would have to do this service for me, and I do not wish that they should have the trouble." Even in death, he was thinking of others rather than of himself, and he was calmly facing the inevitable, thoroughly prepared for it. 2 hours afterward, at 5 o'clock in the afternoon, without there having been at any time the slightest loss of consciousness, Laennec passed away. How faithfully his family had watched over him, and how simple was the feeling of Christian confidence in all of them, may very well be gathered from the letter of his cousin Ambrose to Laennec's brother Meriadec in Paris. "My dear Meriadec, poor René is no more. His life was passed in the midst of labor and of benevolence. While he had all the virtues of the true Christian and a wisdom far beyond what was usually granted to men, they have not sufficed to obtain for him the grace of a longer life. Somehow it was ordained that this glory and ornament of our family was not to remain with us. What a sad reflection it is on our restless eagerness in this life, and on the vanity of our hopes, that a genius like this must perish just when it was about to receive the fruit of its labors. He leaves to us a name difficult to sustain, and the example of virtues that it will not be easy to imitate. Let us hope that he will watch over us in the future as he has done in the past, and that he will still continue to aid us after his death. Although I have been prepared for this sad event, I could not suspect how much grief I was to experience in losing my second master, my friend from earliest infancy, and him who I had become accustomed to consider as my eldest brother. I must confess that for some years now we have all had to pay dear for the short intervals of happiness that it has pleased heaven to accord to us." Laennec's burial took place in the cemetery of Ploeré. The attendance at the funeral was very large. Practically the entire population of the countryside came to mourn for the benefactor that they loved so much. He had made friends even among the simplest of the country people, and knew most of them by name. After his return to the country, he had improved somewhat in appearance, and the neighbors had been very glad to express their feelings of gratitude for his apparent improvement in health. Undoubtedly not a little of this state of better spirits was due to the fact that he liked Brittany and the peasants of the neighborhood so well, and always felt so much at home among them. He was mild and agreeable in his manners, and of a quiet and even temper. His conversation was lively and full of quiet humor, and his friends often said that they never came away from a conversation with him without having learned something. Toward the end of his life, when his great reputation caused him to be honored by medical men from all over the world, and when his reputation made him the lion of the hour, he lost none of his natural affability and kindness of heart. He was remarkable, especially for his great kindness and courtesy to foreigners, and he is said to have taken special care to make himself understood by English-speaking medical visitors. It must be confessed that he was somewhat less popular with his contemporaries who did not belong to his immediate circle of friends and students. One of the reasons for this was his genius, which no generation seems ready to acknowledge in any of its members. Another reason was his continued misunderstanding with Broussais. Broussais was the medical theorist of the hour, and medical theories have always been popular, while medical observation has had to wait for due recognition. There were undoubtedly good points in Broussais' theories that Laennec failed to appreciate. This is the only blot on a perfect career, taking it all in all, whether as a man or as physician. It can easily be understood with what impatience Laennec, entirely devoted himself to observation, would take up the study of what he considered mere theory, and it is easy to forgive him his lack of appreciation. Benjamin Ward Richardson says, "It was a common saying regarding Laennec by his compeers that, while he was without a rival in diagnosis, he was not a good practitioner, which means that he was not a good practitioner according to their ideas of practice, heroic and fearful. To us, Laennec would now be a practitioner very heroic, so much so that I doubt if any medical man living would, for the life of him, take some of his prescriptions. But in his own time, when so little was known of the great system of natural cure, he would be easily out of court. It was amply sufficient against him that he had a glimmering of the truth as to the existence of a considerable run of cases of organic disease, for which the so-called practice of remedial cure by drugs, bloodlettings, and other heroic plans could do no good, but was likely to do grievous harm. We are reminded of Morgagni's refusal to permit bloodletting in his own case, though he practiced it himself on others. Like Laennec, Morgagni seems to have doubted the efficacy of bloodletting at a time when, unfortunately, all medical men were agreed that it was the sovereign remedy. If Laennec was not popular with his immediate contemporaries, succeeding generations have more than made up for the seeming neglect. Less than 25 years after his death, Austin Flint, here in America, hailed him as one of the 5 or 6 greatest medical men of all times. 40 years after his death, Professor Chaffard, himself one of the distinguished medical men of the 19th century, said, "Without exaggeration, we can call the glory which has come to French medicine because of the great discovery of auscultation a national honor. It must be conceded that for a long time before Laennec, the great man of medicine, those to whom medical science owed its ground-breaking work did not belong to France. Harvey, Haller, and Morgagni had made the investigations on which are founded the circulation of the blood, experimental physiology, and pathological anatomy in other lands than ours. It almost seemed that we were lacking in the fecund possibilities of daring and successful initiative. Auscultation, however, as it came to us perfect from the hands of Laennec, has given us a striking revenge for any objections foreigners might make to our apathy. This discovery has rendered the scientific medicine of the world our tributary for all time. It was an immortal creation, and its effects will never fail to be felt. More than this, it will never be merely an historical reminiscence because of the fact that it guided men aright, but it will, in its actuality, remain as an aid and diagnostic auxiliary. Auscultation will not disappear but with medical science itself, and with this stage of our civilization which guides, directs, and enlightens it. Laennec was known for his simple Britannia faith, for his humble piety, and for uniformly consistent devotion to the Catholic Church, of which he was so faithful a member. His charity was well known, and while his purse was very ready to assist the needy, he did not hesitate to give to the poor what was so much more precious to him, and it may be said to the world also than money, his time. After his death, and only then, the extent of his charity became known. Dr. Austin Flint said of him, "Laennec's life affords an instance among many others, disproving the vulgar error that the pursuits of science are unfavorable to religious faith. He lived and died a firm believer in the truths of Christianity. He was a truly moral and a sincerely religious man." Of his death, his contemporary Bayle, who is one of his biographers, and who had been his friend from early youth, said, "His death was that of a true Christian, supported by the hope of a better life, prepared by the constant practice of virtue." He saw his end approach with composure and resignation. His religious principles, imbibed with his earliest knowledge, were strengthened by the conviction of his maturer reason. He took no pains to conceal his religious sentiments when they were disadvantageous to his worldly interests, and he made no display of them when their avowal might have contributed to favor and advancement. Surely, in these few lines is sketched a picture of ideal Christian manhood. There are those who think it wonderful to find it in a man of genius as great as Laennec. It should not be surprising, however, for surely genius can bow in acknowledgment to its creator. Shortly after the death of Pasteur, it was well said that two of the greatest medical scientists of the 19th century have given to the physicians of France a magnificent, encouraging, and comforting example. It is almost needless to say that these two were Laennec and Pasteur, and their example is not for France alone, but for the whole medical world. They were living 19th century answers to the advocates of free thought, who would say that religious belief, and especially Catholic faith, make men sterile in the realm of scientific thought. No better ending to this sketch of Laennec's life seems possible than the conclusion of Dr. Flint's address to his students in New Orleans, already so often quoted from. It has about it the ring of the true metal of sincere Christian manhood and unselfish devotion to a humanitarian profession. The career of the distinguished man, whose biography has been our theme on this occasion, is preeminently worthy of admiration. In his character were beautifully blended the finest intellectual and moral qualities of our nature. With mental powers of the highest order were combined simplicity, modesty, purity, and disinterestedness in such measure that we feel he was a man to be loved, not less than admired. His zeal and industry in scientific pursuits were based on the love of truth for its own sake, and a desire to be useful to his fellow men. To these motives to exertion, much of his success is to be attributed. Mere intellectual ability and acquirements do not qualify either to make or to appreciate important scientific discoveries. The mind must rise above the obstructions of self-love, jealousy, and selfish aims. Hence it is that most of those who have attained to true eminence in the various paths of scientific research have been distinguished for excellencies of the heart as well as of the head. The example of Laennec is worthy of our imitation. His superior natural gifts we can only admire, but we can imitate the industry without which his genius would have been fruitless. Let us show our reverence to the memory of Laennec by endeavoring to follow humbly in his footsteps. Quod Faustum Veritat. End of section 13.
Section 14 of Makers of Modern Medicine. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Read by ijtufts. Makers of Modern Medicine by James Joseph Walsh. The Irish School of Medicine. Graves, Stokes, Corrigan. Part 1. There are men and classes of men that stand above the common herd, the soldier, the sailor, and the shepherd not infrequently, the artist rarelier still, the clergyman, the physician almost as a rule. He is the flower, such as it is, of our civilization, and when that stage of man is done with, and only to be marveled at in history, he will be thought to have shared as little as any in the defects of the period, and most notably exhibited the virtues of the race. Robert Louis Stevenson, Preface to Underwoods. The physician who is not also a scholar may be a more or less successful practitioner, but his influence will be confined, his methods mechanical, and his interests narrow. The doctor, the lawyer, and the minister of religion can do but inferior work, unless to a knowledge of their several sciences they bring the insight, the wide outlook, and the confidence which nothing but intimate acquaintance with the best that has been thought and said can confer. The more accomplished the specialist, the greater the need of the control which philosophic culture gives. Bishop Spalding. The Irish School of Medicine. Robert Graves, M.D. Footnote 1. For much of the material embodied in this series, I am indebted to Sir Charles Cameron, the historian of the Royal College of Surgeons in Ireland, whose courtesy to me while on a visit to Dublin in 1904 is one of the precious memories I shall always cherish. At the same time, Sir Christopher Nixon and Sir John Moore, for letters of introduction to whom I was indebted to Professor Osler, not only gave me valuable suggestions, but demonstrated how kind is the Celtic nature at its best. It has been always generally recognized that a very important portion of what is called English literature is really due to the native genius of the English-speaking writers of Irish birth and parentage, whose Celtic qualities of mind and heart have proved the sources of some of the most significant developments in the language of their adoption. What a large lacuna would be created in English literature by the removal from it of the work of such men as Dean Swift, Goldsmith, Burke, Sheridan, and Moore. It is not so generally known, however, that if the work of the distinguished Irish physicians and surgeons of the last century were to be blotted out of English medical literature, there would be left quite as striking and as wide a gap. It is indeed to what is known as the Dublin School of Medicine, for medical schools have very properly been named usually after the cities rather than the countries in which they were situated, that we owe not a little of our modern progress in practical medicine, and especially the advance in the clinical teaching of the medical sciences. Now that the Gaelic movement is calling attention more than ever before to things Irish, it seems only proper that this feature of the national life should be given its due prominence, and that the great members of the Irish School of Medicine should not be without honor in their own and other English-speaking countries. There are three great names in the history of Irish medicine recognized by all the world as well deserving of enduring fame. These three names are Robert James Graves, William Stokes, and Dominic Corrigan. Graves' name is indelibly attached to the disease known as exophthalmic goiter, which he described and separated from other affections before anyone else had realized its individuality. William Stokes was perhaps the best authority on diseases of the heart and lungs in his time. His name will be preserved in the designation of the peculiar form of breathing which occurs in certain comatose conditions, and has received the name Cheyne-Stokes respiration, in honor of the men who first called attention to it. Corrigan was in his time one of the greatest authorities on the heart, and especially on the pulse. His name is preserved in the term Corrigan pulse, which is applied to a peculiar condition that occurs very characteristically in disease of the aortic valves of the heart. The lives of these men deserve to be better known, for they can scarcely fail to be an inspiration to others to do work of a high order in medicine, work that will represent not alone present success and emolument, but will stand for medical progress for all time. Dr. Robert Graves was the youngest son of the Reverend Richard Graves, D.D., Senior Fellow of Trinity College, and Regius Professor of Divinity in the University of Dublin, and of Elizabeth, daughter of James Draft, also a Fellow of Trinity College, whose family had been long settled in Kings County. His father, as a tribute to his distinguished learning, was later promoted to the deanery of Armagh. There were two other sons in the family, Richard and Hercules. All three of the boys passed through Trinity College with high honors and, in fact, established a record there that has since been unequaled, for at the degree examinations of 3 successive years, the gold medals in classics and in science, then the highest distinctions attainable by students of Trinity, was conferred upon one of the brothers. Dr. Graves received his degree of Bachelor of Medicine at the University of Dublin in 1818. After this, he studied for some time in London, and then spent 3 years on the continent, at Berlin, Göttingen, Vienna, and Copenhagen, as well as in Paris and certain Italian schools, finally studying also for some months in Edinburgh before his return to Dublin. As Dr. Stokes very well says, "In this large and truly liberal education, which embraced the training of the school, the university, and the world, we can discover in part the foundations of his subsequent eminence. He did not content himself, as is so commonly the case, with commending, to use his own words, the life of a practitioner without practice, but he made himself intimate with the recent discoveries and modes of thinking in every great school of medicine, whether abroad or at home, and formed friendships with the leading physiologists and physicians of Europe, with many of whom he kept up a correspondence during his life. An interesting incident in his travels serves to illustrate very well his facility for the acquisition of languages. Once, while on a pedestrian journey in Austria, he neglected to carry his passport and was arrested as a spy. He was thrown into prison, and for a time his condition seemed serious enough. He insisted that he was a British subject, but his assertions in this matter were immediately repudiated by the Austrian authorities in the little town, who insisted that no Englishman could possibly speak German as well as he did. He was kept in prison for some 10 days, until authentic information could be obtained with regard to him, and, during this time, such was the state of the prison that he suffered many privations. Later in life this gave him a sympathy with the prisoners of Ireland, and led to his making suggestions for the amelioration of their condition. Like practically all the great medical men who have proved to be original workers, Graves' interest was not confined alone to medicine. During his sojourn in Italy, he became acquainted with Turner, the celebrated English landscape painter, and was his companion in many journeys. Graves himself was possessed of no mean artistic powers, as his friend Stokes tells us, and his sketches are characterized by natural vigor and truth. His thorough appreciation of his companion, however, and the breadth of his sympathy and admiration for the great painter of nature can perhaps best be understood from some candid expressions of his with regard to their work in common. "I used to work away," he said, "for an hour or more, and put down as well as I could every object in the scene before me, copying form and color as faithfully as was possible in the time. When our work was done and we compared drawings, the difference was strange. I assure you there was not a single stroke in Turner's drawing that I could see like nature, not a line nor an object, and yet my work was worthless in comparison with his. The whole glory of the scene was there." After wandering for some 3 years in Europe, Graves returned to Dublin and at once took a leading position in his profession as well as in society. He came back at a very fortunate period for him. In 1807, Dr. Cheyne, who had been educated in Edinburgh, made the first step toward the foundation of a new school of medical observation by the publication of the first volume of the Dublin Hospital Reports. Dr. Stokes says that the best proof of the value of these reports is that they appear to have given the tone to the subsequent labors of the Irish school, which inherited their practical nature and truthfulness. Within a year after Graves' return, he appeared as one of the founders in the new school of medicine in Park Street, and was also elected physician to the Meath Hospital, where he commenced to put into effect that system of clinical observation and instruction which has done so much to establish the lasting reputation of the Dublin School of Medicine. For the next 30 years, Graves' life is full of the teaching and the practice of medicine. He was noted for his tenderness toward the poor, but the rich soon came to appreciate his skill. Nothing ever made him neglect his poor patients. Meantime, he left his mark on every subject that he handled in medicine. Fevers, nervous diseases of many kinds besides that named after him, tuberculosis, and other forms of pulmonary disease were all illuminated by his practical genius in a way that has made them clear for succeeding generations in medicine. With regard to fevers especially, Graves' work will count for all time, because he set their treatment on so practical a basis. The trained nurse is quite a modern acquisition, yet 75 years ago, Dr. Graves insisted that the services of a properly qualified nurse in severe continued fever are inestimable. He emphasized the necessity for moral management in fever, and friends and relatives are seldom capable of discharging this office. If they chance to discover from the physician's remarks or questions the weak points of the patient's case, they generally contrive to let him know them in some way or another. If the patient is restless, for instance, the ill-judged anxiety of his friends will most certainly keep him from sleeping. If he happens to take an opiate, and they are aware of the nature of his medicine, they will surely inform him of it in some way or another, though it may be only by a hint, and his anxiety for sleep, conjoined with their disturbing inquiries, prevents its due operation. We are apt to think that the modern aphorism, nursing, meaning trained care, is more important than medicine in the treatment of fever, is the result of observations in our own day. Dr. Graves, however, felt very deeply that the most important element in the treatment is the conservation of the patient's strength with the preservation of his morale, and this can be best accomplished when the patient is constantly under the care of an experienced nurse, noting every symptom and averting every possible source of worry and every form of exhaustion of energy. With regard to fever treatment, however, Graves' name is immortal in medicine because of his insistence on the doctrine that fever patients must be fed. A century ago, the presence of fever was supposed definitely to indicate that the patient should have no food. Any contribution to his nutrition was supposed to feed the fever rather than the patient. Graves pointed out, however, that at the end of a long-continued fever, the most serious condition is the emaciation and weakness of the patient. He insisted that, appetite or no appetite, fever patients should be fed regularly. The result was at once noteworthy. Only the very hardy individuals had recovered before this. Now, even weaker patients had a good chance for life. The mortality from fever fell very strikingly, and in his time, Dublin was overrun with typhoid and typhus fever, and the saving of life produced by the new method of treatment was very considerable. Graves himself, when he saw how much he had accomplished by his new doctrine, said that he wanted no better epitaph on his tombstone than the words, "He fed fevers." Some of Dr. Graves' very particular hints with regard to treatment of fever show how careful he was in clinical observation. He deprecates the allowance of very much fluid for patients, since their thirst cannot be assuaged in that way, and the amount of liquid taken may be harmful for causing depression. He suggests, therefore, the use of acidulated water made by means of a little currant jelly or raspberry vinegar, given in small portions and at regular intervals. Much better than plain water, he considers water to which some light bitter has been added, such as cascarilla. Some quantities of this will appease the morbid thirst of fever more effectually and for a much longer period than large draughts of water. Even more interesting in these modern times, however, than Graves' attitude toward the treatment of fever is the position he took with regard to the habits of life that were best for the consumptive. At that time, tuberculosis of the lungs was considered to be an inflammatory disease, requiring the patient to be in the house most of the time, carefully protected from cold, and during any rise of temperature to be kept in warm rooms, without any special encouragement to take food. Graves and Stokes changed all that, and for the time completely revolutionized the principles of treatment for this serious ailment. Alas, their work, notwithstanding the good results shown in a certain number of cases, failed to attract widespread attention, and not until our own time did the principles that they laid down as the rational basis of successful therapeutics for tuberculosis come to be generally adopted. Graves insisted that his patients, when suffering from beginning tuberculosis, should not be confined to the house, but on the contrary should be out of doors most of the time. He emphasized what he called the taking of exercise, but in such a way that he agrees much more than might be thought with modern ideas on this subject. Now, it is insisted that tuberculosis patients must not overtire themselves by taking exercise, though they must be in the open air a large part of the time. Graves explains the exercise that he would like to have them take by saying that they should spend 4 or 5 hours every day riding in a carriage, or, as he seems to prefer, in an open jaunting car, and that they should spend at least as much time sitting outside in quiet. Besides this, the most important element in treatment he considers to be the encouragement of the appetite, as might be expected from the man who first fed fevers. His directions in this matter are very explicit, and he suggests various methods by which patients can be tempted to eat more and more food, and emphasizes the use of cereals and of milk and eggs as likely to be of most service in helping these patients to gain in weight and strength so as to be able to resist the further advance of the disease. This, it may be said in passing, is just the ideal treatment for the consumptive at the present time. Others of Graves' opinions in regard to tuberculosis are in general surprisingly modern. He insists, for instance, that the main causes of the disease are overcrowding in towns, the long hours of hard work in factories, and abuse of alcohol. He thought that the population of country places, though fed no better as a rule than in the city, do not develop the disease so frequently because of their opportunity for fresh air. He placed very little confidence in the opinion that cold has anything to do with tuberculosis, though he disputed Laennec's dictum that bronchitis was never the beginning of tuberculosis. Graves advises his students not to try to protect their throats by means of mufflers, for this will only render them more liable to cold. His advice is rather to harden themselves against cold. For this, he suggests the use of water plentifully on the chest and throat, to be employed not too cold during the winter time, unless one is used to it. He also suggests the use of vinegar and alcohol as hardening fluids. They should be applied frequently, and in his experience were effective. Another interesting anticipation of modern methods was with regard to child feeding and summer diarrhea. It is often thought that only in recent years, with the development of the science of bacteriology, the danger of continuing milk feeding when infants are already ill in the summer has come to be recognized. Milk is now known to be an excellent culture medium for various forms of bacteria. That is, it is a substance on which microbes grow plentifully, and it is often used in the laboratory to raise microbes. Dr. Graves, however, without any knowledge of modern bacteriology, but from clinical observation alone, pointed out that the only way to avoid summer diarrhea is to stop all milk feeding. Let the infant, he says, abstain from milk in any shape for 24 hours, sometimes for the space of 2 or even 3 days. It is incredible how small a portion of milk, even in the most diluted state, will keep up this disease, acting like a species of poison on the intestinal mucus surface. Here, of course, was scientific intuition running far beyond medical knowledge, and pointing out a serious danger and the best means of avoiding it. There is scarcely a subject touched upon in Dr. Graves' clinical lectures, however, which is not illuminated in this way by precious sidelights, many of which unfortunately were obscured by medical theories and conclusions founded on them without due experience. We have already said that his careful clinical observations led him to separate the type of disease, which has since come to be known as Graves' disease, from a number of other forms of nervous disturbances of the heart rhythm. There is at least one other class of disease usually considered to be much more modern, the type of affection known as Raynaud's disease, or a tendency to spontaneous stoppage of the circulation in the extremities, and also the other type, now known as Weir-Mitchell's disease, or erythromelalgia, in which there is suffused redness and pain in the extremities, examples of which Graves picked out from his hospital service, and described in such a way that it is easy to recognize them even at this distance of time. His 2 volumes of clinical lectures on the practice of medicine are much more than an index of the medical teaching of his time. They contain anticipations of many a supposed after-discovery, besides an immense amount of very practical observations made at the bedside, and valuable hints for treatment, the result of his personal experience. End section 14.
Section 15 of Makers of Modern Medicine. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Read by J.T. Gardell. Makers of Modern Medicine by James Joseph Walsh. The Irish School of Medicine. Graves, Stokes, Corrigan. Part 2. One of the best proofs of the greatness of the work accomplished by Graves is to be found in the tribute to his character, and what he achieved, by Professor Trousseau, who was at the time the acknowledged leader of the clinicians of Europe. He said, "For many years I have spoken of Graves in my clinical lectures. I recommend the perusal of his work. I entreat those of my pupils who understand English to consider it as their breviary. I say and repeat that, of all the practical works published in our time, I am acquainted with none more useful, more intellectual, and I have always regretted that the clinical lectures of the great Dublin practitioner have not been translated into our language." A little later in the same lecture he said, "And nevertheless, when he inculcated the necessity of giving nourishment in long-continued fevers, the Dublin physician, single-handed, assailed an opinion which appeared to be justified by the practice of all ages. For low diet was then regarded as an indispensable condition in the treatment of fevers. Had he rendered no other services than that of completely reversing the medical practice upon this point, Graves would, by that act alone, have acquired an indefeasible claim to our gratitude." His tribute closes with the following very striking passage. "I freely confess that I had some difficulty in accepting, notwithstanding the imposing authority of Graves, what he states of the influence of certain remedies, such as mercurials, essence of turpentine, spirituous preparations, nitrate of silver, etc. But the Dublin professor speaks with so much conviction that I ventured to follow his precepts, and I must say that my early trials very soon encouraged me to adopt unreservedly what I at first accepted only with misgivings. There is not a day that I do not, in my practice, employ some of the modes of treatment which Graves excels in describing with the minuteness of the true practitioner, and not a day that I do not, from the bottom of my heart, thank the Dublin physician for the information he has given me. Graves is, in my acceptation of the term, a perfect clinical teacher, an attentive observer, a profound philosopher, an ingenious artist, an able therapeutist. He commends to our admiration the art whose domain he enlarges, and the practice which he renders more useful and more fertile. After this tribute from one who was himself one of the greatest medical teachers of his generation, it will be very interesting to find how much Graves anticipated nearly 3/4 of a century ago the principles of the bedside teaching of medicine, which have come to be acknowledged as the only sure basis of a genuine practical medical education. For him, the only possible way to learn medicine practically was to study it at the bedside, and he insisted over and over again that while the theoretical sciences allied to medicine were eminently fascinating, they were of little actual value in teaching the student how to solve the all-important problem of treating patients. In his address before the Dublin Medico-Chirurgical Society, an association of students in connection with the Dublin hospitals, he said in 1836, "Many causes contribute to prevent students from attaining what after all should be the great object of their wishes, practical knowledge. The different sciences to which you are required to turn your attention successively possess so many fascinations that you may attach to some an undue degree of importance. But be assured of this, that however accurate be your knowledge of anatomy, healthy and morbid, however skillful you may be in the chemical theories and manipulations, however extensively you may have mastered the necessary properties of botany, however well you are acquainted with the nature and properties of drugs, be assured, I say, that you have acquired all this knowledge in vain, unless you have diligently studied symptoms at the bedside of the patient and have observed the consequences and causes of disease in the dead room. In fact, in whatever other pursuits you may employ your afternoon hours, the morning should always be dedicated with earnestness to the hospital. From its wards, all appearance of levity and inattention must be banished, for your neglect of the opportunities there presented for observation loads you with a serious amount of responsibility, I had almost said of guilt. It is no light thing to have life entrusted into your hands. We are all liable to err. We all commit mistakes. The rules of our art are not invariably precise and certain, but they only are guilty who have not used every opportunity of acquiring practical knowledge. He is doubly guilty who, conscious of his neglect, embarks in practice and commences with the decision and boldness true experience alone can confer. At a comparatively early age, Graves realized more than most men that medicine is an art and not a science, and that each individual case presents problems that have to be studied out for themselves and for which no general principles of diagnosis, prognosis, or therapeutics serve. He appreciated that there was no royal road to medical wisdom, in the sense of a scientific shortcut by means of which manifestations of disease and their indications for treatment might be grouped together and easily learned. Nor, may we add, has any such road been found since. Each physician must train himself by patient, repeated observation, and without this discipline and training, there can be no real success. Accordingly, he said to his students in Dublin, "The chief object of medical science is to relieve suffering and to save life. You must, therefore, anxiously watch the action of remedies, and by constantly noting down the effects of treatment, learn to appreciate its merits and apply it when required. Nor is this an easy task, Some indeed have vainly imagined that the method of treating or curing disease could be compressed within the limits of a few short directions, made easily deducible from some general principles and easily applicable in any particular case. But it is not so. Gentlemen, we have as yet discovered no such general principles to serve as guides. This discovery presupposes a knowledge of the laws and relations of the vital powers far beyond what we now possess. No, we must toil onward by a much more laborious and circuitous route, and must commence by making ourselves thoroughly masters of a vast number of individual cases, assisted by the observations and the writings of practical men. We may afterward proceed to arrange our knowledge, to classify it so as to render it more available. Analogy and induction are here our only, or at least our most valuable guides, and they will seldom fail to instruct us how to act when properly consulted. While recognizing all the difficulties of medical practice and the essential individualization of all its problems, Dr. Graves had little or no patience with a skeptic who thought that medicine could accomplish but little for the cure of many ailments. He said once before the Medico-Chirurgical Society, "Many, indeed, aiming at acquiring the character of medical skeptics, think they exhibit proofs of superior discrimination when they, with apparent candor, make the confession that the more they see, the less confidence they have in the resources of medicine. This confession should be interpreted not as a reproof of our art, but as a testimony of the want of skill of the would-be philosophical asserter of so false a proposition. No, God be praised, our predecessors have not toiled in vain. The anxious experience of ages has not been recorded to no purpose. Our art is in truth boundless in resources, and when applied with ability, most successful. There are indeed some acute and many chronic diseases which baffle our powers of diagnosis and defy our modes of treatment. Such appear to be, however, not numerous when compared with the great mass of cases capable of cure or alleviation. The medical skeptic, however acute his powers of reasoning may be, and however he may labor to render plain subjects obscure and direct facts ambiguous, can never rob the good practitioner of the pure, the inward joy he feels when conscious that he has snatched a patient from the jaws of death. Knowing that such were his ideals with regard to the practice of medicine, it is all the more interesting to review the system of teaching that Graves considered most likely to produce genuine practitioners of medicine. Those who have been mainly concerned with the reform of medical education here in America in recent years can scarcely fail to be struck with the appropriateness of Graves' ideas on this subject nearly a century ago. When a very young man, he did not hesitate to express his deprecation of the conventional and artificial methods of medical instruction in his own time, and he anticipated what is best in the methods that have gradually come into vogue at the end of the 19th and the beginning of the 20th centuries. His views will always remain a suggestive storehouse of thought for those who have the higher medical education at heart. In his introductory lecture at the opening of the medical course at the Meath Hospital in Dublin in 1821, he declared very definitely what he considered to be the principal aim of the medical student. Students should aim not at seeing many diseases every day. No, their object should be constantly to study a few cases with diligence and attention. They should anxiously cultivate the habit of making accurate observations. This cannot be done at once. This habit can be only gradually acquired. It is never the result of ability alone. It never fails to reward the labors of patient industry. You should also endeavor to render your observations not only accurate, but complete. You should follow, when it is possible, every case from its commencement to its termination, for the latter often affords the best explanation of previous symptoms and the best commentary on the treatment. Graves was inculcating in principle what Corrigan and himself and Stokes were to exemplify so thoroughly in practice in the next few years. Before the end of the decade in which this address was delivered at the Meath Hospital, Corrigan, at the Little Jervis Street Hospital, where there were only beds for 6 medical patients altogether, was to make his great discoveries with regard to aortic disease, and to lay the sound basis of the diagnosis of affections of the heart for all time. There are many passages in this address of Graves that might well serve for warnings to the present day and generation as regards methods of medical education which do not include sufficient practical teaching. He said, for instance, "The chief objection to our present mode of teaching is that, however well inclined the student may be, he is never obliged to exercise his own judgment in distinguishing diseases and has no opportunity of trying his skill in their cure, and consequently at the end of his studies he is perhaps well grounded in the accessory sciences, is a perfect medical logician, able to arrange the names of diseases in their classes, orders, and different subdivisions. He may be master of the most difficult theories of modern physiologists. He may have heard, seen, and, if a member of the medical society, he may also have talked a great deal. But at the end of all this preparation, what is he when he becomes a full doctor? A practitioner who has never practiced." These words have quite as suggestive applications to most phases of our modern education as they had to that of Graves' time. There are other passages that bear so significant a meaning in this regard that one can scarcely refrain from quoting. "Our present method of instruction is indeed very useful, and nothing better can be devised for a beginner. But for the more advanced student it is by no means sufficient, nor is it calculated to give him practical experience, without which all other acquirements are of no avail. I say it does not give him experience because he has at no time been charged with the responsibility of investigating a case for himself and by himself, because at no time has he been called on to make a diagnosis, unassisted by others, and above all, because he has never been obliged to act upon that diagnosis and prescribe the method of treatment. If those who had been thus educated, and who had been made doctors upon so slender a foundation, were to confess the truth, we should be presented with a picture calculated to excite dismay, if not a stronger feeling. How many doubts and distracting anxieties attend such a man at his first patient's bedside? If the disease be acute and life in imminent danger, and if he shrink under this sudden and unusual load of responsibility, he gains little credit for professional ability. If, on the contrary, inexperienced as he is, he assumes that decision of judgment, that energy of practice which experience alone can confer, is it not probable that the result will be still more disastrous? Graves' last days and the circumstances of his death and burial are given by Professor Stokes, his great personal friend, and himself one of the most distinguished physicians of his time. We quote the concluding paragraph of Professor Stokes' biographical notice. It was in the autumn of 1852, he being then in his 57th year, that the symptoms of the malady which was to prove fatal first showed themselves. In the following February, he began to succumb to the disease. Although at times his sufferings were great, yet he had many intervals of freedom from pain. And he then showed all his old cheerfulness and energy. To the very last he continued to take pleasure in hearing of any advance of knowledge that tended to ameliorate the condition of man, or to throw light on his relations to a future state. In this latter point of view, the discoveries of Layard greatly interested him, as illustrative of the sacred history. And thus he was permitted to fill up the intervals of his sufferings, even to the last, for his mental faculties never failed or flagged, a mercy for which he often expressed a fervent gratitude. And so he was providentially enabled to review the past, and to form a calm and deliberate judgment on the religious convictions of his earlier years. And once the truthfulness of these were ascertained, he adhered to them with that earnestness which characterized all his decisions. It was after the attainment of this state of patient expectation that one who was dear to him expressed a prayerful wish for his recovery. "Do not ask for that," he replied. "It might prove a fatal trial." His mind having become thus satisfied, he made few remarks on these subjects, except in reply to the inquiries of others. Thus, when referred to the prophetic illustration of purifying and redeeming love, "A fountain shall be opened for sin and for uncleanness." "No," he said, "not a fountain, but an ocean." On the day before his death, he desired, a second time, to partake of the Holy Communion with his family. When some explanations were commenced, he answered, "I know all that. I do not regard this as a charm, but I wish to die under the banner of Christ." Feeling himself sinking, he asked for prayer, and a petition was offered suitable to his condition. But he seemed to long for something more, and when questioned, replied, "I want some prayer that I know, some of the prayers of my youth, some of my father's prayers." The litany was commenced. He immediately took up the well-known words, and when the speaker's voice faltered, he continued them alone and distinctly to the end of the strain. "Whom thou hast redeemed with thy most precious blood." On the 20th day of March, 1853, and without renewed suffering, he ceased to breathe. His tomb is in the cemetery of Mount Jerome. It bears the following inscription dictated by himself: Robert James Graves, son of Richard Graves, professor of divinity, who, after a protracted and painful disease, died in the love of God and in the faith of Jesus Christ. William Stokes, very closely associated with the name of Robert Graves and all that made the Irish School of Medicine influential for good, about the beginning of the second quarter of the 19th century, is that of William Stokes. Stokes' work on the diseases of the chest and, later in life, his treatise on diseases of the heart and aorta stamp him as one of the great physicians of all time. His name is assured of immortality in medicine because with that of the well-known Scotch physician, Cheyne, who came to Dublin late in the second decade of the 19th century, it is associated in the term most commonly used for a form of breathing, having special diagnostic and prognostic significance in certain serious diseases, and which is known as Cheyne-Stokes respiration. Even more interesting, however, than Stokes the physician is, as we shall see, Stokes the man, and all that he stood for in his generation in Dublin during a long life. William Stokes was of a family that had long been distinguished in Dublin for scholarship. While his ancestors came originally from England, 5 generations occupied more or less prominent positions in the public life of Ireland, and they had lived in Dublin for more than 150 years before Stokes began to be prominent in Irish medicine. His father, Whitley Stokes, had been a scholar and senior fellow of Trinity College, and was prominent in the scientific, political, and literary circles of the Irish capital at the end of the 18th and the beginning of the 19th century. He had been a member of the United Irishmen, but fearing that the revolutionary principles that were being propagated would only bring about an ineffectual rebellion, he separated himself from them, though years after, when the United Irishmen came under the ban of the English government, his previous connection with them cost him suspension from the fellowship. Later on, however, Whitley Stokes became the Regius Professor of the practice of medicine at Trinity College, a chair which he held until succeeded in the early 40s of the 19th century by his son, William, the subject of this sketch. Something of the character of the man can be judged from the fact that though he was a distinguished physician and interested in every branch of science, taking an active part in the foundation of Trinity College Botanical Gardens, and being one of the founders of the Zoological Garden in Phoenix Park, he was also the author of a prize essay in reply to Tom Paine's Age of Reason, which was then attracting so much attention. Our William Stokes was the second son of Whitley Stokes, and was born in Dublin in 1804. Like many another distinguished investigator in science, he was not looked upon as a bright student as a boy, and indeed would be prevailed upon to interest himself only very slightly in what is usually considered to be the absolutely necessary fundamental work in education. He had a great love for poetry and romance, which indeed he carried with him all his life. The Scottish border ballads were his favorite reading, and he spent days in committing them to memory. Almost needless to say, his apparent indolence and disinclination to any steady, methodical system of study were, as his son, the late Sir William Stokes, records in his biography of his father, sources of real concern to his parents, and caused his mother specially much anxious thought. One day, while reading his favorite author, Sir Walter Scott, he fell asleep, to be awakened shortly after by some warm drops falling on his face. He started up to find his mother bending over him. It was her tears that had awakened him. Stung with remorse at having been the cause of so much sorrow to the mother whom he loved very dearly, his nature underwent an immediate and salutary change, and the dreamy, indolent boy became thereafter the ardent and enthusiastic student. Stokes amply made up for any neglect of study there might have been in his boyhood days, as soon as he entered upon the medical course to which he felt called. Here he came to be looked upon as one of the most ardent and painstaking of students. His preliminary medical studies were begun in Dublin at the Meath Hospital. Chemistry he learned in the laboratory of Trinity College, and anatomy in the Royal College of Surgeons. After spending several years thus, he went to Glasgow, where for 2 years more he was occupied mainly at chemistry in the laboratory of Professor Thomson. Like most of the young Irishmen of his time, he next proceeded to Edinburgh in order to complete his education in clinical medicine and, if possible, obtain his medical degree from that famous institution. It was at Edinburgh, under the magnetic influence of that great teacher, Alison, that Stokes began to develop the rare powers of original observation, which at an early age placed him in the front rank of the best medical men of the time. It is interesting to note that before he left Edinburgh, he published his first medical work, a treatise on the use of the stethoscope, which was undoubtedly the means of bringing that instrument, and with it Laennec's fruitful system of physical diagnosis by means of auscultation, to the general notice of the English-speaking medical profession. Even after all that has been written on the subject, it remains a very valuable little book. It was dedicated to the famous Cullen, who had already published a series of cases which had been illustrated by the use of the stethoscope, and to whom Stokes probably owed the idea of the need for a more formal little treatise on the subject. It is typical of the slow adoption of medical novelties, even when they are of great importance, that more than 10 years afterward, old-time, though distinguished, physicians not infrequently made fun of Stokes for spending so much time in the study of cases with the stethoscope, since in their opinion it was little more than a toy. This was done in no bitter, carping spirit, but with the most friendly complacency and condescension. Stokes, however, intensely practical in his way, realized the value of the instrument, and as a result of his teaching it, soon began to be more generally used, thus introducing into English-speaking medical circles that exact knowledge of diseases of the chest, which can only be obtained by means of this little instrument and the methods of auscultation which are associated with it. End of section 15.
Section 16 of Makers of Modern Medicine. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Read by chrishavel. Makers of Modern Medicine by James Joseph Walsh. The Irish School of Medicine. Graves, Stokes, Corrigan. Part 3. Immediately after graduation, Stokes settled down in his native city to practice. In 1826, when Stokes was only 22, Dublin was visited by one of those epidemics of typhus fever which were so common in the first half of the 19th century, and which consisted, evidently, at least to a great degree, of what we now call typhoid fever, but intermixed with many cases of the real dread typhus. The mortality in such epidemics, as we have reason to know from statistics here in New York, was always over 25%. And often reached far above 50%. The manner of contagion was unknown, only it was very well understood that those much in contact with the patients were likely to contract the disease. Among the poorer classes in Dublin, the fever raged with virulence, but young Stokes devoted himself to the care of patients to an extent that severely taxed his physical powers of endurance. He devoted himself especially to the poorer classes. He did not contract the fever during the height of the epidemic in 1826, but he did in 1827 when it recurred. But fortunately he suffered in the mild form. An epidemic of another disease, Asiatic cholera, the danger from which has been almost entirely removed by the progress of scientific medicine in modern times, followed not long after. It showed itself in Dublin when Stokes was about 25. He it was who recognized the first case of the disease and sounded the note of warning that probably saved many lives by calling attention to the danger that was just beginning. Once more, he devoted himself to the care of the patients, and, as with regard to typhus fever, wrote an account of his experiences, which is in itself a valuable medical document that shows the powers of observation of the young medical man. Stokes spent himself in labor for the poor, and his deep interest in their welfare led him to sacrifice much time in order to organize medical charities for his unfortunate countrymen during the sad years of that awful 5th decade of the 19th century. His interest in this matter of organization led him also to realize how much might be accomplished by public hygiene and efficient government sanitation. He recognized, too, how much would be accomplished along these lines if men were given proper training to make them specialists in these subjects. To Stokes, then, almost more than to any other man, is due the development of public sanitation as a special science, and its organization for the proper safeguarding of public hygiene. His efforts, especially with regard to the physicians of Ireland, who so nobly sacrificed, not unfrequently at the expense of other practice, their time, health, and often even their lives, in order to aid their stricken countrymen, form one of the best monuments to his tender sympathy and his goodness of heart as a man. His testimony before the Parliamentary Committee was at this time of the utmost value in securing due recognition of their services. In 1843, when the Medical Charities Bill was brought forward, Stokes and Cusack united in the effort to procure for these devoted men an amelioration of the conditions under which they had labored. They repaired to London to give evidence on the subject before the House of Commons. Both these friends had had to deplore the loss of many of their dearest and most promising pupils, who, after a short experience of country practice, had fallen victims to fever contracted in the discharge of their duties. They pleaded that in all justice the remuneration for attendance on fever hospitals and dispensaries should be fixed at a liberal scale, and that some provision ought to be made for the widows and children of gentlemen who had lost their lives in the public service. They collected statistics which proved that during a period of 25 years the mortality of the medical practitioners of Ireland was 24%. While in most instances the cause of death was typhus fever. They showed that, on the authority of Inspector General Marshall, the comparative mortality of combatant officers in the army was less than half that, amounting to only 10.25%. It was little to be wondered at that William Stokes should say, in answer to the chairman's question regarding the existence of any special risk to the medical officer in Ireland, "Such a number of my pupils have been cut off by typhus fever as to make me feel very uneasy when any of them take a dispensary office in Ireland. I look upon it almost as going into battle." Again he observes, "The medical practitioners in Ireland are placed in a position very different from, and far more serious, than that of their brethren in Great Britain. The Irish physician is often exposed to contagion in its most concentrated force. When himself under the influence of cold, wet, fatigue, and hunger, as he labors among the poor, passing from hovel to hovel in wild and thinly populated but extensive districts, he has often to ride for many hours in the worst weather, and at night, enduring great fatigue, while himself a prey to mental as well as physical suffering. For if we add to such labor the injurious influence which the knowledge of danger must have on the system of a man feeling that he is struck down by the disease under which he has seen so many sink, and tortured by the thought of leaving a young family unprovided for, we can understand how it happens that the country is so often deprived by death of so many of its best educated and most devoted servants. Perhaps the most interesting phases of Stokes' purely medical work during the first part of his career is his treatment of the subject of consumption. When not quite 33, he wrote a treatise on the diagnosis and treatment of diseases of the chest. His familiarity with the work of Graves and of Auenbrugger gave him command of all the modern methods of physical diagnosis, so that he was able to study tuberculosis to the best possible advantage, and with the least possible chance of too favorable judgment with regard to its cure. Notwithstanding the accuracy of his knowledge, however, he insisted that the disease was curable, and that the important point with regard to it was the recognition of it as early as possible, in order that the patient might be given the best chance for life. At that time, most physicians considered tuberculosis to be a hereditary disease, without any idea of its being possibly contagious. Acceptance of heredity seemed to set the stamp of inevitable fatality on the heads of victims of the disease. To announce the curability of tuberculosis, then, was to run counter to all the medical traditions of the time, and Stokes in doing so must have had in support of his teaching many observations of patients who had been cured, notwithstanding the fact that they were assured sufferers from this supposedly fatal disease. We know that Stokes was surely correct in his judgment in this matter, and realized too that his method of treatment, which included abundant feeding and long hours each day in the outdoor air, comprised the best elements of the modern treatment of tuberculosis. Perhaps one of the most striking anticipations of what is apt to be considered quite modern in medicine is Dr. Stokes' description of the methods by which he considers certain forms of heart weakness, especially that incident of incipient fatty disease, should be treated. His directions are almost exactly those which have made the names of the Schott brothers known throughout the world during the last 25 years. To have anticipated our modern views with regard to tuberculosis, its curability, and the best methods of treatment shows how thoroughly Stokes had studied his cases of consumption. That the same man should also have been able to work out the details of treatment for heart weakness is a triumph that indicates better than anything else perhaps the genius of the physician, not only in the observation of disease, but above all in that more important part of medicine, the proper application of therapeutic principles. Stokes observes, "In the present state of our knowledge, the adoption of the following principles in the management of a case of incipient fatty disease seems justifiable. We must train the patient gradually, but steadily, to the giving up of all luxurious habits. He must adopt early hours and pursue a system of graduated muscular exercises, and it will often happen that, after perseverance in this system, the patient will be enabled to take an amount of exercise with pleasure and advantage which at first was totally impossible owing to the difficulty of breathing which followed exertion. The treatment by muscular exercise is obviously more proper in younger persons than in those advanced in life. The symptoms of debility of the heart are often removable by a regulated course of gymnastics, or by pedestrian exercise, even in mountainous countries, such as Switzerland, or the Highlands of Scotland, or of Ireland. We may often observe in such persons the occurrence of what is commonly known as getting the second wind. That is to say, during the first period of the day, the patient suffers from dyspnea and palpitation to an extreme degree, but by persevering, without overexertion, or after a short rest, he can finish his day's work, and even ascend high mountains with facility. In those advanced in life, however, as has been remarked, the frequent complications with the theromatous disease of the aorta and affections of the liver and lungs must make us more cautious in recommending the course now specified. If any proof of Stokes' ability as an observer and a teacher were needed, it would be readily found in his original description of the form of respiratory disturbance, since known as Cheyne-Stokes respiration. The passage is besides a model of succinct completeness of description that would well deserve to be in the commonplace book of physicians who write, for so many of them need to imitate his conciseness and clarity. It is to be found in his book, Diseases of the Heart and the Aorta, page 336. A form of respiratory distress peculiar to this affection, fatty degeneration of the heart, consisting of a period of apparently perfect apnea, succeeded by feeble and short inspirations, which gradually increase in strength and depth until the respiratory act is carried to the highest pitch of which it seems capable. when the respirations, pursuing a descendant scale, regularly diminished until the commencement of another apneal period. During the height of the paroxysm, the vesicular murmur becomes intensely puerile. It is curiously interesting to find that a favorite subject of discussion in the Irish medical societies of nearly 50 years ago was a topic which is still frequently on the tapis in medical society meetings. In one of his public addresses, Dr. Stokes bewailed the fact that medicine did not have its proper place in the estimation of the people and was not able to assert its dignity as a profession in its proper sphere. He discussed also the remedies for this state of affairs, and as he was a man of eminently broad views, of very large experience, and of sane conservative judgment, they are worth while pondering at the beginning of the 20th century. For the practical problems of professional life which he sets forth are still with us. It is for this reason that it has seemed worthwhile to give a rather lengthy quotation that would adequately represent his conclusions in the matter. Is it by public agitation and remonstrances addressed to deaf or unwilling ears that these medical abuses are to be corrected? Is it by the demand for class legislation? Or is it by the efforts of one and all to place medicine in the hierarchy of the sciences, in the vanguard of human progress, eliminating every influence that can lower it, every day more and more developing the professional principle, while we foster all things that relate to its moral, literary, and scientific character? When this becomes our rule of action, then begins the real reform of all those things at which we fret and chafe. Then will medicine have its due weight in the councils of the country. There is no royal road to this consummation. On the one hand, the liberal education of the public must advance, and the introduction of the physical sciences and the arts courses of the universities must give the death blow to empiricism. And, on the other, education of ourselves must extend its foundations, and we should trust far less to the special than to the general training of the mind. When medicine is in a position to command respect, be sure that its reward will be proportionally increased and its status elevated. In the history of the human race, 3 objects of man's solicitude may be indicated. First, his future state. Next, his worldly interests. And lastly, his health. And so the professions which deal with these considerations have been relatively placed. First, that of divinity. Next, that of law or government. And, as man loves gold more than life, the last is medicine. But with the progress of society, a juster balance will obtain conditionally that we work in the right direction, and make ourselves worthy to take a share in its government, not by coercive curricula of education, not by overloaded examinations and special knowledge, which are, in comparison to a large mental training, almost valueless, but by seeing to the moral and religious cultivation, and the general intellectual advancement of the student. From this, it is to be feared that Dr. Stokes would have very little sympathy with the specializing trend of modern medical education. Certain it is that not thus were the medical giants of the old days developed. But the times have changed. Perhaps we should change with them. Only the danger of the change must be ever kept in mind, so as to avert, if possible, its most serious consequences at the first warning. While Stokes felt deeply for the Irish people, and the sad conditions under which they were laboring, unfortunately, like many another educated Irishman, he had very little active sympathy in any of the movements for their relief. He was a man in early middle life when O'Connell's agitation began, but he had no part in the movement. Later on, when his personal friend Isaac Butt was engaged in his great political work for Ireland, Stokes tried to dissuade him from it, feeling that the arousing of the people to a realization of their rights only led to a tighter riveting of their chains. Better judgment has prevailed, and now practically all classes are united in the Gaelic movement, making it harder to understand Stokes' position. Yet his is a case for sympathy rather than blame. His heart was touched, but his head could not see a happy issue for his countrymen, and so he preferred to have them endure in patience rather than suffer further ills through coercive measures. Dr. Stokes realized, however, all the iniquity of the union of the Irish and English parliaments, and a favorite story of his was told with regard to one of the members of the Irish Parliament who sold themselves to England. This member, finding that he was unnoticed in the distribution of rewards after the passage of the Union, though 18 of his fellow members were raised to the peerage, waited on the Secretary of State, and in an injured tone complained of having been neglected. The Secretary answered in the blandest manner, "The government, sir, is most anxious to do all it can to assist those who supported it. What is the object of your ambition?" "Make me equal to the rest of the blackguards," was the prompt reply of the conscientious legislator. Stokes used to add, "History does not tell if his quite reasonable request was granted." In the midst of Stokes' sympathy for his compatriots, there was always a countercurrent of reactionary feeling, as if he feared the Celtic enthusiasm for reform would overstep the mark and bring evils in its train, even worse than the good it might entail. The following letter to a friend, as representing one phase of this feeling on the part of a true-hearted Irishman, seems worth reproducing, because it suggests thoughts with regard to the present movement which warn of possible dangers from the commercial spirit that must be avoided at all hazards, if Irishmen are to retain the influence their idealism has ever given them in whatever part of the world they might be. October 27, 1836. You will be sorry to hear that I have been for 2 days down to Connemara to see poor McNamara. He is dying. Oh, what a tragedy it will be. We expect him up to town this week. I never saw the glorious Loch Corrib look so beautiful. I was entertained by Miss Blake. She is a perfect specimen of the old Irish aristocracy, tall, distinguished, elegantly formed, with dark hair and exquisitely fair complexion. She looked, as she stood in her tapestried hall, a lady of romance, her youth, her mourning dress, her classic head, and the symbols of her loved religion all combined to form a picture not easily to be forgotten. The castle, grey and worn, stands on a green platform over the clear and rapid river through which the whole waters of Loch Mask and Loch Corrib rush to the sea. It reverses Byron's simile, all green and wildly fresh without, etc., etc. You will say I am raving, but in truth a little time will level these ancient castles, and their high-born and honorable inhabitants, and the feelings which their communion creates, and then utility will have its reign, and common sense, laughing at the past and the beautiful, will build factories with the remains of history, make money, and die. Dr. Stokes' interest in Irish historical matters can be best judged from the fact that toward the close of his life, when he was extremely busy with his practice and medical work of all kinds, he took the time to write a life of his friend, George Petrie, the distinguished Irish antiquary. It will be recalled by those who are interested in Irish antiquities that Petrie's work eminently deserved this tribute, and that Stokes' life is worthy of Petrie's merit. Dr. Stokes' daughter, Margaret, as the result of association with Petrie and her father's interest in Irish antiquities, became a deep student of the same subject and wrote a little volume, Early Christian Art in Ireland, which has come to be the standard handbook on this subject for those who want sure and definite information, yet are not specializing in antiquities. On March 17, 1874, as a recognition of his interest in Irish antiquities, Stokes was nominated to the presidency of the Royal Irish Academy. It was a new departure for the members of that society, says Stokes' biographer, which is mainly representative of literature and abstract science, to choose a physician as their head, but it was felt that the time had now come when medicine had obtained, owing to the labors of Stokes and others, such a position in the estimation of literary and scientific men that the election of the Regius Professor of that art in Trinity College to the presidency of the Royal Irish Academy would be welcomed by the majority. Certainly no member of the medical profession could have been found more deserving of the tribute because of all that he had done for Irish medicine, and besides, his broad, sympathetic, liberal interest in Irish antiquities eminently fitted him for this honorable position. When Stokes' death was announced at the beginning of January 1878, the medical world thought that it had lost one of its most representative men. For some years before his death, many honors had come, all unsought, to this worthy protagonist of Irish medicine. He had been made a member of the Prussian Order of Merit, and an honorary fellow of many scientific societies on the continent. He had received the rare distinction of the degree of LL.D. from Cambridge, and had been similarly honored by many other universities. Perhaps the honor that Stokes himself would have appreciated most came after his death, when the country people who had learned to know and love him asked to be allowed to carry his remains from Carrickbreac to the church at St. Fintan, the grassy churchyard grave, where he was to be laid beside his beloved wife and children. They laid him in the same grave and beneath the same stone with her who was the beloved companion of his life, and on whose tomb he had engraved these words: "When the ear heard her, then it blessed her. When the eye saw her, it rejoiced. When the poor and suffering came unto her, they were comforted." Surely a union like theirs was not destined to be but passing. Stokes' beautiful domestic affection was but another index of one of the most beautifully rounded types of man that ever lived. The affective side of his being, profoundly tender, deeply sympathetic, thoughtful always of others first, and humanely devoted to the poor and the helpless above all others, was typical of the best side of the Irish character. For this even more than for all he did for practical medicine, yet the absence of his work would make a large lacuna in the 19th century medical progress. The race may well be proud of him. His example still lives to animate his professional brethren, one of whom, Sir John Moore, said of him, "Those who have seen Dr. Stokes at the bedside of the sick know how gentle, how refined, how kindly was his bearing toward the patient. Amid all the ardor of clinical observation and research, he never for one moment forgot the sufferer before him. No thoughtless word from his lips, no rough or unkind action ever ruffled the calm confidence reposed in him by those who sought his skill and care. In many eloquent lectures delivered in the Meath Hospital, he inculcated those Christian lessons of charity and thoughtfulness, and so by precept and example he strove to teach the duties of a true and God-fearing physician." End of section 16. Section 17 of Makers of Modern Medicine. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Read by chrishavel. Makers of Modern Medicine by James Joseph Walsh. The Irish School of Medicine. Graves, Stokes, Corrigan. Part 4. Dominic Corrigan. The third of the great trio of the founders of the Irish School of Medicine is Sir Dominic John Corrigan, whose name will be forever associated with the form of pulse which occurs in aortic heart disease. It was his supreme merit to have been the first to describe in all its details this type of heart disease, and the distinguished French clinician Trousseau declared that aortic regurgitation should be called Corrigan's disease. At this time, Trousseau was deservedly looked up to as the leading spirit among the clinicians of Europe. He was never tired of commending to his students Corrigan's acute clinical observations, and insisted that it was work of this kind which assured real progress in medicine. Trousseau's suggestion as to nomenclature was not adopted in its entirety, but Corrigan's pulse is well known all over the medical world, and there is no doubt now that it will continue for many generations to confer deserved honor on the man who first appreciated its full significance, though he was not the first to recognize it. And indeed it could scarcely escape notice, but who showed just what diagnostic conclusions might be reached from it. Corrigan's career should prove a stimulating example to the young physician just taking up that real postgraduate work in medicine, which comes after he has received his degree, finished, perhaps, his hospital work, and is beginning his practice. Corrigan was only 27 when he began the series of observations on which was founded his paper on aortic heart disease, which was published when he was about 30. In this matter of youthful accomplishment, Corrigan is not alone among his distinguished Irish contemporaries. Stokes, it will be remembered, wrote his little book on the stethoscope when he was only 21, and had made some very important observations on disease of the chest before he had reached the age of 30. Graves had showed very clearly the sound metal of his intelligence before he was 25, and had described the cases of the nervous disease which have since come to be called after his name, Graves' disease, before his 4th decade had run more than a year or two. In fact, these young men accomplished so much by their careful observation and dependence on their own resources that the medical writer of the modern times is tempted to wonder if perhaps that most precious quality of the human mind in the young adult, its originality, is not obscured by the amount of information that it is expected to absorb before it is tempted to do any thinking for itself. There is another remarkable feature of Corrigan's achievement in the recognition and description of this form of heart disease. At the time he was the physician to a hospital which had only room for 6 medical patients. This appointment to the little Jervis Street Hospital in Dublin had been secured only after competition, and Corrigan had to pay for the privilege of being the attending physician. This he could ill afford to do at the time, and so he resolved, as he told a friend, to make all his opportunities for the study of patients count to the greatest possible extent. He did not visit his hospital merely to see patients, but to study the cases carefully. His success is only another example of the necessity for seeing much, and not many, things, if there is to be any real progress. In our day, physicians scarcely consider that they have any hospital experience unless they are the attending physicians to several hospitals, seeing at least 100 patients a week. The result is that patients do not receive the skilled care they should, and that advance in medicine suffers because of the wasted opportunities for clinical observations, while a busy attending physician rushes through a ward and the resident physician has only time for the routine work that enables him to keep just sufficiently in touch with the progress of his cases to satisfy the hurrying chief. Before publishing his classic paper on the permanent patency of the aortic valves, on which his reputation as a wonderful clinical observer in medicine rests, Corrigan had called attention to some mistakes in the classification of heart murmurs as made by Laennec in Paris. At this time, Laennec was considered to be the best authority in Europe on diseases within the thorax. As regards diseases of the lungs, he well deserved the reputation. To him, the medical world owes all that it knows about diseases of the chest, as far as these can be detected by means of the ear. His young contemporary in Ireland, however, was able to show that in diseases of the heart, some of the ideas acquired in long years of study of the lungs were leading Laennec into false conclusions as regards the significance of murmurs of the heart. Even genius does not succeed in doing more than one thing well, and especially in the matter of taking a second step into the unknown. While the distinguished Frenchman might have been thought just the one to complete the work he began so well on the heart, and while his experience with the lungs might have been expected to help him in the recognition of the significance of heart murmur, this did not prove to be the case. The privilege of solving the mystery of heart diseases was to be left for his Irish contemporaries, one of the most successful of whom, in this matter, was Corrigan. Anyone who wishes to see how little subsequent study has added to our knowledge of aortic disease should read Corrigan's original paper on this subject. He describes all the varying forms of affections of the aortic valve with their various clinical manifestations. His paper is illustrated by a set of plates that would still be valuable for demonstrative purposes, and which serve to show how painstaking were his pathological studies. He illustrated experimentally his ideas of how the murmurs and thrills occur by means of an apparatus consisting of rubber tubes, through which water might be allowed to flow under pressure and varying caliber. Some of his conclusions, derived from experimental observations, will not stand the test of our modern knowledge, but they are very suggestive. Perhaps the best idea of the clinical value of Corrigan's observations can be given by a quotation from his original paper, in which he discusses the interesting and difficult question of the relationship between aneurysm of the aorta and inadequacy of the aortic valve. He said, "The two diseases, aneurysm of the aorta and inadequacy of the valves, may, however, be combined. Aneurysm of the ascending aorta may, by extending to the mouth of this vessel, dilate it so that the valves are unable to meet, and there is then a combination of the two diseases. There is aneurysm, and there is permanent patency of the aortic opening. The first cases that came under my observations presenting the signs of inadequacy of the aortic valves were cases in which the valves were rendered useless in this way, namely, by the mouth of the aorta sharing in the aneurysmal dilation. These cases led me into an error, for meeting the signs of permanent patency of the aortic orifice in conjunction with aneurysm, I erroneously attributed to the aneurysm the signs which arose from the permanent patency. Aneurysm of the aorta of itself does not produce the signs arising from permanent patency of the mouth of the aorta. It can only produce them in the way already described, by involving in the dilation the mouth of the aorta, and hence, when in conjunction with the aneurysmal tumor of the arteria innominata, or aorta, there are found visible pulsation, bruit de soufflet, and frémissement in the ascending aorta, and the trunks arising from it. We may be certain that, in addition to the aneurysm, there is a defect in the aortic valves, or that the aneurysm has extended downward, involving the mouth of the aorta. On the other hand, if these signs be absent, the valves are sound, and the mouth of the aorta is not included in the disease. The propriety of performing Mr. Wardrop's, or indeed the common operation for aneurysm, about the neck, might depend on the information thus obtained of the state of the aortic valves. To perform either in a case where the aneurysmal dilation was so extensive as to involve the mouth of the aorta, or where the aortic valves were diseased, would only bring the surgical treatment of the disease into unmerited discredit. Another very distinct contribution of Corrigan to the medicine of his time was his insistence on the distinction that exists between typhoid and typhus fever. This is one of the most interesting features of his little book on the nature and treatment of fever. With our present knowledge, it seems hard to understand that these two fevers should have been so long confounded. But as a matter of fact, it was not until the middle of the 19th century that the distinction between them was recognized, even by the most acute observers. In this matter, the French and Americans anticipated most of the rest of the world, though Corrigan's teaching in the matter had been correct for many years before others in the British Isles came to the true position. It was his work among the poor particularly that enabled Corrigan to recognize the differences between these two diseases. He came to have one of the largest practices that any practitioner in Dublin, or for that matter in any city of the world, has ever enjoyed, if enjoyment it can be called. His office used to be crowded with patients who would occupy all his time if he allowed them to do so. In order to secure opportunities for his other work, for his lectures, for his hospital visitation, and for his pathological investigation, he had a back entrance to his house through which he could steal out, even though there were many patients waiting for him, when he felt it was time for him to fill another engagement. Late in life, after his return from Parliament when he took up his practice again, it was only a very short time before the same state of affairs developed once more. It almost seemed as though every sick Irishman and Irishwoman wanted to have the opinion of Dr. Corrigan. He had also a large consultant practice, though he was known for being a very different man from the ordinary type of the medical consultant. As one of his younger colleagues said, he never wore the supreme air of a consultant. He was always simple and easy in his manner, was always congenial and ready to listen to what had developed and had been found in the case before consultation with him, and had none of the superciliousness that was supposed to characterize the true high-grade consultant physician in the British Isles a half-century ago. Within a few years after his essay on aortic heart disease, Corrigan published a paper on chronic pneumonia, or, as he called it, cirrhosis of the lungs. Corrigan's successful achievements in medicine depended mainly on the fact that he studied the pathological anatomy of fatal cases with the greatest care. He had detected that in certain cases of chronic pneumonia the process seemed to be quite different from tuberculosis. Observations made post-mortem showed that his clinical observations were justified by the differences observed in the organ. As a result, he formulated his opinions on the subject. He called particular attention to the fact that what he found corresponded very closely with the pathological process which had been observed by Laennec in the liver, and to which the French medical pathologist had given the name of cirrhosis. It would seem as though the pathology of the time was so crude that Corrigan must surely fall into serious errors in his account of what he saw. 20 years later, Virchow was to revolutionize pathology by the publication of his Cellular Pathology. Notwithstanding the progress made since his time, however, Corrigan's description of the condition of the lungs that he noted and of the pathological process observed is so true that even to the present day This paper remains of distinct value in medicine and represents the beginning of correct ideas on the subject. After Corrigan's death in 1881, the London Lancet said, "In the light of recent pathology, Corrigan's speculation on cirrhosis of the lungs are more meritorious than ever, and continue to be regarded as in the main sound. They anticipated by 40 years much of the present pathology." Needless to say, it is only a genius of a very high order that is thus capable of rising above the limitations of environment, and in spite of the defective knowledge of his times observing correctly and drawing proper conclusions, though all the usual accepted principles would seem to be sure to lead him from the truth. The principal lesions of chronic pneumonia, after having been the subject of much disputation, with conclusions now one way and now another in the intervening years, are at the present time recognized as being essentially due to the pathological processes Corrigan originally pointed out. The man who thus made a permanent place for himself in the history of medicine was the son of a poor shopkeeper in one of the outlying districts of Dublin. His early education was obtained at Maynooth College, which had at that time a department for the training of youth for secular vocations, though it has since become an exclusively clerical institution. It is needless to say that he acquired an excellent knowledge of the classics, of which he made abundant use later in life, and of which he was always very proud. The physician in attendance at Maynooth in his time took quite a liking to him, and it was the result of his suggestion that Corrigan took up medicine as his profession. For a time he was under the tutelage of this Dr. O'Kelly, who seems to have been a very intelligent man, and a rather painstaking clinical observer. Most of his medical studies were made in Dublin, and he attended the practice at Sir Patrick Dunn's Hospital. It was the fashion at this time, however, for Irish students of medicine to finish their medical education at Edinburgh whenever possible, and Corrigan spent several years there, receiving his degree of doctor in medicine in 1825. He had attracted considerable attention in Edinburgh for his acute powers of observation, and received an appointment to the Meath Street Dispensary shortly after his return. From the service here, he was appointed to the Jervis Street Hospital. He had to pay, however, for the privilege of being attending physician here, and this, as he said, made him more careful in endeavoring to secure all the advantages possible from his service. After his publication of the article on the permanent patency of the mouth of the aorta, or inadequacy of the aortic valves, he at once became recognized as one of the best clinicians in the city. This article appeared, in April 1832, in the Edinburgh Medical and Surgical Journal, at a time when, as has been said, its author was not yet 30 years of age. As soon as he began his work at the Jervis Street Hospital, he gave a course of lectures, and as he was an excellent talker and a good demonstrator, he at once attracted a large class. In 1834 he joined Hargrave's School, in Digg Street, Dublin, as lecturer on the practice of medicine, and continued to hold the position for more than 10 years. His success as a lecturer attracted many students from the other medical schools. Corrigan's class was often 3 times as large as that of other medical lecturers in the city. It not infrequently happened that as a result of his popularity, the medical class was 2 or even 3 times as large as the surgical and anatomical classes at the same institution. This was very unusual, for Dublin was famous for its anatomical instruction, and there were often 5 times as many pupils enrolled in the anatomy classes as in the medical classes. It was not long before honors began to be showered upon Corrigan. When he was about 40, the diploma of the London College of Surgeons was conferred upon him, and as according to the bylaws of the institution the diploma can only be conferred after examination, Corrigan's examination was made to consist of the reading of the thesis, Inadequacy of the Aortic Valves, before the faculty and the other members of the college. In 1849 the University of Dublin conferred upon him the degree of M.D., honoris causa. There was only one setback in Corrigan's medical career in Dublin. When first proposed for honorary fellowship in the Irish College of Physicians, he was rejected. The reason was entirely apart from medical matters. Corrigan was the most active member of the Irish Board of Health, which had charge of the famine cases in Ireland during the awful years between 1845 and 1850. This board proposed to allow about 5 shillings per day to physicians who would be sent to the country to attend famine fever cases. It is easy to understand that this remuneration was considered inadequate, and the board's decision in the matter raised a storm of protest. Graves wrote very bitterly with regard to it and blamed Corrigan for any part he might have had in it. The result was that for some time Dr. Corrigan was the most popularly hated physician in the medical profession of Dublin. Corrigan made up for any lack of tact he might have had in this matter, however, before long, and in 1855 he obtained the license of the college. 2 years later he was elected a fellow. Before another 2 years had passed he was elected president of the college, and had the unprecedented honor of being re-elected 4 years in succession. The college further made up for its offense by having a statue of Dr. Corrigan by the famous Irish sculptor Foley made for its hall while he was still alive. His own self-sacrificing work during the famine fever years was well known. After he had achieved nearly every distinction that his brother physicians could confer upon him, he was created a baronet. It was understood that this distinction was mainly meant as a reward for his services during the famine, though also for the time which he had so unstintedly given to the improvement of national education in Ireland, in the capacity of a Commissioner of Education. Not long after his creation as a baronet, Sir Dominick stood, in Dublin, for a seat in Parliament in the Liberal interests. At first, he was unsuccessful. In 1869, however, he was returned as one of the members of the government, and sat in Parliament for 5 years. As he was a very eloquent speaker, it was thought that he would produce a very distinct impression in Parliament. His type of eloquence, however, did not prove to have any special influence in the cold British House of Commons, though Sir Dominick was always looked upon as one of the men to be counted on whenever there was under consideration legislation that affected Irish interests. He was defeated for re-election in 1874, but it is rather to his credit than otherwise, since he had been approached by the vintners of Dublin, who were at that time all-powerful in municipal politics, and offered the membership, provided he would agree not to actively support the Sunday Closing Bill, which was to come up at the next session of Parliament. Such an agreement Sir Dominick absolutely refused to consider as consistent with his legislative honor, and the result was the close of his parliamentary career. His years in Parliament, however, did not separate him from his interests either in medicine or in general science. He continued to be especially interested in zoology and made liberal contributions to the Dublin Zoological Garden. His residence at Dalkey, the grounds of which ran down to a rocky coastline, enabled him to obtain many specimens for his aquarium, and these were often transferred to the Dublin Zoological Gardens, for which he was one of the most active collectors. It was his custom during his parliamentary career, though he was more than 70, to leave London on Friday night and reach Dublin about 8 o'clock on Saturday morning. From the station he went directly to the Zoological Gardens and took part in the pleasant breakfast, which the Council of Officers of the Zoological Society, with some invited guests, had there every Saturday morning. He was noted for his humor, and his presence at these breakfasts was always appreciated, because in spite of his advancing years he was sure to add to the pleasure of the occasion. His friends feared that his parliamentary career might prove a serious drawback to his health at his time of life, and their fears were not without foundation. He suffered severely from gout, which left its marks upon his feet and made it very difficult for him to walk for a time, and maimed him for all his afterlife. Though a man who had worked very hard all his life, and who, at the age of 70, practically took up another career, that of politics, Sir Dominick lived to be nearly 80 years of age, thus illustrating the old aphorism that it is not work but worry that kills, and furnishing another example of the fact that great men are great also in their superabundant vitality, and are able to spend their lives in the hardest kind of work, yet, barring accident, live on to an age beyond even that which is considered the average term of human existence. Few men have had happier lives than Corrigan, if the high esteem of contemporaries can ever confer happiness. There was no honor in the gift of his Dublin professional brethren or of scientific bodies in which he was interested, which was not conferred upon him. He was the president of the Royal Zoological Society, the president of the Dublin Pathological Society, of which he was one of the founders, and the first president of the Dublin Pharmaceutical Society. When not yet 50 years of age, he was made physician in ordinary to the Queen in Ireland, and had the unapproached record of 5 elections to the presidency of the King and Queen's College of Physicians in Dublin, more than enough to make up for the one serious setback in his medical career, his blackballing by the college only a few years before. Foreign medical societies invited him to honorary membership, and foreign universities conferred many degrees on him. It is easy to understand, then, that his death was followed by tributes of the loftiest character to his professional work, to his standing as an influential member of the community, and as a man of the highest intelligence and thoroughly conservative patriotism. The London Lancet said in its obituary, "By the death of Sir Dominic Corrigan, the medical profession loses one of its most conspicuous members, the University at Edinburgh one of its most illustrious graduates, and the Irish race one of its finest specimens." Though a perfect Irishman, Sir Dominic was as much at home in London, and though a sincere Catholic in religion, he had too much humor and too much humanity in its constitution to be a bigot. It were well for Ireland if all her public men displayed so much moderation, sense, and good humor as Sir Dominic habitually displayed in dealing with difficult and delicate questions. About the same time, the British Medical Journal said, after calling attention to the distinguished contemporaries with whom Corrigan had been associated, that he was haud minimus inter magnos, not the least among the great ones. Indeed, his biographer added, in originality of conception which, confirmed by later and independent observation, is the true test of genius, in a correct appreciation of the operation of natural laws, in producing and modifying the phenomena of disease, in a rare aptitude for testing his hypotheses by actual experience, and in a forcible exposition of them, he probably had no equal among his contemporaries. In the midst of all his honors and political influence, including association with the highest English officials in Ireland, Sir Dominic Corrigan had remained a consistent and faithful Catholic. Educated at Maynooth as a boy, he was proud to remain the physician to the college during many of the busiest years of his life, when he must have often found it very difficult to spare the time to fulfill the duties attached to the position. He was the consultant physician till the end of his life. He is not even yet, after a quarter of a century, forgotten by the poor of Dublin, who recall his kindly help in affliction and his generous aid, often given in ways that would be arranged with studied care so as not to hurt delicate Irish susceptibilities. The Irish School of Medicine has in Graves and Stokes and Corrigan a greater group of contemporaries than has been given to any other nation at one time. If we were to eliminate from 19th century medicine all the inspiration derived from their work, there would be much of value lacking from the history of medical progress. These men were deeply imbued with the professional side of their work as physicians, and were not, in any sense of the word, money-makers. Another very interesting phase in all their careers is that no one of them occupied himself exclusively with medical studies. All of them had hobbies followed faithfully and successfully together with medicine, and all of them were deeply interested in the uplifting of the medical profession, especially in securing the rights of its members and saving poor sick people from exploitation by quacks and charlatans. All of them gave of their time, their most precious possession, for the political and social interests of their fellow men, and felt in so doing that they were only accomplishing their duty in helping their generation to solve the problem that lay immediately before it. End of section 17.
Section 18 of Makers of Modern Medicine. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Makers of Modern Medicine by James Joseph Walsh. Johann Müller, father of German medicine. Germany has come to occupy so large a place in progressive medicine during the last half-century that it is rather hard to conceive of a time when the Teutonic race was not the head and front of modern medical progress. The leadership that had existed in Italy for over 5 centuries only passed to Germany at the beginning of the 19th century. The first great leader in German medical thought was Johann Müller, and to the wonderful group of students that gathered around him, German medicine owes the initiative which gradually forced it into the prominent place it still holds in the world of medicine. The great institutions of learning that have since come in Germany did not exist with anything like their modern systematic arrangement when Müller began his work. It was the marvelous influence of the man as a teacher, and not the scientific aids afforded by institutional methods, that brought forth the great generation of teachers which followed immediately on Müller's footsteps. Nowhere more than in the life of Müller can it be recognized with absolute certainty that the system and the institution count for little in education, as compared to the man and his methods. The keynote of Müller's career, even more than what he did for biology, and for all the biological sciences related to medicine, is the wonderful conservationism of thought which characterizes his scientific conclusions, while at the same time he began the application of the experimental methods to medicine as they had never been applied before. At a time when physiologists, because of Wöhler's recent discoveries of the possibility of the artificial manufacture of urea, might easily have been led to the thought that life counted for little in the scheme of the universe, Müller continued to teach consistently that vital energy may direct chemical or physical forces, but must not be confounded with them. It looked as if in the development of the chemistry of the carbon compounds, all of which are the result of life action, that materialistic views must be expected to prevail. Müller insisted, however, that life ever remains the guiding principle which rules and coordinates all the physical and chemical forces at play within living organisms, and that the vital principle is entirely independent of these forces so closely attached to matter. All Müller's disciples, and they were the representative biological scientists in Germany during the 19th century, followed closely in his footsteps in this matter, and the result was a conservationism of thought in biology in Germany that is the more surprising when we realize how much German philosophers in their systems emphasized the necessity for absolute independence from all previous systems of philosophical speculation. It is so much more interesting, then, to find what was the method of education that made of Johann Müller so conservative a thinker, while not injuring his genius for experimental observations. The influences that were at work in his earlier years were evidently those that made him subsequently the bulwark against materialistic tendencies in biology, and yet did not impair his originality. His early education was obtained under influences that are usually considered to be distinctly harmful to independence of thought, and yet they seem to have helped him to the fulfillment of his destiny as a great thinker and investigator. Müller is undoubtedly one of the very great men of modern science, and is the recognized founder of the system and methods of investigation which have given German medicine its present prominence and prestige. In recent years, there have been many tributes to Müller, because as Virchow's teacher, it was considered that some of the praise for the work done by Virchow must naturally reflect on the man to whom the great German pathologist acknowledged that he owed so much of his inspiration and his training in methods of investigation. Virchow's death, too, very naturally led to the recall of what had been accomplished in German medicine during the 19th century. And for much of this, Johann Müller must be considered at least indirectly responsible, since to him so many of the great German medical scientists owed their early training. These men, all of them, did not hesitate to attribute the progress of German medicine to the methods introduced by Müller. At the beginning of the 20th century, something of the estimation in which he was held in a land far distant from the German fatherland may be gathered from the following tribute paid to him in a recent meeting of the Medical Society of the State of New York by Dr. C.A.L. Reed of Cincinnati, former president of the American Medical Association. In the midst of his panegyric of Virchow, Dr. Reed described in some detail the medical faculty of Berlin at the time when Virchow was beginning his work as a student at that university. He said, "In the faculty there were Dieffenbach, the foremost surgeon of his day, Schönlein, the great physician who had come from Zurich the same year to join, not only the teaching body, but to act as a reporting counselor for the ministry and to serve as physician in ordinary to the king. Fourier, who was in charge of the Pathological Institute, Kaspar, who was also medical counselor, with a seat in the Special Deputation for Medical Affairs in the Ministry, but towering above them all was the intellectual figure of Johann Müller, the professor of physiology. He was an original genius with daring, actually engaged in winnowing the wheat of demonstrated truth from the prevailing chaff of egoistic opinion which divorced physical science from speculative philosophy. Prompted by the inspiration which he had derived in turn from Bichat and the French school, the professor of physiology was busily retesting in the laboratory truths previously elaborated by Haller, Wheat, Spallanzani, Cullen, Prochaska, John Hunter, the Bells, Morgagni, Berzelius, and Bichat himself. This is the tribute to Johann Müller, nearly 50 years after his death. That of Virchow, at his Obsequies in Berlin, is even more enthusiastic. Virchow then, at the age of 37, at the height of his powers, already acknowledged the greatest of living pathologists, just recalled to Berlin to become professor of pathology in the university which he had left more or less in disgrace because of his political opinions, could not say too much of the teacher whom he respected and honored so highly, and whose inspiration he felt stood for so much in his own career. He said, "My feeble powers have been invoked to honor this great man whom we all, representatives of the great medical family, teachers and taught, practitioners and investigators, mutually lament, and whose memory is still so vividly with us. Neither cares by day nor labors by night can efface from our mind the sorrow which we feel for his loss. If the will made the deed, how gladly would I attempt the hopeless task of proper appreciation. Few have been privileged, like myself, to have this great master beside them in every stage of development. It was his hand which guided my first steps as a medical student. His words proclaimed my doctorate, and from that spot, whence now his cold image looks down upon us, his kindly eyes beamed warmly upon me, as I delivered my first public lecture as privat docent under his deanship. And, in after years, I was the one out of the large number of his pupils who, by his own choice, was selected to sit beside him within the narrow circle of the faculty. But how can one tongue adequately praise a man who presided over the whole domain of the science of natural life? Or how can one's tongue depict the mastermind, which extended the limits of his great kingdom until it became too large for his own undivided government? Is it possible in a few short minutes to sketch the history of a conqueror who, in restless campaigns, through more than one generation, only made use of each new victory as a standpoint whereon he might set his feet and boldly look out for fresh triumphs? Yet such is the task to which we are called. We have to inquire what it was that raised Müller to so high a place in the estimation of his contemporaries, by what magic it was that envy became dumb before him, and by what mysterious means he contrived to enchain to himself the hearts of beginners and to keep them captive through many long years. Some have said, and not without reason, that there was something supernatural about Müller, that his whole appearance bore the stamp of the uncommon, that this commanding influence did not wholly depend on his extraordinary original endowments is certain, from what we know of the history of his mental greatness. Virchow's tribute could not well be more enthusiastic or more ample. His appreciation has been the standard for all other medical opinions of the man. How much Müller is honored at the present time in Germany can be best appreciated from the number of times that his name is mentioned with respect, and often with laudation in the proceedings of German medical societies. Scarcely a meeting passes in which more than once Johann Müller is not referred to as the founder of the scientific method in medicine, which has given Germany her present position in the very forefront of medical scientific progress. It is a common expression, said half in jest, it is true, but surely more than half in earnest, that the proceedings of no medical society would be really successful within the bounds of the German fatherland unless they were hallowed by an invocation of the great name of Johann Müller, the revered patron of modern German medicine. This is no witticism by exaggeration, after the American fashion, but a sincere Teutonic expression of feeling that occupies German medical minds with regard to the man who founded the most progressive school of modern medicine, and in doing so brought honor to his native country. Johann Müller was born at Koblenz on July 14, 1801. About 6 months before, the Emperor of Austria, by the Treaty of Lunéville, signed February 9, 1801, ceded to the French Republic all the Austrian possessions on the left bank of the Rhine. The electors of Treves, who were archbishops and reigning princes, and who had resided for centuries at Koblenz, by this treaty disappeared forever from the list of German rulers. When Johann Müller was born, French prefects of the departments of the Rhine and Moselle took up their residence in the old town which had been, since the beginning of the French Revolution, a favorite dwelling place for the French nobility driven from their homes by fear of persecution. Müller's father was a shoemaker and lived in a small house in the street of the Jesuits, so called because the fathers had had a school in it for many years. Johann was not destined to receive his education from the Jesuits, however, for the order had been suppressed nearly 30 years before his birth, and did not re-establish itself in the Rhineland for many years afterward. The circumstances of the Müller family were not such as to encourage hopes of a broad education, though his father seems to have taken every possible means to secure as much school training as could be obtained for his son. The early death of his father promised to deprive Müller of whatever advantages might have accrued from family sacrifices, but his mother was one of these wonderful women who somehow succeeded in raising their families well and affording their children an education in spite of untoward circumstances. Johann was the eldest of 5 children, with 2 sisters. He was very proud himself of the fact that while he took from his father a large, strong, healthy frame and a dignified carriage, he had his mother's skill for putting things in order, her constancy of enterprise, and her tireless faculty for hard work. After his father's death, his mother's energy and good sense enabled her to carry on the business established by the elder Müller by means of assistance, and as Koblenz was the center of a district that during the Napoleonic Wars was constantly overrun with soldiery, the shoemaking trade was profitable. Johann seems to have learned the trade, but his mother succeeded in enabling him to begin his education seriously at the age of 11 or 12. About this time, Joseph Goeritz, who was afterward the great leader of Catholic thought in Germany, and after whom is named the famous Goeritz-Gesellschaft, which stands for so much in German Catholic life and progress, was a professor in the Grundschule, or secondary school, in Koblenz, and had recently published treatises on natural philosophy with special reference to physiology. Müller entered this school in 1810, and Goeritz did not resign his professorship until 1814, when, owing to the publication of a political work, he was obliged to flee from the country. It is not known how much influence Goeritz exercised over young Müller, but some at least of his precious love for the natural sciences, which even in his student days led to the making of natural collections of various kinds, seems to have been imbibed under the influence of the philosopher-physiologist. The touching of the orbits of the 2 men, who were destined, more than any of their fellow citizens of Koblenz, to influence Germany's future, must always remain an interesting consideration in the lives of both. Johann's parents were, as might have been expected, down in the old Catholic Rhineland in the capital of the spiritual principality of Treves, faithful members of the Roman Catholic Church. Very early in life, Johann conceived the wish to become a priest. His mother, rejoiced at her son's idea, was ready to make every possible sacrifice to secure his education. It was with the intention of education for the priesthood, then, that Johann entered the Schulenschule an old college of the Jesuits, in which Jesuit tradition and methods of education still survived, and in which some of the old Jesuit pupils seem still to have held positions even during Müller's time as a student, 1810 to 1817. It would appear probable that because of the traditions of Jesuit teachings that held over at the School of Koblenz, and perhaps too because of the presence of some of the old masters and teachers trained by them, Müller knew the ancient languages so well. He made his own translations of Plato and Aristotle, and consulted the latter especially always in the original, and had a lifelong reverence for the great Greek philosophic naturalist work. Latin he used so well as to speak it readily, and practice in the disputations of the University at Bonn made the language still more familiar to him. It was said that he wrote Latin better than German. After the fall of Napoleon, the Prussian government took up the reorganization of the schools in this part of the Rhineland, and Müller became more interested in scientific studies. At this time, he became devoted to mathematics, to which he studied under the old pupil of Pestalozzi, Professor Lutzinger, to whom Müller, in the sketch of his life prefixed to his thesis at the university, expressed the feeling that he owed a special debt of gratitude. During his school days, Müller became a collector, as we have said, of natural objects. He was especially interested in butterflies for a time, and collected all the species in the country around. He had a curious dislike for spiders, which remained with him all his life. He was able to overcome this, however, and made important studies of that insect's eyes, and of its changing expressions under the influence of fear or when about to fall upon its prey. His feeling with regard to the insect is an index of a certain feminine quality of mind that had a characteristic expression in later life in his dislike for vivisection. He cannot bring himself to the conclusion that animals must be sacrificed in the midst of horrible pain unless there is some very definite scientific point to be determined, and unless every precaution was taken to avoid inflicting needless suffering. Even then, he preferred that others should do this work, and more than once took occasion to point out the fallacy of physiological observations founded on animal experimentation under such anomalous circumstances, and insisted that very frequently the results gave conclusions only by analogy and not by any strict logic of animal similarity or absolute physiological nexus. In a sketch of Müller's life by Professor Bruck of Vienna, himself one of the most distinguished physiologists of the 19th century, to whom the University of Vienna has paid the tribute of a marble bust and tablet in its courtyard, the great Austrian physiologist sums up very well the reasons for Müller's fame. Professor Bruck's tribute may be found in the Medical Times and Gazette of London, July 17, 1858. If we inquire, he says, what were the circumstances to which Müller, independently of his high intellectual endowment, his gigantic power for work, the energy and massiveness of his character, and his active and vigorous bodily constitution, owed the commanding position he incontestably held among men of science in our day, we must admit that before all things this was due to the breadth and depth of the foundations upon which his intellectual cultivation had been built. Professor Bruck then dilates on the variety of scientific interests which occupied Müller's earlier years, and the thoroughness with which he accomplished everything that he set himself to. End of section 18.